meeting back again. It's 1:30. There is an item 37 that has been asked to be postponed. So we're going to take that motion off the, off the agenda right now, just so for the sake of anybody that might be listening or in the audience for that particular item. So I'm going to recognize Commissioner Lockhart, please.
Sure. Commissioners, I'd like to make a motion that we, well, maybe I'll just read it exactly as it's written. There's letters and numbers involved. Based on Seminole County Administrative Code Appendix A, Section 2.85, the applicant's representative has timely filed in writing a written request for a continuance with justification that the applicant's representative or consultant is scheduled to be out of town and will not be able to attend the meeting. Is there, so this is a motion to continue the item to May 11th at 1:30.
So moved.
Second.
Okay. Fine. Motion seconded. Any discussion? All in favor say aye. Aye. Opposed? Okay, so that item is on May 11th at 1:30. So everybody has that, and anybody that's interested in that specific thing knows that now. Okay. Now that I've reconvened that meeting, as a reminder, this meeting is being viewed at the BCC Chambers on SGTV, on YouTube, and by registering to participate in the Zoom webinar. Residents can provide public comment in person or by registering to speak on the Seminole County website and the Board of County Commissioners webpage. There you will find a link to register for the webinar entitled Meeting/Webinar Registration and Helpful Hints. If you are unable to join via computer online, interested parties should call 407-665-0808. I don't know why we do it now, because if they don't know it now, they're not going to get on if they can't watch it. For additional information on how to participate via telephone, we will take public comment on each item as it appears on the agenda. In order to be recognized to speak, using a computer or iPad, you will need to use the raise hand feature, or if calling, you will need to press *9. First item is consideration rescinding Section 3 and 4 of Seminole County Executive Order 2020-030 regarding COVID-19 and the use of facial coverings. Item 31 is considering rescinding that section, and what we're going to do is we're going to have an update of the COVID-19 and the executive order. Nicole, our County Manager, Nicole Guillet.
We've got Alan Harris.
Mr. Chairman,
Yes.
if I may have a little latitude, please. I know we've got a lot of folks here on this topic. First, I want to say I agree with my fellow Commissioner Lockhart, who pushed to have this hearing brought before this board. To an extent, we can all agree that the CDC has been wrong on many recommendations, yet correct on others. We can all agree nobody enjoys wearing a mask. There's ample evidence that facial coverings do make some difference, even if it only saves a single life. That said, we should not adopt an arbitrary date, nor should we set some nebulous goal into the future, as the CDC has failed to even consider such. So, Mr. Chairman, I make and move a motion that Section 3 and 4 of the current executive order be amended to state the following: that this body shall revisit this issue every 30 days or every second BCC meeting of every month. The facial covering order shall be removed once 50% of the county's eligible population has been vaccinated and there has been 30 days of declining community. Hey, excuse me.
Please.
Show some respect.
Hey, Jay.
Eligible population as vaccinated has been 30 days of declining community transmission or sooner, should the Seminole County medical community and subject experts as represented here today recommend appropriate to do so.
Mr. Chairman, I'll second that motion.
There's a motion and a second. Before we take debate, we will listen to all the citizens that are here today that have asked to speak, and we will listen to the individuals that are here. Mr. Alan Harris, I believe you are, the county manager has asked that you speak. I cannot.
Mr. Chairman?
Oh, he's on the, yes.
I would ask that be the first order of business. You have a motion and second on the floor once the public input is concluded.
With debate.
Understood.
Okay. Mr. Harris, you are recognized, sir.
Hello, Chairman. Can you hear me okay?
Yes, I can.
Thank you. Chairman, Commissioners, Alan Harris, Chief Administrator for the Office of Emergency Management. I have been asked to help provide an update on the current situation related to COVID. I'm going to do that through a series of medical professionals, as we do in all of our discussions weekly with those individuals, and I'm going to immediately turn it over to Donna Walsh, Director of the Florida Department of Health for Seminole County.
Thank you, Mr. Harris, and good afternoon, Chairman and Commissioners. Just as we often do, we'll provide an update to you on how Seminole County is doing with COVID-19 vaccine and addressing the severity of illness and hospitalization, even death. So we are making great progress. I'll start out with the positive. We are making great progress in vaccine coverage. We have to date been able to provide vaccine to our community members all across Seminole County, and 171,722 individuals have received at least one dose of COVID-19 vaccine, keeping in mind that two of the doses that are out there, two of the manufactured vaccine out there are two-dose series. That's Pfizer and Moderna. Pfizer 21 days apart, Moderna 28 days apart, and then Johnson & Johnson, which was just approved on Friday evening by the FDA and CDC to be made available again as a one-dose series. We have vaccinated about 43% of our eligible population, and that means 16 years of age and older. The Pfizer vaccine has been approved for 16 years of age and older. And we have vaccinated about 35% of our total population, keeping in mind that no vaccine has been approved for emergency use for anyone under the age of 16 yet. Our pediatric population in Seminole County is about 100,000. So you're looking at potentially 20% of our population where vaccine is just not available yet because it hasn't been approved. And we are seeing that about 38% of our white population has been vaccinated, about 19% of our black population, and 20% of our Hispanic population. In public health, and we work very closely with the county as well as our nonprofit and faith-based organizations to reach out to populations where there may be vaccine hesitancy, because this is one of the measures that we can do to protect our community and get back to some sense of normalcy sooner. So we're making great progress in this respect, but there's more to go, of course. We had seen over the last several weeks that we had seen some improvement in the number of cases reported. We had also seen some improvement in the hospitalizations and deaths. However, recently, within the last week or so, we have started to see that curve go upwards again. We have been through this response. We have seen the ebbs and flows as people congregate and gather together, and we completely understand that folks are tired. But we do see as people gather together for holidays, just as we did with the Christmas holidays and Thanksgiving holidays, again with spring break and Easter holidays, that there's more opportunity for this virus to spread. It's an opportunistic virus, and it spreads very easily when people are close together and unprotected. So our chief epidemiologist, Kevin Baker, will go into more detail with those statistics here in a moment. Currently, our hospitalizations are going up. We're joined today by several of our hospital partners that will talk to you about what they're seeing in the hospital setting. But we currently have 88 hospitalized here in Seminole County with COVID-19 complications. We also are seeing, unfortunately, an increase in our long-term care facilities of cases in residents as well as staff. So we're at 27 current residents positive and 8 staff. Again, staff being protected as well as residents, new admissions to our long-term care facilities are important because, as we've mentioned before, about 86% of our reported deaths here in Seminole County are in those 65 years of age and older. So across the nation, this is by far our most vulnerable population. And as we've expressed before, it doesn't mean that if you're not 65 and older, you're exempt from complications or death, because that's simply not so. I mean, we have unfortunately seen some very young young people succumb to this virus. The age group 65 and older make up about 11% of our cases. Currently, we're seeing the majority of our cases reported in the age group 15 to 44. I want to go through, and I know there's been questions asked, how do we determine when to relax the mitigation measures that have been recommended by our public health experts since the beginning of this response? And certainly the social distancing, the 6 feet or further apart, because this is a respiratory droplet spread virus, does help. We've seen that especially in our congregate settings, whether that's the school setting, a jail, the long-term care facilities. That certainly is a mitigating factor to the spread of this virus. We also know that wearing the facial coverings is protective. I think, as Dr. Husty will talk to you today, this is something that if you are a medical provider, that we're accustomed to doing each and every day. I'm a nurse by trade as well. It's just, something to keep the respiratory droplets from spreading, whether it's COVID, flu, or any other respiratory spread virus or bacteria. Interestingly enough, this past flu season, we've seen extremely low numbers of flu in our community. And, we certainly, one of the thoughts is that we have been using those protective
Ms.
measures
Walsh,
against.
Ms. Walsh,
Yes.
can you hold on 1 second? Ladies
Yes.
and gentlemen, I understand this is very sensitive to everybody. I really do. And we're going to give everybody the respect they deserve when they're up here at the podium, and we're going to listen to every single one of you before anything happens and our decision is made. But that means that you give the same respect to those that are speaking, whoever they may be. And I would appreciate that very much. Laughing at somebody or laughing at something is not acceptable. Booing is not acceptable. Cheering is not acceptable. I am sorry, but that's, we are facing, we want decorum. And I really would appreciate every single one of you respecting each and every one of you as we will to you. Thank you. Ms. Welsh.
Mr. Chairman?
Ms. Walsh, yes.
Point of order. Because this is a medical issue, anyone that speaks, I'd like to know about their medical background, certifications, or degrees that they may have.
Thank you. Again, please, everyone, thank you very much. Ms. Walsh, please, you're up. Continue.
Sure. And to address Commissioner Delari's question, I am a registered nurse. I'm also a public administrator with a master's degree from the University of Central Florida. I've been working in public health for over 34 years and worked in epidemiology for 14 of those 34 years. So just to give you a little bit of background, well-versed in public health preparedness, epidemiology, and public health. So if you look at this slide is from the Centers for Disease Control and Prevention, and this gives you a guide as to how the mitigation measures have been recommended. If you look at the sustained transmission, the minimal to moderate community transmission, which is very similar to what we're experiencing here in Seminole County, where we're seeing that there is sustained transmission, especially in those congregate settings, as I've mentioned before, and potential for rapid increase as we've seen the spikes, the ebbs and flows, if you will, that Kevin will show you and talk to you about here in Seminole County. There is definitely a potential for spread as we gather together. We've seen it multiple times now through this response. So with the moderate mitigation, that does include everything we've mentioned prior to. So Kevin, if you'd like to go to the next slide. So if you're looking at the epidemiology, and this is where we come from, is to protect the public health, and that's everyone in our community, not just few, but everyone. So if you're looking at the level of community transmission, if there is widespread transmission, as we're seeing evidence of and have been, more extensive mitigation is recommended. We're also looking at outbreaks. Kevin will talk to you about the numerous outbreaks that his team has conducted case investigations and contact tracing with. Also the severity of the disease. As I mentioned, our hospitalizations unfortunately are going up. This indicates that people are suffering more complications due to this disease, up to and including death. And also looking at the level of community transmission throughout. So I don't know if I can you advance to the next slide, Kevin? There we go. Some of the community characteristics, obviously, when looking at the CDC guidelines, these are recommended guidelines throughout the entire United States based on what we know about this virus. COVID-19 is what we consider a new and emerging virus. Certainly, we have had experience with coronaviruses in the past, SARS in 2003, 2004, and so, but nothing to the level or magnitude that we've experienced with COVID-19. This is similar, although it's a different virus, than the 1918 flu pandemic. This is a pandemic. It's affecting every country in this, globally. So that's why, we're looking at this as a global situation. However, every community has its uniqueness. So we look at the size of the community, the population density. We also look at the resources we have locally and whether or not we have enough resources to address those complications, those hospitalizations, and care for people appropriately, access to health care, looking at our vulnerable populations, as I mentioned before. Do people have difficulties getting into a doctor? Do they have health insurance? Is that a barrier? Can they get to the doctor through transportation? All of those things are factored in when decisions to protect our community come into play. You can go to Kevin. And then additional factors to consider for determining mitigation strategies, as mentioned before, our healthcare workforce. Not only our hospital capacity, do we have the healthcare workforce? So you may have adequate rooms in a hospital setting or ICU, but you may not have the workforce to care for the individuals who are suffering complications from the virus. Also, our testing, through this entire response, the county has been extremely supportive along with our community partners in providing adequate testing, because this is how we know how the virus is spreading in our community. Also, the availability of the personal protective equipment. Early on in this response, there were shortages. We, fortunately, are not experiencing that right now. We're also looking at our public health workforce and available resources. The federal government has been very supportive. We have hired upwards of 130 additional staff just at our health department alone, and we started with about 150 staff before this response. So it has taken almost double our staff in order to respond appropriately to protect the health of our community at large. We're also looking at our state, local government agencies and partners, and I think it goes unsaid that in our county we have a magnitude of support in this area. So with that, I'm going to turn it over to our Chief Epidemiologist, Kevin Baker. He can show you the detailed data that I just gave you a summary of, and then we can certainly take any questions afterwards if there are any. Thank you.
Ms. Walsh, thank you very much, but we're waiting for the next person, Ms. Bacon. Baker, I'm sorry. I see three hands, but Clint, is Mr. Baker on?
No, sir. Mr. Baker is on. I think he's just still muted.
Yeah, he is looking for his unmute as we speak. Okay.
Okay. All right. Can you hear me now?
Yes.
Okay. I apologize for the delay. All right. So good afternoon again, Chairman and Commissioners. Thank you for allowing us to speak again today on the COVID-19 data. So as you can see here in this slide, we are overall since the start of the year where we had the highest peak that we had in COVID-19 cases since the start of the pandemic. We have seen a substantial decrease in cases, which is fantastic. However, we have started seeing some slight increases in activity that we are keeping a very close eye on. And you can see that as time has gone on, we've gotten closer in line with roughly around the number of cases per 100,000 that's being seen in the state of Florida as a whole. So then looking at our COVID-19 test positivity rate as well as our cases per 100,000, you can see again that it kind of mimics the case counts that we have been seeing a decrease. However, that increase is occurring. Donna mentioned that we were over a 10% positivity rate for a while, and we had decreased around the beginning to middle of March. But unfortunately, in the month of April, we did see an increase above that 10% mark, which definitely is concerning for us in terms of doing case investigations and contact tracing. My teams of case investigators and contact tracers have absolutely felt the burden that this has brought on to them by seeing these steady increases in case and contact activity.
Mr. Chairman, can we ask our IT people to see if we can get Dr. Baker on the screen for the public? Aha. Thank you.
Okay, Mr. Baker, continue, please.
Okay.
Second from the
Absolutely.
top. There he goes.
All right. So, and then I wanted just to point out currently where our cases and deaths are when we look at by age group. So you can see that the highest impacted age groups that we're seeing currently in 2021 are among those 15 to 44, as Donna mentioned, which alone make up over half of our cases in Seminole County. And then also, as Donna mentioned, you can see that those age 65 and older also tend to make up across these three age groups here the majority of the deaths. However, we have had some deaths here in Seminole County in very young individuals, which can be avoided through the proper prevention measures, including vaccination, physical distancing, and wearing masks. So looking at our deaths and hospitalization specifically, because these are two ways that we do look at severity and magnitude of disease, we are seeing an increase, as Donna mentioned, in hospitalizations in Seminole County. And while we have been seeing less deaths in Seminole County, we do confirm deaths multiple times throughout every single week. I know there's been a lot of attention to whether or not deaths that are put here are considered actually COVID deaths, and I do want to assure everybody that these cases do undergo a review as we identify that someone has passed away. A thorough review is performed of each death to determine if that death is COVID-19 related or not. But unfortunately, we are still seeing some activity here moving in the direction that we do not want to see it move. So I talked about this table the last time I presented and wanted to provide an update in terms of 2021, where we currently stand. So again, you'll see that it follows that trend where toward the beginning of the year, over the course of 7 days, we had 358 new cases per 100,000 population over the course of the week of January 3rd. Since then, we've seen cases gradually decline up until around the end of March and beginning of April, where we did see a peak again in the 200s, which was concerning. And then last week, we had 166 cases per 100,000 over the course of the week of the 18th. So we are, again, seeing gradual decreases. However, since we know that this disease can take up to 14 days to manifest symptoms or to make someone test positive, unfortunately, 1 week of a decline is not something that we recommend, basing any decision-making on, as we know that it takes more time to see the effects of cases and the spread in our community. But we are certainly watching this, because as you can see here, since the month of January, and really even prior to that, really since about June or July of last year, we have consistently been in this high transmission level of COVID-19 activity, which is very concerning. We have not gotten even down to the substantial level since we reached the high transmission level. And so we are concerned that, again, even as cases continue to go down, still being 166 cases per 100,000 over the course of a week is a substantial spread. And it's also very, again, burdensome to the staffing that we've hired to be able to complete the case investigations and contact tracing activities. So while we see the decrease, we want to see sustained substantial decrease over time before making any decisions that could impact the provision of prevention measures in Seminole County. So just looking at long-term care facilities, we're very grateful to say that since the beginning of the year, we've seen much less activity in our long-term care facilities. However, again, we do still see some cases. Not every person in a long-term care facility, neither staff nor resident, not everyone is vaccinated. So again, those measures that are in place and will hopefully be in place in the future will continue to help prevent further transmission if COVID-19 were to be introduced in those facilities. About 47% of all COVID-19 deaths in Seminole County are associated with long-term care facilities. So I want to take a moment to talk about the variant cases that we've seen here in Seminole County. So to date, we have 162 variant cases that we have been identified. And I will reiterate, as I did last time, that not every case that is tested for COVID-19 undergoes what we call whole genome sequencing, which is the test that identifies whether or not someone is infected with a COVID-19 variant. And the reason for those that aren't aware that we're concerned about variant cases is because with variant cases, we can see increased transmissibility as well as increased severity of disease from those infected with variants. So as you can see right now, the B117 UK strain is predominantly impacting our community in terms of the variants. Other than that, the South Africa, both California and the Brazil strain so far have been reported in very low numbers in Seminole County. So I also wanted to highlight a little more on what Donna spoke about in terms of vaccination data. So in terms of our eligible population, we're at over 40% vaccinated, which is an outstanding achievement to both our public and private partners. So again, that's a 42.2% vaccination rate. However, when we do look at our total population, we're roughly about 1 in 3 people vaccinated. So when we do look at herd immunity, we do want to really look at our total population, which we know that roughly 20% are not going to be able to be vaccinated likely in 2021, and that is our under 16 population. So we are still wanting to work towards increasing that number. In this time, it's extremely important that we work with the community to address vaccine hesitancy, to discuss the scientific method for how vaccines are provided emergency use authorizations, and that we are providing a safe and effective vaccine. So I did just want to show our case counts versus our vaccination count. So you can see that we're seeing what we definitely want to see, and that is an increase in vaccinations and a decrease in cases. However, as I was mentioning with the variants earlier, in addition to when we talk about the increase in transmissibility, that certainly also involves the ability for the variants to potentially evade vaccine-induced immunity. So basically at that point, we just want to keep a very close eye on our case count as we continue to vaccinate to ensure that the vaccine is indeed continuing to drive down case counts. As we continue to see increases in COVID-19 variant transmission, that does give us an opportunity to see potential increases in cases if indeed those variants are able to, even to some degree, evade the vaccine-induced immunity. And I also wanted to take a moment to look at both public, which is Department of Health and Seminole County government, versus private partners that have been offering vaccines over the course of the last 4 or 5 months. So you can see, of course, that the Florida Department of Health and Seminole County government have, by leaps and bounds, taken the majority of the vaccination effort. And we have been very busy on a 6-day-a-week basis treating people vaccinated and making sure that we have vaccine available in all parts of Seminole County. However, we are happy to say that, as you can see in the last month or so, that the vaccines that have been offered per day by our non-DOH partners are starting to take an effect and are starting to even see more of those cases or vaccinations happening per day than by DOH. Of course, now that the Johnson & Johnson vaccine has been resumed, we are going to hopefully start seeing more vaccinations occurring and hopefully getting closer and closer to that goal of herd immunity. And so I just wanted to really quickly give a breakdown showing the vaccinations by age group in Seminole County. So we can see that right now for 2020, or since the start of the vaccination effort, that we have about the 35 to 44 and the 45 to 54 population. Those have about 18% and 16% of those respectively have gotten their first dose. And then 16.8% and about 25% have completed their vaccine series. So when we look at our total vaccinated by age group, we can see that our 65 and older population, given that they had started getting vaccines much earlier, we're having really great coverage among that population. And so now our biggest goal is to focus on the younger population that has clearly not had a high enough percentage of vaccinated to really start seeing the changes that we're wanting to see. But unfortunately, we don't have a crystal ball. We can't make the predictions as to what's going to happen, but we do anticipate that if we can get a large number of these populations vaccinated, these younger populations, that we're going to start seeing the change that we do want to see. Thank you.
Any questions? Seeing none.
Mr. Chairman?
Yes.
Can Mr. Baker just tell us what credentials he may have?
Yes, I'm sorry about that. My credentials, I have a master's of public health, and I have been practicing epidemiology and disease control for the last decade with the Florida Department of Health and the Centers for Disease Control and Prevention.
Thank you.
County Manager, anyone else?
Yes, Chairman.
Yes, Alan?
I have a number of individuals that I would like to invite to speak for a few moments. First, Dr. Benoit, and before I turn it over to Dr. Benoit and Trey Abishire. Trey Abishire is the Chief Executive Officer for the Hospital Corporation of America Central Florida Regional Hospital. But I just want to take an opportunity to thank Dr. Benoit. Dr. Benoit has been a partner with us for multiple years, has helped us in multitudes of different ways, from the beginning of COVID testing to the vaccination process and doing vaccine pods with Oviedo Medical Center and Central Florida Regional Hospital. Dr. Benoit, unfortunately, in 2 weeks will be leaving Seminole County and moving to Alachua County. He has received a position at North Florida Regional Hospital, so we will miss Dr. Benoit, and I just want to thank him for his partnership over the last multiple years. Dr. Benoit is a surgeon, a trauma surgeon, as well as the Chief Medical Officer for Central Florida Regional Hospital. Dr. Benoit, Trey.
Yes, thank you, Alan. I wish you would not have reminded me of that. I'm still fighting to keep him here as long as I possibly can.
Well, I hope you win. I hope you win on that, quite frankly.
That's not going to happen. He's taken a nice promotion. We're very proud of him and the great work he's done and will continue to do. But thanks for letting us join today, and I'll certainly pass it to Dr. Benoit, being our Chief Medical Officer as well as our subject matter expert for all things COVID, and he has been since we got into this global pandemic. But from a hospital perspective at Central Florida Regional Hospital, we've seen the ebbs and flows in our daily census, peaks of 51, lows of 9, and it's been up and down since that time. We still adhere to universal masking within the walls of the hospital, and we follow all CDC guidelines regardless of the changes. We stay very close to that as a hospital and as HA Healthcare, being the largest healthcare provider in the U.S. So I'll turn it over to Dr. Benoit to talk some specifics, and certainly we have our colleagues on the phone from South Seminole, as well as Advent Altamont Springs, who've been incredible partners during this journey that have joined us in this effort to battle this global pandemic.
Good afternoon. Thank you very much for those kind words, and it truly is a privilege every time I get a chance to speak to this board. I will miss the relationship and that I've had with Seminole County, and I hope always to stay in touch. I will say, given our numbers, so as Trey mentioned, within the hospital system, we saw a peak in cases in July. We saw another peak in December, and we expected to see a decrease happening now within March, April, and as we roll into May. But what we actually have seen, even a couple of weeks ago, we had half the number of cases that we had in July. So COVID-19 is not done with us yet. We are very happy to see the vaccinations that's occurring within the hospital system, as well as through the pharmacies and in the community. We do believe that vaccinations is a great mitigation strategy, especially for the variants that have been occurring. Research is coming out that the vaccines will probably cover these variants, so we're happy to see that. So the more that people can get the vaccines, we're much in favor of that. As Trey mentioned, we continue to do universal masking because we do believe in masking as a strong mitigation factor to decrease droplets and to decrease transmission. So within our hospital, we're still universal masking, but we do follow guidelines. And so you have a couple of people together who are vaccinated, then they need not wear a mask. But as far as the full widespread community, then masking is still a very important aspect in order to decrease the spread. The vaccines, we do know, have great efficacy and effectiveness, especially for mild disease, and 100% against very severe disease and death from COVID-19. So for that, we're in favor of making sure that our partners receive our vaccines. Our visitation remains limited within the hospital. That hasn't changed in months because the community spread still isn't where we would like to see it. We would love to see that community spread decrease, and that's really when we would talk about a date of removing masks. But for now, our recommendation is that masking still continue. And that's the end of my report, unless there are any questions. Thank you.
Any questions? Alan?
Yes.
Next.
Then next hospital, I'm just going to go from north to south. So I'd like to introduce Dr. Acumbrum from South Seminole Hospital, Orlando Health, and Sean Mulsberger, Senior Vice President of Orlando Health, South Seminole Hospital. They have been also an incredible partner throughout this entire experience. Dr. Acumbrum.
Thank you, Alan. Thank you for the kind introduction. And I'd like to thank the board for letting us speak. A brief introduction about myself. I have been a resident of Seminole County since 1994. Went to University of Illinois to study for a short bit and promptly came back to Seminole County. It's my home. Love it. And I have been practicing in Seminole County since 2001. Love it here. Great county to be in. I'm the Chief Quality Officer at South Seminole Hospital, part of Orlando Health. And we are seeing the same variations and slight increases that are being seen at the other hospitals. We have noticed that we had the peaks in July, in December. That was devastating. And as Donna mentioned, 50% of the deaths were in the elderly. It was heartbreaking for us to see that it was somebody's parent or grandparent or a spouse who had never been to the hospital before, came into the hospital for the first time in the last 2 to 3 years, and then passed away. Though the mortality is just a number for a lot of different people, it is somebody's spouse or a grandparent, or it could be their parent too. And that's very important to consider. After the peaks that we saw in July and December, we have started to see a slight uptick over the last few weeks. The cases now seem to be in the younger population, and we believe at Orlando Health that we will follow the CDC guidelines, will continue with the masking, and we do feel that the vaccination is the way to go to beat COVID at this point of time. At Orlando Health, the masking is ongoing and will continue to stay the course with regards to masking. Vaccination efforts are going on as usual and continue to stay the course with that too. So hopefully we will be able to beat this COVID together as a team, take collective decisions and thoughtful decisions for all the residents of Seminole County. Do you have any questions for me at this time?
Any questions?
Thank you.
Seeing none. Alan, next.
Sure. Next, I'd like to introduce Dr. Sinclair, Chief Medical Officer for Advent Health Altamont, Tim Cook, Chief Executive Officer for Advent Health Altamont, as well as Dr. Vincent Hsu, Infectious Disease and Prevention Physician, a specialist in infectious disease, specifically COVID. So very honored to have him with us today. He's a very busy individual, so I really appreciate all of y'all are very, very busy, but we haven't been able to get Dr. Hsu on before, so we're really excited to have him as well. So Dr. Sinclair, Dr. Hsu, I'm not sure which one of you wants to speak first, or Tim?
I'll speak first. It's Dr. Sinclair here. I'm the Chief Medical Officer at Altamont, and thank you, Alan, for the invitation today. I'm a board-certified anesthesiologist. I've been board-certified for 25 to 30 years and served as the Chief Safety and Quality Officer for the last 7 or 8 years at the University of Miami before transferring here to I also have a Master's of Business Administration from Florida Atlantic University, and I'm a fellow with the College of Healthcare Executives.
Doctor, I'm sorry, Doctor, I can hardly hear you.
Yeah.
Could you speak up into the mic a little bit better, please?
Does this help?
Yes, sir, thank you.
Yes. Okay, great, not a problem. I don't know if you want me to repeat my introduction, but I do not. I see a couple heads shaking. Let me just say that there's really 2 points that I want to make, and they're quite simply a continuation of what was already stated from our other hospitals here in the county. The first is that we at Altamont are experiencing an upward trend in the COVID hospitalization as well as severity. We've opened our second 36-bed COVID unit to accommodate our upwards of 50 COVID-positive patients here in-house. And our ICU admissions have gone up. We've gone from 0 admissions in our ICU 3 weeks ago to now 40 to 50% of our department census are COVID-positive patients. And for those of you that are aware or have heard of remdesivir, which is actually a medication that's approved by the Food and Drug Administration for management of severe COVID, it's currently indicated on about 50% of our COVID-positive patients. So this is actually a change or an uptick that we've experienced in the last numbers of weeks. The second point that I wanted to make is that we are concerned and cautious regarding the variants, which are increasing in number even here in Seminole County. We know that there's underreporting of the variants, and as a result, we continue to encourage and more than encourage, it's mandatory that our staff continue to wear masks while within the hospital in our various settings. We have seen and know that there are vaccine breakthroughs. Whether that's attributed entirely to variants is not 100%. We know that that's a component of it, and continue again to encourage mask wearing in the hospital setting. I would say that from the trends that we are seeing, that we continue to emphasize the vaccination rate as well as a 30-day trend or reduction in the positivity rate as markers for when we would even entertain the thought of rolling back some of the mask mandate that is currently in place. Thank you.
Thank you, Doctor. Alan?
Dr. Hsu?
Good afternoon. My name is Vincent Hsu. I am a board-certified infectious disease physician I trained at the CDC for 3 years in epidemiology. I'm a master public health and continue to see and treat patients even during the pandemic. I do support the guidance that CDC provides. We do understand that when they issue guidance, it is not necessarily a one-size-fits-all. We do understand that mistakes have been made, but we're continually learning about this disease. And so we're continually adapting to what is going on in the community. I am concerned about the most recent trends that we had been seeing with this potential fourth wave over the last few weeks, but I am a little bit heartened that we are seeing an encouraging trend, at least over the last few days. And a few days does not a long-term trend make. But I believe that because we have vaccinated a greater proportion of the community, that is going to make a difference. The more people in Seminole County that are vaccinated, the lower the risk of transmission, especially when we are adhering to mask wearing and social distancing. And if we continue to do that for a defined period of time, I believe we will be able to continue to see the decreases in transmission in new cases. We do have to look at the data and the trends. We've got to look at the multiple metrics, includes hospitalizations, new cases, percent positives. A variety of metrics are needed to help us make that decision. But if we are able to see a sustained decrease trend in some of these metrics, I would suggest that then we could periodically look at that and then come to a decision about what to do about community mask wearing edicts. It is a difficult decision to know where to draw the line. I recognize that the board and the commissioners have a very difficult task. I do not believe that now is the right time. We do need to continue looking at the data, but if we do see a continued sustained downward trend in many of these metrics, I do believe that at some point, hopefully soon, we can make that decision about what to do about mask wearing, but we're not there quite yet. I'll stop right there. Thank you.
Thank you very much, sir. Alan?
Thank you, Dr. Shu. I'm going to let our surgeon, chief medical officers, CEOs all go. Thank you all so much for participating. The last person I'd like to introduce is obviously someone that does not need to be introduced, the county's medical director, Dr. Todd Husty.
Well, thank you very much for that. And thank you all for participating, Dr. Sue, Dr. Sinclair. I'm so sorry to hear you going, Dr. Benoit. But good luck in your endeavors. I'm Dr. Todd Hussey. I'm a DO, not an MD. I wanted to be a DO because we believed in holistic medicine, and I was a bit of a hippie a long time ago. But from there, I moved forward and ended up in the Navy and became a board-certified emergency physician, and did that for 35 years, working in emergency departments, running emergency departments, and getting involved in EMS. During that time, I did have a little stint on TV, which was very interesting. I actually got to work with the CDC fairly closely when they rolled out the chickenpox vaccine. We had worked with the CDC previously, and they liked our reporting because it went national. And when they wanted to roll out the chickenpox vaccine, they actually came to Orlando and gave us kind of first shot at it so that we could roll out a national story. They recognize that I am a vaccine fan because I grew up in a time when lots of people and lots of kids suffered from childhood illnesses, mainly viruses, most of them respiratory. And I even took care of some of those people in my older years when I was a respiratory therapist. But when I grew up, we started vaccinating people a lot. The greatest, as the CDC will tell you, the greatest improvement in healthcare in the 20th century was vaccines. It was getting rid of, and at least decreasing the impact of some of these childhood viruses on the kids, on pregnant women, on their offspring, etc. So vaccines really, we've forgotten how important they are. I know people are thinking that they're important. Oh yeah, we all agree that vaccines are important, but they really, unless you lived at that time, you might not have a true appreciation for how important vaccines are to this day. I know the physicians I'm sure understand it, even if they're younger. I think we all have a great appreciation for vaccines. So I think we're very blessed to have the vaccines available. I wanted to make a couple of points, though, about this pandemic. The first point is that we still have a pandemic. I don't care what anybody says, and I would challenge anybody to, by any measure, to say that this is not still a pandemic. A pandemic is a little hard to fathom. We haven't had one in our lifetimes. Unless you're over 100 years old, you have not been through a pandemic, not like this. So, and we still have a pandemic, clearly, by all measures. Next point, vaccines are important. I just made that point. Vaccines are, and the other physicians that were on, the other experts feel that vaccines are extremely important. How do I know they're important besides history? Is that, well, I've done my fellowship in COVID over the last year. I go on conference calls weekly, multiple times weekly, with experts all over Florida, experts around the United States, even internationally. I will say that I have learned an awful lot, and I keep having I keep getting real good reality checks with people who work with viruses in virology, and they will tell us all how important vaccines are. We need to get the population vaccinated as much as possible. I know that we've had some hesitancy. I think some of that hesitancy, and it was actually told to us at one of the hospital systems that they went around with a cart into their shifts at the hospital. And hesitancy just means that I'm hesitant, and it's also inconvenient. So they went around with a cart and actually offered vaccines to people at work and got 100 more workers to get vaccinated. I think we're going to have to keep pushing in that direction. We do a lot of that in Seminole County. We might even have to do more. But we need to get lots and lots of people vaccinated. The other point that I wanted to make sure that we discuss is that, as was stated by the other experts, masks are very important in this disease and in stopping the transmission of this disease. You know, the bottom line is what our goal is. Do we have a goal? Our goal is stopping and greatly reducing the transmission of this disease. We have ways of doing it. We know that people who are right in each other's faces probably transmit this disease. So despite studies that talk about that social distancing may not make as much of a difference, you know what? We know that when you're right in each other's faces and it's a respiratory virus, that you're going to transmit the disease. There's no two ways about that. So social distancing is important. It's maybe not as important as the next one, masking. So we know what we can do to stop the transmission of this disease, which is masking. And then there's vaccines. So, I mean, it's really kind of simple. We need to believe in this. We need to believe that we still have a pandemic, because we do. We need to know that we have mitigation strategies that work, because they do. And we know that when we stop following those, we have an increase in transmission of the disease, which we have and we will continue to do. Just checking my notes. It's interesting because I wanted to make sure that I knew what I wanted to say, and I wanted to hear what the other doctors were saying, and my notes are about gone because the other docs, the other experts covered it all. I mean, I'm not sure I can add anything to the fact that all of our healthcare systems are clearly behind continuing with CDC guidelines. maybe I should point out that I'm really looking forward to the CDC examining and giving us more guidelines as to what to do. Dr. Chu said that we've been learning a lot about this. We might have even made, some people in some places made some not the best decisions at one time or another. I think, and we know what some of those were. I think Seminole County actually stayed pretty well grounded and tried not to make some bad decisions, and I think we were pretty darn good at it. Point is that we're still learning about the disease. It does change what we know about it, and coming up with the right guidelines. I mean, let's think about it, is that if we choose badly, I want to know, I want some facts to tell me that changing drastically, changing anything drastically, will be safe for the citizens of Seminole County. I know what we're doing is safe, and I know that the numbers are still going up. So I do agree that we should have numbers that are decreasing over a good period of time, not just temporarily, but over a good period of time. And we need to have our vaccination levels up. What we don't know is how many people in the community are immune. That's it's a really, really hard number to figure out. But we can watch other countries like Israel who have high vaccination rates. We can watch other places and get some idea as to how much immunity may be out there and when is it getting safe. And if we combine that with metrics like how many people are the transmission of the disease, how much is being transmitted still, or how much is coming down, that's when we really get to talk about this. Until then, it's a little bit like, I hate to say it, and I'm not trying to make light of anybody that has strong opinions about this. I understand we're all darn tired of this. But, it's a little bit like, are we there yet? Are we there yet? Are we there yet? And no, we're not there yet. You've heard it from other people, from other experts, and I'd like to weigh in that we are not there yet. Golly, I can't wait until we are. My goal is to get away from this thing, and all of us to get away from it, but we are not there yet. Thank you.
Mr. Harris, is there anyone else?
That's it. Thank you, Chairman.
Mr. Harris, on whatever side of the issue that you're on, I think that all of us owe you and all of those that work with you at Emergency Preparedness and the Department of Health and everything, a real thank you. We've done it many times here up at the podium. This is over 400 days now that you all have been on alert, and I know how hard that you have worked, especially in all throughout this. But I think I have heard nothing but universal applause when it came to you all distributing the vaccine at the Oviedo Mall. So I just want to tell you all thank you very much, and I think I can't speak for the others, but I think they share my opinion in that. So thank you very much to you and to all.
Thank you. We have an incredible team, incredible partnership between the Department of Health and Emergency Management and Fire and EMS. So thank you very much.
Thank you. County Manager, do you have anything else before I open it to the public?
No, sir.
All right, thank you. All right, ladies and gentlemen, I have a number of public comment forms, nearly 50. I will tell you that if you do not recall, that each will get there are 3 minutes. When you come up to the podium, please state your name and address for the record, and then we will start the 3-minute clock. I will read a portion of some of these public comments that do not want to speak publicly but wrote out their comment forms and move them rather quickly. We do have a number of them also. And thank you very much for your attentiveness and for your decorum. After the discussion, you all, acted. Thank you. I just wanted to let you know, giving those people the opportunity to speak, and I and my colleagues will do the same for you as you speak. I will allow any questions by any commissioner of any of you that they wish to ask. So I just want you to know that that is part of this. And that will not be part of your 3 minutes, and it will be after you have finished. I'm going to read all of these comments now. And the other thing is, I'm going to put 31 and 32 together. Quite frankly, I can't figure out who's here for 31 or 32. Some of them put 31 and 32. I think all of this is about the masks and the two things in front of us, so I'm just going to do them all at one time. I hope everybody appreciates that. First, we have Kristen Siege, and she says, please take the masks off our children. Jen Ferguson, just in opposition, I believe, to the masks, if I'm not mistaken. We have a no-name person who opposes. Please remove the masks. They do not work. They are doing more harm. We need to be able to see people's faces. Tess Beck, and the baseless and tyrannical mask mandate. Mr. Dan Seacole, and please forgive me if I mess up your names, but it's my fault. Face masks should only be used by those who want to use them. I don't know the first name because it was written, but Bello, B-E-L-L-O. Face masks should be an option. Dan Seacole, rescind section 3 and 4 immediately. Mary Kavanaugh, I believe, but does not, just says, I am in support of 31. Sandra McDonald, I am a nurse at ORMC. Masks are causing more harm than they are helping.
That's right. That's right.
Ladies and gentlemen, please. Thank you. Chantel Rivera, just in opposition of 31 and 32. I don't know what, I think she probably means that she's in opposition of 32 and in favor of 31. Brooke Harrison, now that there are options for everyone to feel safe and secure and vaccines are available for everyone who wants them, the mask mandate needs to be removed. Lisa Hurston, I lost my business of 15 years due to COVID mandates. There is zero evidence masks prevent COVID or other viruses. Aaron Siedleck, no more masks. Marjorie Murphy, I'm here only to say the mask should be voluntary and mandates should be rescinded. Debbie Smith, I support supporting making a decision on indoor mask mandates based on data and overall community progress in reducing infection and vaccines. Did anybody that did that feel that I did not say their sentiments correctly? Okay, thank you. Now, we're going to go to public forum comments. For those of you that waited to give them to me last, I'm going to shuffle them. So everybody will have the opportunity, and nobody knows who's going to go first, second, third, or last. So, first person, Frank Hunt. Mr. Hunt.
My name is Frank Hunt. My address is 3622 East Lena Lane, Apopka, Florida. These remarks are from a video titled The Plandemic by Dr. Judy Mikovits and her book, The Plague of Corruption. Dr. Mikovits is called one of the most accomplished scientists of her generation Her job was to develop vaccines as immune therapy. She is not anti-vaccine. Her 1991 doctoral thesis revolutionized the treatment of HIV/AIDS. At the height of her career, she published an article in the Journal of Science that sent shockwaves to the scientific community as she revealed that the use of animal and human vital tissues were unleashing devastating plagues of chronic diseases. For exposing their secrets, the minions of Big Pharma and our federal government waged war against her, destroying her career, her reputation, her life. In the 1980s, she was involved in research to isolate the HIV virus. Her work was held up for 2 years by Tony Fauci and Robert Redfield, the now director of the CDC and the heads of the Department of HHS. Why did they hold it up? In a conflict of interest to the Bayh-Dole Act, they were in a position to make big money from the patents of the drugs and therapies developed, which according to Dr. Mikovits were therapies that killed people and did not make them better. Also, the delay of several years caused the deaths of millions of people from AIDS. The African people lost a whole generation through Fauci's and Redfield's actions. Tony Fauci then orchestrated the cover-up of this. Now they're at it again. Through their efforts, the AMA shut down the use of hydroxychloroquine and zinc as a treatment for COVID because the dosage was only $5, and Big Pharma, Tony Fauci, Robert Redfield, and Bill Gates could not make any money off of it. According to 70% of doctors, this is the most effective treatment of COVID. By the way, according to his 2020 tax returns, Tony Fauci made $9 million last year. I don't think it all came from his salary. Because the CDC counted people dying with COVID and not from COVID, the death toll from COVID has been estimated to be about 3 to 4% of what was reported as the U.S. death toll. As of today, according to the New York Times, the current death toll in the U.S. from COVID is over 572,000. However, 3% of that number is 17,000. The typical death toll in the U.S. in a year from the flu is between 20,000 to 50,000. Now we are supposed to follow CDC's guidelines on masks and sheltering in place and social distancing, which I call unsocial distancing. According to Dr. Mikovits and other doctors, they have no vested economic interest in promoting vaccine and CDC guidelines. Social distancing and wearing masks are the opposite of what we should be doing. In Georgetown University speech in January 2017, Tony Fauci said, quote, "The topic today is the issue of pandemic preparedness, and if there's one message I want to leave with you today is that there is no question there will be a surprise outbreak." At the end of the speech, he concluded, "The thing that we are extraordinarily confident about is that we're going to see this in the next few years." As a footnote, Tony Fauci's NIH gave $3.7 million to the Wuhan lab for their work on the coronavirus. Thank you for your attention.
Okay, ladies and gentlemen, please, we've got 50 people. Please, I asked you before. I'm just trying to be, we don't have to clap, please. Okay. I'm going to start calling up 3 people at a time so the other 2 can be on deck and in the hole, if you will, like baseball. Okay, so Andrew Ernst, you are next, sir. Followed by Leslie Kirschenbaum, and I would just ask the next person up just to get up on the side over there. Followed by Melissa Taylor. Mr. Ernst.
My name is Andrew Ernst. I reside at 700 East Chapman Road, Oviedo. I came semi-prepared with what I wanted to speak about, but after listening to the team of experts, that might be altered. This pandemic and mask mandate started with 2 weeks to stop the spread, and it turned into a year-long power trip by government bureaucrats that has ushered in unprecedented expansion of government. With this increased governmental overstep, many of our most coveted constitutional rights have been infringed upon. I urge you to remove the countywide mask mandate immediately. Government's job is to protect our most basic rights, life, liberty, and the pursuit of happiness. Government overreach has limited the use of, or the ability of us to send our children to school, attend church and religious services, and to move and operate in our local communities without being discriminated against. I am being created as a second-class citizen because I refuse to wear a face mask while performing my daily activities. Critical thinking has gone out the window during this pandemic. Quarantining the healthy, not the sick. Closing businesses, but allowing fast food restaurants and home improvement stores to remain opening. 6-foot social distancing is required. There's nothing social about this. Wear your mask outside, wear your mask inside. Cancel holidays, cancel family gatherings, and our most coveted national treasures. 1 year later, the goalposts continue to be moved further each time. Yesterday in Seminole County, there were 62 new cases of the coronavirus. We have a population of roughly 477,000 people. That's roughly an 8% positivity rate, and when you break it down, you're only affecting less than 1% of our population. If we are following the science, this is where my speech kind of goes off. All the experts that were presented today with much greater qualifications than I possess all follow and want to enforce face masks. We've had a little over a year to do case studies, and no one can produce a case study showing the efficacy of a facial covering. We're not all wearing N95s, we're not wearing respirators, wearing surgical masks, wearing gaiters. They're of little of no value. The mask mandates are having lasting effects on our children and adult populations. Children are being taught that social interactions with their friends are bad and fresh air is harmful. I urge you to remove the mask mandate immediately. We are not subjects to the Crown, but we are free residents of Seminole County in the state of Florida and the United States of America. The people that you're here to represent, please do a better job of representing all of your residents. Thank you.
Leslie Kirschenbaum, and the next person up after Melissa Taylor will be a Sheila, no last name.
Thank you. My name is Leslie Kirschenbaum, address 113 Wisteria Drive, Longwood, Florida. Thank you for your time, and thank you for allowing us to speak before you on a matter that means a lot to many of us. As you can see, we have parents, business owners, doctors, healthcare workers, and concerned citizens. I want to get back to normal just like everyone else, and the way you can do that is giving our basic human rights of choice. To sit here and think that we're still forcing masks in order to get services from private establishments who are scared to death of the repercussions our government will inflict on them if they allow someone to enter their establishment without a mask, in my opinion, is psychological warfare. The whole notion, love thy neighbor, has gone out the door, because if I'm not wearing a mask, that person next to me is going to say I'm the reason this pandemic still continues. The words come together in unity is always brought up. But how can that happen when my brother and my sister has segregated me from their loved ones simply off the fear of me and my family not wearing a mask? Do you know what these mask mandates have done? Do you know the psychological damage we've created on society? Which doctors on the panels failed to mention the rise of drug use going up and suicide, along with deaths from people not being able to go to their doctors because of the fear and the shutdowns that occurred. You're listening to the Health Department and CDC guidelines. The CDC guidelines used a 6 feet apart measurement that was created 80 years ago and was proven to be outdated, and now we're implementing 3 feet apart, which Mrs. Walsh got wrong. How many children had to be quarantined and taken out of schools due to the outdated science from CDC? But the doctor previously says they're following the CDC regardless of the changes. How many children couldn't go to school due to CDC? And they had to go online, which is another issue on our children, and that's another story. As a mother to 4 children who attend different schools, 1 in Orange, 1 in Seminole, 1 in private, and 1 children in 5 different therapies, we all agree and we want the same thing. We want a choice. Our teachers don't get paid enough to be responsible in instilling the best education for our children, along with being a mask police. Let them educate our children without having them to tell a 4-year-old to put their mask on. Mrs. Walsh, you stated that we're using 6 feet apart measurement. I just said that they just changed it to 3 feet. Dr. Fauci actually said that. Excuse me. Excuse me. Oh, and COVID patients are actually seated in the ER with other patients. There's no hazmat suits, no different department or floor for these COVID positive patients or the presumed, meaning that we're actually treating it like the flu. The flu does not require masks. Please end this now. Thank you.
Now is Melissa Taylor, followed by Sheila, followed by Bill Silson, I believe is Melissa.
Melissa Taylor, and I will not be providing my address. Where there is risk, there must be choice. An article published by Stanford University Cardiology Division, quote, "The existing scientific evidences challenge the safety and efficacy of wearing face masks as preventative intervention for COVID-19. The data suggests that both medical and non-medical face masks are ineffective to block human-to-human transmission of viral and infectious disease such as SARS-CoV-2 and COVID-19, supporting against the usage of face masks. Wearing face masks has been demonstrated to have substantial adverse physiological and psychological effects. These include hypoxia, shortness of breath, increased acidity and toxicity, activation of fear and stress response, rise in stress hormones, immunosuppression, fatigue, headaches, decline in cognitive performance, predisposition for viral and infectious illnesses, chronic stress, anxiety, and depression. Long-term consequences of wearing face masks can cause health deterioration, developing and progression of chronic diseases and premature death," end quote. I can give personal testimony that long-term mask wearing has caused me a lot of negative health issues. I have complied for my business to wear a mask, and I now have a medical exemption for mask wearing. Furthermore, quote, "This was further supported by a study on infectivity where 445 asymptomatic individuals were exposed to asymptomatic SARS-CoV-2 carriers using close contact for a median of 4 to 5 days. The study found that none of the 445 individuals were infected with SARS-CoV-2, end quote. Why are politicians still pushing for mask mandates when asymptomatic doesn't spread like originally thought, and so much science and data suggest otherwise? When are we going to stop this charade? The MSM and paid-for politicians have been psychologically manipulating our society with held-back facts, censoring the truth, and inflated numbers to propel their agenda, and as a result, destroying individual lives, communities, and our critical thinking. I oppose the mask mandate. We don't need to barter for our rights back. They are not gifts from the government. They are our inalienable rights. Yes. End the mask mandate and stop pushing the vaccine. That's an experimental product. It is not FDA approved. I'm a daughter of the American Revolution, and I stand here as an American opposing the mask mandate. Thank you for your time.
Sheila, followed by Bill Silson, followed by Gerald Martin. Please.
My name is Sheila, and I prefer not to give my personal information for the safety of myself and my family. I'm here today to oppose masks, and I want to talk specifically about masking children. Our kids are being harmed by this mask mandate in every way. They are being terrorized and coerced, and you are harming an entire generation. I'm here to talk about the damage being done to children for a virus with a 99.97% recovery rate in children. Mandating masks for 6 to 8 hours a day in school is child abuse. Calling it anything else is pure deception at this point, April 27th, 2021. There was a German study that required doctors to report on approximately 26,000 children over the last year. It can be found in the COKI registry. okay? They did a study with the effects of masks on children. Children who had to wear the mask for a minimum of 4.5 hours a day. The studies concluded increased irritability, headaches, reluctance to go to school, impaired learning, and fatigue. And we also know about the increased number of anxiety disorders in children, nightmares. Suicide rates have escalated to an all-time high in my lifetime for children, okay? Because of masking and constant fear-mongering for a virus, again, with a 99.97% recovery rate in kids. This is less about protecting our children and all about conditioning our children. I would like to see choice regarding masks for our children and for all Americans.
After Bill, there is Gerald Martin, followed by, I believe it's Aaron or Eric Soda.
My name is Bill Shilson, 224 Slade Drive. Thank you for entertaining all of us today and that hour of expert testimony. Unless I'm mistaken, this fiendish virus that's consuming all of our emotional bandwidth is the same virus in China as it is in Europe and Australia and the United States. It's the same virus in California as it is in Texas, in New York, in Michigan, and Florida. The sole distinction in all of these places is the level of tyranny that the local population is willing to endure, and that tolerance, my friends, is waning. I watched the stormtroopers of China actually weld shut the front doors of their own citizens. I watched the police of Australia literally smash out car windows of people who weren't wearing masks and drag them away in chains. The poor slobs of Europe aren't faring much better. I also watched the California Coast Guard hunt down a man on a paddleboard alone in the Pacific Ocean to arrest him for his clearly anti-authoritarian activity. In Michigan and California, I've watched many thousands of family businesses go bankrupt while friends of the state got special concessions. I also watched their governors flaunt contempt for the very rules imposed on their subjects in a particularly vile display by the House Speaker. I watched the governor of New York arguably kill more people than Osama bin Laden with no remorse or regret. Tell me, what would happen to a regular citizen if he had been responsible for that much needless suffering and death? 7 months ago, I introduced this board and the executive committee of one to two renowned pulmonologists in Broward County that were conducting a groundbreaking study on ivermectin. Since then, dozens more of these clinical studies have been conducted and have proven the drug to be essentially 100% effective as a prophylaxis and better than 75% effective as a cure. Tell me, please, which hospitals in Seminole County are utilizing this information? We now know that the advertised R0 factor to be vastly incorrect, at least for disease manifestation. We know that the cycle threshold multiplier of 40 is an intentional fraud, and even at 20 produces far more false results than it should. We know that the CFR charts are identical to population mortality charts, and we know unequivocally that our children are not susceptible to this virus, statistically. Where is any of this information in the public forum? We know that comorbidities and general health have far more to do with the lethality than the actual virus. People die from common colds and flu every day. It's simply a trigger. Can you commissioners up there not see the utter absurdity of pretending that those plexiglass sheets do anything at all? Does this otherwise diabolical virus only travel at 90-degree angles? Can it only travel while the person is walking to a table but somehow knows when you sit down and then it's got a plain ice? Does it somehow know that the mask fabric you wear is hundreds of times too thin to do anything at all, but it intuitively can sense your good intent and hangs on to that filthy rag against all odds? There was a time when I trusted the narratives and those that pronounced them, but that time is long gone. Now I do my own research. I now speak directly to you commissioners. Educate yourselves and assume the responsibility that we entrusted to you when we elected you.
Mr. Gerald Martin?
Yes, Gerald Martin.
Followed by Eric, followed by Cheryl Bryant.
Gerald Martin, 565 Lake Bingham Road. And I just feel so terrible that these fine people have to come down here to fight for our freedom of choice. We should be able to choose what we want to do. It's so ridiculous. You know, we have a whole movement behind a guy that said, I can't breathe. I can't breathe. Let our children breathe. Let our children breathe. Well, you want to slow death? Just mask them. How would you like for me to come to your house and put my hand over your face and just hold you there all night? That's what we're doing. We're masking people. Listen, I don't have sex out there because I might get AIDS. I have common sense. I've got common sense not to go out when someone's got the flu and sit next to them. I've got common sense not to go do things that are dangerous like drink and drive. That's common sense. I've got the God-given right to do whatever the hell I want, whatever I want to do. That's my right. You can't take a lung from me if you want. If you want to make me stop smoking cigarettes, you can't say, okay, we're going to take your lung. That's my lung. This is my right. This is my body. I reserve the right to be able to choose. I deserve the right to have my children choose. If they don't want to go to school, then they can just not go to school. If they want to homeschool, they got that choice. If you want to wear a mask in your car by yourself, you have that right. I'm not going to step over that boundary and discriminate against you because you're not wearing a mask. I'm not against those people. I'm against the enemy of the people. That's what I'm against. Everyone should have that freedom and have that right. And shame on this government. I mean, people are dying from the flu, and we never wore a mask for that. We never were forced to stay home and not go out and have sex because of AIDS. I mean, you all are still having sex. So I just say, let our people go.
Eric, good luck following that. Followed by Cheryl Bryant, followed by Mike Sawyer.
Challenge accepted.
Please, no.
My qualifications are that I stayed at a Holiday Inn last night, and I feel well qualified to speak before you because of that. I believe that yourselves, with maybe one exception.
Could you give us your name and address for the record?
It's still
if
Eric
you're
Soto,
willing?
like he said, and my address is I live in Altamont Springs.
Okay, thank you.
Yeah, thank you, Amy. I'll start over. I believe that several of you, as well as the country at large, are suffering from several cognitive biases. And so I'd like to go through a few of those with you that I think that you may be suffering from. Anchoring bias. We were presented with a novel virus that we thought was going to be devastating to the world. And you're stuck there. That is not the case. That has not been the case, nor do I believe will it be the case. So please alleviate yourself from your anchoring bias. Confirmation bias. I believe that these experts that you presented to us are suffering from confirmation bias. They focus on disease, so all they see is disease and all they see is transmission. When in fact, I'll bet you nobody from this meeting gets COVID-19, which is given to you by SARS-CoV-2, but nobody really likes to talk about SARS-CoV-2, which I don't understand. I don't know why we're talking about COVID-19 instead of the actual virus that we're trying to protect ourselves from. I also believe that you are suffering from loss aversion bias. You keep talking about if we can save one person. If you really want to save one person, nobody should leave their house ever. But guess what? People are still going to die in their houses. You can't do it. It makes no logical sense. So if you will please free yourself from these biases, I think that we can move on as a society and we can achieve greatness again. Now, I also want to share a couple of things that have impacted me personally. One, my father got it, 88 years old, had cancer and diabetes when this thing first happened, when everyone was wearing masks. Very strange. The guy barely leaves his house, and somehow he got it. Yet the people that treated him when he returned home said, he does not seem to have this disease. Faring far better. It seems odd to me. So I do believe that there are false representations of the number of cases that are out there. I think that we don't really know any of this stuff and that a lot of it is made up. But I'll even assume that you guys are correct in your numbers, and still the percent chance of anyone in Seminole County giving it to someone else in Seminole County is extremely low. I was contact traced. They try to tell me I had to tell you what my temperature was every single day. I politely refused. I said, if I feel sick, I will not leave my house. I have not given the disease to anybody. I can't give somebody a disease that I do not have. It's impossible. I would also like to say that I was forbidden from being a baseball coach, which they needed baseball coaches, because I was honest and said that I would not wear a mask. And all the coaches out there, guess what? They don't wear the masks. But we're going to pretend that they wear the mask.
Eric.
I'm going to take the 45 seconds that he left, because he had 45 seconds on his clock. I perform different types of analysis. Every time I go to Lowe's, and I've been going to Lowe's every single time because I'm an essential worker, I've been going to Lowe's ever since this began. Oh, by the way, I wore a mask when you were told not to, because I didn't believe what they were telling me then. And I go to Lowe's and I ask, how many of your essential workers who have been at the forefront of this have died or gotten COVID? 2 have gotten it. Now that's only one Lowe's out of all the many Lowe's that are out there and all the Publixes that are out there. So I wonder why they aren't falling down dead every single day by not 1s and 5s and 10s, hundreds of them. Please end the mandate. Don't even bring it up ever again. We are Americans and we are a free people. Thank you. One last thing. I'm pretty sure the majority of these people elected you.
That's right.
And I think if things go the way that they're going now, that will not be the case when you come up for re-election.
All right. Everyone, would you please remember that we're trying to give everybody the opportunity to speak and keep it within 3 minutes. I would greatly appreciate it. Cheryl, thank you very much. You're followed by Mike Sawyer, which is followed by Ben Rivera.
Hi, my name is Cheryl Bryant, and I live at 664 Starstone Drive in Lake Mary, and I'd like to thank Commissioner Lockhart for helping me get that crosswalk fixed on Lake Mary Boulevard and Sun Drive. Every time I call you, you help me, so we're asking for help again. Maybe you can have some influence here today. I thought it was very interesting, the presentation that we saw today. In southern Indiana, where I'm from, we call that all hat and no cattle, because we didn't see one single bit of evidence. No one produced one single study that showed that masks work to prevent COVID. Not one. They talked a lot, they had a lot to say, but we didn't see any evidence. And also, I would challenge any of you today at this point to produce a study that shows that masks work the way that people are using them today. Not in some setting where things are being tested, but how humans actually use the mask. I have not seen one study, and I've looked and I've looked. In addition to that, I think it's very interesting that all of a sudden the numbers are going up right now and the vaccines are going up. I think there's a correlation there, and it has been proven actually. So I'm not buying the fact that that we have to worry about this. In addition to that, I think the mask mandate needs to be rescinded immediately. It's harming our children. Thank you, Jesus, that I no longer have children in school. Because I tell you, I would have been a terror. These kids, they are now saying that it might take upwards of 7 years to undo the psychological damage that we're doing to them. It's awful, the PTSD, it's awful. It makes me well up just thinking about it. And as adults, we need to have nonverbal communication with each other. We need to be able to communicate with each other, love each other, be near each other. And this has just got to stop. The cure cannot be worse than disease. And what you have done is you have made the cure worse than the disease. And this has to stop. And I will tell you that I owned Wild Hair Kitchen and Garden Emporium in Longwood. I recently sold it. And I had a lot of doctors, nurses, healthcare workers who came into my store and purchased products there. And I will tell you that 99.9% of them were not in favor of this mask mandate. They thought it was all just balderdash, and I have to agree with them. And I have to agree with the fellow before me. If you folks are going to talk about respect and then not respect our God-given rights, then I think that somebody needs to be primaried, and we need to get people in here who are going to respect us. Thank
you. Mike Sawyer, you're next, followed by Ben Rivera, followed by David Levitt.
Is he outside, maybe?
Mike Sawyer, going once. Well, if he is, I'm waiting for him. Going once.
Is it announced outside? Yeah, it's announced.
Yes.
You have to give time for them to come in.
Joe, do you see anybody coming in? No.
Maybe just set it to the side and we'll see.
Okay. Well, I'll just ask for him again. Don't worry, everybody. He'll come back. Ben Rivera, followed by David Levitt, followed by Cindy Haller.
Good afternoon, everyone. My name is Ben Rivera. I'm from Oviedo. I know a lot of good people came up here, kind of took a lot of the talking points, but I just wanted to say that first off, as a concerned citizen and with two children, one being in elementary school right now, the past year has been really rough. My son was going from kindergarten into first grade, and when the mask mandate and the social distancing took extreme effects, not gonna lie, it kind of frightened us. We weren't sure if he was gonna get the proper education, he was gonna get the proper fundamentals in human communication, because that's what kids do. That's how they learn their body language skills. That's how they learn to interpret different things. When you mask them and you social distance them, we felt like he was gonna be at risk to falling behind. And we made a decision to go through the virtual school route, which lo and behold, I'm sorry to say, the county's virtual school, the state, whatever it's run by, is garbage, because it did not teach him one thing. We've come to realize that after he's gone back to school, he's behind. And this all started because we were in fear of the fact that if we sent my son to school, he was going to be in a jail. That still kind of is. I visited a school recently to have a parent-teacher conference, and they still have panels up. The desks are separated. They have to have masks all the time. And you know, I also just wanted to say that it's extremely confusing when we sit here talking about masks, when for half a year last year, the guy in charge of all this, Mr. Fauci, is clearly on video going back and forth. He said it 3 times on national television. First it was, we don't need masks. Then we need masks. Then we don't need masks. Now we're at double masks. And I don't understand this, okay? Like everyone said before, it is our right to decide. Nobody in this board, a state board, a federal board, has the authority to relegate my risk or anyone else in here. It's their right to determine their risk. And I just have to say, and I don't mean to call anyone else out here, but it's the truth. H1N1, I was in high school and I contracted that. I was in the hospital with a 106-degree fever on the verge of death with 2 IVs and ice packs, and they were trying to save me. I was out of school for 2 weeks. I'm sorry to say, but I don't think really anyone in here cared then about the children, because immediately when I was healed, I was sent back to school and nobody blinked an eye. Nobody on the panel can say that they cared. There was no mask mandate. Nobody told me I had to quarantine afterwards. This is ridiculous. And quite honestly, there's no real sense in this. And the last point I want to say is, this is exactly how government works, because when we first started here, I don't know what to say, Commissioner, my apologies, Mr. Zimbauer started by saying that he agreed at first with looking at the situation and taking away masks, but then said, okay, we need to start looking at this every 30 days, we need to reconvene. That's how this government works unless you put a stop to it, because they're just going to take time, take money to keep going over the same situation, and nothing's going to get done. Thank you.
Dave Levitt, followed by Cindy Howard, followed by Lisa Carolosi.
There's a delay.
I believe.
Thanks, guys.
Yeah, that might be
Can we
wrong.
get the camera to go up a little bit? I think my head's getting chopped off.
Uh-oh.
Thanks. David Levitt, Seminole County resident. It's been a while since I've been up here.
We missed you. Said we missed you.
Yeah, I bet you do. Yeah, I used to come up and give a lot of compliments. So. And I'm going to give one. Thank you, Amy, for proposing what you're proposing. The fact of the matter is, this executive order was written by the emergency manager of Seminole County, who, under the state of an emergency that we're in, whether the county's under the state of emergency or the state's under the state of emergency, either way, doesn't matter. Alan Harris has a right to make executive orders because we're under a state of emergency. So this is not your mandate to vote down. I mean, I hate to say that, but that's the truth. Only Alan can really do that. Now, what you can do possibly is direct Alan's boss to say, hey, get rid of that mandate, what you need to do. So I want to get into a couple of other things. In the executive order that Alan wrote, he actually he made it possible for any police officer in any of the 7 cities, any Seminole County deputy, the sheriff, any code enforcement officer, he made it possible. He actually put that in his executive order that all these people have the authority to fine you if you violate this executive order. And it's per Florida statute. And the Florida statute says it's a $500 fine, by the way, when when the conviction is a misdemeanor of the 2nd degree or a non-criminal violation, which is what this is. So I'm going to stand here right now and I'm going to ask a sheriff who I really, really think a lot of, our Sheriff Lima, to please issue me a citation. I have been in violation of this executive order continuously on numerous occasions. And commissioners, when I'm talking, can I please get your attention?
I'm reading
what
you're talking about.
Thank you.
And I'm making notes, Mr. Levitt.
Please, fine me. If you have the ability to fine me 1,000 times, 1,000 times, more than that, come up here and fine me. And by the way, fine a lot of these people sitting in this room, because right now they're breaking the executive order. This thing has no teeth. It's so ignorant of an executive order to have out there. So I want to do a couple things here. One of my favorite congressmen, Thomas Massey, just recently, we choose freedom over Fauci. But he didn't say that. Our great governor, DeSantis, said that. Massey's just quoting him. Well, with that in mind, I have no idea why he just renewed the state of emergency, but I think we all know that's because of the money. So the point is, this whole thing is silly. And even though you really can't vote today, you stack the deck against us. You got all these experts up here that, and by the way, my credentials, I graduated top of my class in the School of Common Sense. Okay? And common sense tells me this is crap. So thank you.
Cindy Howler, followed by Lisa, and I'm sorry if I mispronounced your name.
You got it right.
Oh, good. Followed by Sarah Rezke.
Good afternoon, Commissioners, public. Cindy Holler, 1731 Beacon Drive, Sanford.
So sometimes I worry about actually catching pneumonia when I'm in the county chambers, but I'll just... So I come to you today from a healthcare worker. I am licensed to practice physical therapy in the state of Florida. I get frequent emails from Department of Health, and, I personally have been doubly vaccinated. I was vaccinated actually before President Biden took the oath of office. I was vaccinated in December and January with the Pfizer vaccine. I've been tested 125 times. I've never been positive. I'm extremely low-risk individual for contracting the virus, which I will tell you is a real virus. I work in long-term health care, doing physical therapy in what we call a SNF, or nursing home, skilled nursing facility in Volusia County and in Seminole County. Interesting little thing was I've been hearing people, share different things. When I was working in Deltona Healthcare a couple of years ago, we were asked, we weren't required to receive the flu shot, but I did receive it. Some of my fellow therapists did not receive it. And one of the policies they had was if you did not receive your flu vaccine, then when you were working with patients, you had to mask. And if you received the vaccine, you didn't have to mask. So I was like, well, so now why do we have it different with this virus? So anyway, I just thought that was kind of interesting. Private businesses, they can do what they want, of course. I do not want to infringe on anybody's right to wear a mask or multiple masks, but don't force it on me. I have worn the mask actually very seldom, even before I was ever vaccinated. I first heard that the purpose of the mask was to keep your hands away from your face. So one of the things I always told my kids, which I'm glad they're not in public school anymore, because I probably would be going ballistic, is when you come in from public, I don't care where you've been, wash your hands with some water, get under your nails, wash up to your wrist and everything, and just keep your hands clean, keep your fingers away from your eyes, your nose, and your mouth, and you will be much healthier. Let's see what else. So the one gentleman who said that he had been very sick with the one virus a couple of years ago. My daughter Lizzie actually had flu and pneumonia when she went to, I'm forgetting HCA. Gosh, I'm not remembering the school. Anyway, she was 8th grade. She missed school for 2 weeks. But nobody, there was no big concern with classmates or whatever. She recovered, she went back to school. So, anyway, no mask talk there. And then the last thing I just want to say is I would like the mask mandate rescinded now. Don't wait. So, thank you for your time.
Lisa, followed by Sarah, followed by Beth Martin.
Hi, everybody. My name is Lisa Terralosi. I'm a resident of Lake Mary, Florida. And I didn't have intentions of speaking today, but somebody talked me into it some. I was a hygienist, and I remember going through school. The mask rules were you had to change them every hour due to the bacteria because, of course, things are getting on your mask that you can't see. We know that doesn't really happen with what's going on now, and everybody touches it and with their dirty hands, so now they're breathing in and out all the bacteria that's on the exterior of their mask. Not to mention that oxygen is very important for us. It's also against our constitutional right to force us to wear one. Businesses shouldn't have to make it mandatory for the government shouldn't make it mandatory for the businesses to have to require masks to come in. You should have the right to choose. And I also agree with if you feel safe and protected by wearing a mask, by all means, people should have the right to wear a mask. But then I should also have the right to choose whether I want to or not. I also feel if we don't stop it really fast, it's not going to go away. I just have this bad feeling we're going to be China in the future where you're going to be mandated to wear them and drones are going to come get you to put it on. And then, of course, the children wearing masks, it's a shame. And if they have people at home that have underlying issues and they want to wear a mask, they should feel free to wear one. We have a 99.97% chance of not dying from the COVID, which applies to adults also. It can be a little less than that if you're older. And so we're changing the whole entire population for 1%. And also, with the experts or the doctors that you had speak today, that's one group of doctors who are all educated. The same way there's another whole group of doctors that feel that ivermectin, hydroxychloroquine are very effective when given prior or early on in onset. And we only heard one side of the story today. We heard like the political side today, and I think maybe we should hear that whole other group of doctors who are just as educated that also are very concerned about the vaccine and what causes may happen in the future that we don't know yet because it was never experimented on people first. So, and one last thing. If this were really that deadly of a pandemic, wouldn't there not be any more homeless population left? Thank you.
Sarah, followed by Beth Martin, followed by Julia Quint.
Hi, it's Sarah Reschke, and I live on Cove Court in Longwood. I've had the privilege of living in Chairman Constantine's district for 17 years, and I appreciate the opportunity to come and speak to you all today. My credentials is I've also been in the healthcare industry for 17 years. I work for a medical manufacturer and distributor. I'd rather not comment on what organization that is. I'm supportive of removing the mask mandate and encouraging those who feel protected by the mask to continue to wear those. I did email Ms. Lockhart and Chairman Constantine's executive assistant these articles, so if you haven't had an opportunity to look at them, they should be in your email. On April 6, 2021, the CDC posted German results that demonstrated SARS-CoV-2 did not spread through asymptomatic spread or asymptomatic people, which means that if you don't have a fever and you're not demonstrating any symptoms, you are not affecting anyone by not wearing a mask. In March 2021, a Danish mask study reporting statistically insignificant results between patients wearing and not wearing masks. There are other studies, but these were the most recent that I wanted to share. In addition to mask wearing, which could feel preventative for some, there are other preventative measures like taking vitamin D daily, which can reduce hospitalization by 80% and death by 60%. You can also take zinc, vitamin C. There's also a study recently that came out and said chlorinated water kills the SARS-CoV-2 virus, so I'm glad that my parents do water aerobics weekly. There's also studies that sunlight kills it, which makes sense with the vitamin D, and so some of us have the ability to go out and enjoy that natural sunlight that we are very blessed with here in the Sunshine State. And then there are other therapeutics that are available, as some of my other residents have shared, in addition to the emergency-only vaccine that is available for those who choose to take that. There's also ivermectin and hydrochloroquine that is available, but really our immune systems, if we are doing those preventative measures, can beat it. And there's also another study that says 30 minutes of exercise that gets your heart pumping for 5 days a week will actually prevent you from getting the SARS-CoV-2 virus. Thank you.
Thank you very much. Before I call in the next person, Joe, did you just raise the temperature? Thank you very much. I was going to, whenever this room gets filled, they like to lower it a little bit to keep everybody comfortable, but I think that most of us are freezing. So I'm glad you did that. Thank you very much. Beth Martin is up next, followed by Julia, followed by Nicole Wallet. And thank you to help me out there, Nicole, with your name. Are you Beth Martin?
Mm-hmm.
Good.
Beth Martin, I live in Lake Mary. The question I kept raising my hand to ask when you had all the medical professionals on was, I wanted to see if they had a graph that they've started since they started vaccinating everybody to see how many of those COVID cases / deaths were coming from the vaccine. That being said, instead of creating a strong immune system in our youth and population, and talking about different ways, like the lady that just spoke, taking vitamin A, taking vitamin D, getting out in the sun, making sure you're taking care of your body, eating the right things, exercising. Instead of focusing on that, we're focusing on covering ourselves up and inhaling all the junk that we're supposed to expel. There was a scientific study by a group of German researchers that was just done in 2020 on the masks. And one of the things that they came up with was there are a lot of people suffering right now from mask-induced exhaustion syndrome, which I will just read a couple of the symptoms. Increase in breathing resistance, increase in blood carbon dioxide, decrease in blood oxygen saturation, increase in heart rate, decrease in cardiopulmonary capacity, feeling of exhaustion, increase in respiratory rate, difficulty breathing and shortness of breath, headache, dizziness, feeling of dampness and heat, drowsiness, decrease in empathy perception, and impaired skin barrier function with acne, itching, and skin lesions. These are just a couple of the symptoms that the mask is causing. And I thank God I don't have any kids in school right now because they wouldn't be in school and wear a mask. It makes me so sad to see people walking in Target with their 2 and 3 and 4-year-old with a mask on. These kids think this is normal. It's not normal. It's weakening their immune system. And you guys need to stop this now. Like today, you need to rescind the mask mandate. And they need to start a graph with all the COVID cases / deaths from the vaccine. Thank you.
Julia, and followed by Nicole, followed by Andrea Selfick.
Good afternoon. My name is Julia Quinn. I'm a resident of Seminole County, a business owner, a wife, a mother, and a board member of Florida Freedom Keepers, a state chapter of the global organization Freedom Keepers United, whose mission is to advocate for medical freedom, informed consent, and the right to maintain control over medical decisions at the local, state, and international level. As we can see firsthand during these unprecedented times of COVID-19, there has never been a more urgent and important issue than medical freedom, which all too often gets swept aside in the name of one-sided, politically driven science, or under the guise of for the greater good. Medical mandates, be it for masks, vaccines, or any other medical procedures or devices, come with risks and should never be mandatory, particularly in a free society such as America. Where there is risk, there must be choice. So it makes sense that I would be here today on behalf of Florida Freedom Keepers to voice my opposition to Executive Order 2020-30 regarding COVID-19 and to publicly support Amy Lockhart's proposal to end Seminole County's mask mandate. But today I'm not here to speak as a board member, I'm here to speak as a mother. I'm here to be a voice for my 4 young sons, ages 8, 6, 4, and 2, and to be a voice of reason in this fight for the world that they will grow up in. It seems no matter who you talk to, fear has been a resounding word this past year. Fear of asymptomatic spread, fear of death, fear of government overreach, fear of the loss of individual liberties. And so people turn to science to make them feel safe. But what happens when we're only looking at one side of the science? Turn on mainstream media and you'll hear Fauci preaching masks like religion, and you'll see elected officials determining policy based on single-sided science. And as we've seen over the last year, these policies aren't without risk. I'd like to share some of the science we aren't hearing. From the CDC itself, available evidence shows that cloth masks may even increase the risk of infection due to moisture, liquid diffusion, and retention of the virus. Altogether, common fabric cloth masks are not considered protective against respiratory viruses, and their use should not be encouraged. An analysis by Rational Ground in December tabulated all the days that various counties had mandated and compared them to the days without mandates. They found that even when counties did have a mandate in effect, there were 660,000 cases over 3,000 days. When counties did not have a countywide order, there were 430,000 over 12,000 days. This shows that Florida counties with the mandates actually had significantly more cases per capita than those without mandates. Does this science and these statistics justify the extreme government overreach and involvement in medical decisions to participate in society? Galileo once said, in questions of science, the authority of 1,000 is not worth the humble reasoning of a single individual. On behalf of my family and my children and on all your local constituents, I implore you to take a stand for what is right. Be a single individual with humble, sound reasoning, and challenge yourself to put fear aside and read both sides of the science. Dig deep and end this insanity. Vote to end the mandate today and not June 7th. Today. Thank you.
We have Nicole, followed by Andrea, followed by Carmelo Bellardo.
My name is Nicole Willett, and I'm not going to give my address because as I have spoken out on Facebook and the other platforms, I have gotten a lot of hate mail and death wishes because I am an informed individual who stands for freedom of the individual and not the tyranny and the propaganda that we have heard today. We have had a bunch of people that are experts, but we don't have anybody speaking about the mental health and the implications that this mask mandate has. I have never been bullied as a child like I have since dealing with this mask issue. I was bullied when I was in an abusive marriage, but I got myself out of that marriage. And if you have not been abused, if you have not had somebody hold you down with their hand over your mouth and your nose, then you have no idea how these masks affect people. And I'm not the only person in this county who has been raped, who has fought off attacks, who has been abused by their spouses or people that love them. I have a lifelong restraining order. If I have to wear a mask, then the man that is promised to kill me has an excuse and something to hide behind. And you guys are not even considering the fact that there are many people in this county that have restraining orders, and they are going to stand their ground, and they are going to pull out their guns and shoot at the people that they have restraining orders against when they are violated, when these masks give them every opportunity to violate those restraining orders. And so you are actually putting people at risk of gun violence. And not just violence, but standing your ground, and nobody's even thinking about that. Nobody's thinking about the people like me who have been abused. You have no concept of how this is isolating people. It is muzzling us. It is every single textbook point of what abuse is. This mandate, it abuses the citizens. It doesn't give us freedom. Personally, I am a bodywork therapist, a licensed healthcare professional. I'm not just a massage therapist. I actually do medical work. My youngest client is 5 months old. My oldest is 96. My oldest client at 96, he's having glaucoma, macular degeneration, and polyneuropathy reversed. His doctors are blown away, and it's because of what I'm doing for him. So I might not be a doctor whose education is on illness management. I am somebody who's been studying health for over 22 years. My mother died from cancer. The reason why I do what I do is to help people in my community be healthy and to make sure that I myself am healthy for my children, because I don't want my kids to have their mother die the way mine did. And having to wear a mask My exercise-induced asthma, which I have had since I was a child, is now full-blown asthma. So the mask mandate isn't protecting people. It's harming people, and it's putting every single one of us in danger, and it needs to end. Thank you. And thank you all for coming out.
Okay, we have Andrea next, followed by Carmelo, followed by Michelle Menela.
Hi, I'm going to read mine just because I needed to get out quickly. I'm Andrea Suffolk. I live in Altamont Springs. You have my address. I would like to say one thing with regards to the abuse. I'm also a victim of an abusive marriage, which I did not have the physical aspects of it. But through healing for that, I learned the ideas of gaslighting. And one of the things that makes me so convicted in what I'm doing now is I believe for the past year, the media, the politicians, the celebrities, all the athletic companies, the big tech, the corporations have all been gaslighting us into fearing this virus. And they're increasing our fear, and it is unhealthy. My children are all getting the vaccine. My parents are. I might not be able to meet my new nephew because my sister, who is a nurse, is so, you got to get the vaccine, you got to get the vaccine, that I may not be able to meet my nephew because of the fear that has been caused by all this, and it's not right. 2 weeks ago, I came here to speak to you all about ending the mask mandates. When I had my chance to speak, I asked for the commission to provide me with duplicatable, peer-reviewed studies that you used to implement the mandates that proved the masks worked. I followed up with Lee Constantine's administrative assistant the following day to obtain these material. Sarah Hurry from his office could not have been friendlier or more efficient. She directed my request to Alan Harris immediately, as she believed he could get me the information I needed. Alan Harris was also very quick to respond, and he sent me a link to the county website, which did give me plenty of information. However, none of it was the information I requested. I asked for a duplicatable, peer-reviewed study that proves that masks work. What I received were numerous outdated studies that do not meet that criteria. When I received his email, I was taken back to college, where people routinely, when they don't know quite how to answer the professor's question on an essay, would just keep writing, hoping that at some point they would hit the answer the professor wanted. Or as many English majors joke, I have a BA in BSing. It was not until the days leading up to this meeting that I realized that the 5 of you, our elected officials, had not once voted on this issue. These mandates were put in place 10 months ago. Why have you avoided going on the record with your position? There is so much wrong with this situation. I fear that each and every one of you does not see the issues. Like I said 2 weeks ago, if you believe in the mandates, you will abide by them 100% of the time. If you do not do that, your actions prove that you do not believe in them. None of you are wearing them today. At least today, you didn't look at us all like we were toddlers that weren't behaving and saying you need to put your masks on while we don't. With all due respect, the people have been wearing masks for over a year now. The mask requirements have kept people from breathing fresh air for all this time. So much for 2 weeks to slow the spread. These mandates have inflamed fear and caused division in our families, communities, country, and around the world. I think those who are expected to live abiding by these mandates are entitled to actual scientific evidence that they work for their intended purpose, saving lives, not government control and psychological observations. Even the manufacturers of the disposable masks we all wear that you have available here today say right on the box that they will not prevent the spread of a virus. I've yet to see any study that proves that homemade and manufactured cloth masks of these various materials are any more effective. What I have been able to learn from other sources is that the virus has a diameter of 60 to 140 nanometers, while medical and non-medical masks have a thread diameter of 55 to 440 micrometers. This makes the virus 1,000 times smaller than the holes in the masks. Using masks to prevent the passage of this virus is like installing a chain-link fence to stop the mosquitoes. It doesn't work.
Andrea, you almost through.
I think we all deserve, and I'm not the only one that has asked, we deserve the information that proves that masks work. I also have a problem with being told I need to restrict my breathing based on something that's not proven. I have a problem with the mandates being based on how many people are receiving a rush to market untested vaccine. I also have a major issue with looking at this with a COVID-only approach and ignoring the people that are dying from depression, abuse, poverty, lack of untreated medical mandates. All these things are important, addictions. All these other conditions need to be addressed too, and the mental health impact on this is going to last for decades. You all know that. You can't look me in the eye and say you don't. I have two more quick thoughts. The pharmaceutical companies have no liability. I have a cousin that's been dealing with Guillain-Barré syndrome for the past 5.5 years. He can't walk without a walker, and he can't grip anymore. He was 47 when he got this. Mike Wallace did a special back during swine flu that talked about pushing vaccines and interviewed a woman with this syndrome. I feel like we're living that interview now, although 60 Minutes wouldn't have the guts to air it now. It's from back during the swine flu. Please watch it. And please, this needs to end today. It's total BS. It is. Please end it. Thank you.
Carmelo, followed by Michelle, followed by Margaret Pass, P-A-S. Ladies and gentlemen, and I want everyone to have their opportunity to speak, and that's no problem. And as you can see, many people have gone over, and I haven't said anything, and just let them do. But just keep in mind, make sure that you try to keep within 3 minutes. I greatly appreciate it for everybody. Thank you.
I'm Carmelo Bellata III, and I live in Altamont Springs, in the great state of Florida, in the best country in the world, the United States of America. I used to be one of those people that used to sit on my couch and watch the news and read the newspapers to find out what was happening. I used to think, what can I do to change things? Well, after events in recent history over the past 12 months, they've caused me to reevaluate my role in my community. I got out of my house, I got involved. Ladies and gentlemen, there are many, many others like me who are waking up and who are getting involved. There is a sleeping giant awakening, and we realize what needs to happen. Leadership needs to be accountable. We need to have you on the record, or leadership needs to be changed. The information and data presented by the doctors and experts was convincing. By the way, those are all salaried professionals, I imagine. Well, there are thousands of entrepreneurs who start at zero income every single day. And some of these businesses, they're suffering. But for each of those presenters, there are many doctors and experts who can provide equally convincing data showing face coverings and shutdowns just do not work. Businesses in Seminole County, our county, are silently pressured to enforce face coverings for patrons for fear of detrimental reviews and social media damning that the business that it may affect their viability. I will never tell anyone not to wear a mask. But if you look at those packages that they come in, they have instructions. Masks are quickly contaminated, it defeats their own purpose, and it's a consequence of good intentions, I guess. I ask that if one expects our children to wear masks all day, that's 7+ hours, then at least our elected officials ought to go and wear masks for 7+ hours straight and just see what it's like. It's not fun. The ones who govern are not exempt from rules imposed on the governed. I've heard save at least one life. Yes, we should save one life, at least. That goes for car wrecks, smoking, sports injuries, helmets on motorcycles, but these are all freedoms that we have in this country. I ask that you vote to eliminate the mask mandates for our kids in school and for our community in Seminole County. In America, we have rights to make individual choices. We all make individual choices. You want to wear a mask? Wear a mask. You want to get the vaccine? Get the vaccine. You want to wear a motorcycle helmet? Wear one. You want to smoke cigarettes? Have at it. We must work to maintain those rights. And I ask that you strike down this mask mandate and be accountable to your constituents. Thank you very much.
Michelle,
Is it Burrows on there?
is there who?
The last name Burrows? Oh, no.
No.
Michelle Manella, correct?
Michelle Manella, yes.
My name is Michelle Manella. I live in Longwood. I'm a licensed frontline healthcare worker as a clinical laboratory scientist, and I've been involved in the processing of well over 2,000 specimens during this last year, and I have not caught it because I've taken a lot of measures just to keep myself healthy, and I think that many of us have not experienced that because of getting fresh air, sunshine, nutrition, things like that. Anyway, Mark Twain once said, "Nothing is so permanent as a temporary government program." And I really see that happening in real time here. It feels like the finish line, the goalposts keep being moved time after time after time. I've sat here listening today to many of the experts that you played for us at the beginning testify regarding COVID positivity, epidemiology, hospitalization, severity numbers, discussions regarding social distancing and vaccines. I suggest that the vast majority of that data is actually irrelevant to this discussion of masks. We all want to see as few deaths as possible. We all want to see COVID go away. But what we're really discussing right now is, are masks effective? Melissa Taylor earlier quoted a Stanford University study that was published on the National Institute of Health website last week, so I won't go over it again. But it clearly stated that the data showed that masks are ineffective at blocking human-to-human transmission of SARS-CoV-2 and COVID-19. Not only are masks dirty, dehumanizing, and ineffective, to quote Dr. Jay Bhattacharya from Stanford University, the professor of medicine, said children have developmental needs that require them to see other people's faces. Learning to speak, for instance, requires seeing lips move. Slightly older children need to see people and learn how to interact socially by watching people, including facial expressions. So you have harms on one side and very little benefit on the other, close quote. You may be asking, what does that have to do with our county mandate? Everything. Because the Seminole County School Board has basically said that they are going to follow your recommendation. So your recommendation here today affects those little kindergartners and 6-year-olds who have to wear this over their face, their nose and their mouth, where they breathe all day long. This is traumatizing them. These little 5- and 6-year-old kids cannot come up here to the podium and tell you this. It's our job to tell you this. And we are expressing today that this mandate needs to end. Please support Amy Lockhart's proposal to end this mandate today. Not tomorrow, not a week from now, not a month from now. You may also say, but the CDC says, Dr. Fauci says, we didn't elect the CDC, we didn't elect the FDA, we didn't elect any of those people. We didn't elect Dr. Fauci. We elected you to look at the science. It's been well over a year, over 400 days now that we've been dealing with this, and the science is just not showing that masks are effective in reducing death. Stop the charade, follow the science. I know we went with an abundance of caution at the beginning, but it's time to end this. Please support Amy Lockhart's proposal. Thank you.
All right, just so I have it, Margaret Pass, followed by Jason Quint, followed by Kelly Shilson.
Good afternoon, Mr. Chairman and esteemed commissioners. My name is Margaret Paz. I live in Sanford. I have been a resident of Seminole County for over 30 years and a business owner for 23. I am a Christian, a mom, a patriot, and Mimi to 2 beautiful grandchildren. My concerns are for my family, my friends, and my country. I believe that we have veered off into a path that may become very difficult to reverse. On October 23rd of 2020, the journal Nature Medicine published a study with an astounding claim, and I quote, "By simply wearing masks at higher rates, Americans could prevent as many as 130,000 COVID deaths by the end of February 2021. The study was produced by the University of Washington's Institute for Health Metrics Evaluation, and it garnered immediate acclaim. More than 100 news outlets were lauding the study's findings, including the New York Times headlines that read, "The price for not wearing masks? Perhaps 130,000 lives." Of course, the politicians weighed in on the study, and the National Institute of Health published a stricter masking requirement on the basis of it. So what was the problem? As reported by the Wall Street Journal, using surveys that were months old, they erroneously assumed that the U.S. mask adoption rate was at 49% as of late September 2020, which left plenty of room to increase to universal adoption, defined at 95% or more likely to an 85%. However, the new findings indicated that America's mask adoption rate had been at 80% since the summer. The results? Stricter mandates based on erroneous data. The problem? No one bothered to go back and reevaluate the situation based on new findings. When faulty data is used to restrict our freedoms and impose mandates that impede our lives, it leads us further away from the truth. Not one of the more than 100 news outlets retracted their story. The politicians did not go on TV and say that the study was inaccurate, nor did they ease up on the mandates that were instituted as a result. When perceptions are used to control the reality, we are treading on dangerous grounds. In March of 2020, a top U.S. infectious disease official said, and I quote, "There's no reason to be walking around with the mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think." That was Dr. Fauci on 60 Minutes. So what changed? Are the masks better produced? Have the molecules in the COVID virus become so much bigger that they cannot penetrate the mask? Or has the scientist been influenced by the politics of the day? That's right. Last week, I emailed each one of you a recent study reported by the NCBI, which is under the National Institutes of Health, that showed that masks do absolutely nothing to help prevent the spread of COVID-19, and their use is even harmful. The study found that although scientific evidence supporting face mask efficacy is lacking, adverse psychological, physiological, and health effects are established. The article comprehensively summarized scientific evidences with respect to wearing face masks in the COVID area, providing proper information for public health decision-making. I hope you each had an opportunity to read that study. Commissioners, I implore you to please remove these mask mandates and stop the war on our freedoms. We were created to be free, and in the words of my Lord and Savior Jesus Christ, who the Son sets free is free indeed. Thank you for your time.
Mr. Jason Quint, followed by Kelly, followed by Debbie Suarez.
Good afternoon, Jason Quint. I live in Longwood. So my background, I own a small business here locally in Lake Mary. I was a former divisional CFO of a Fortune 500 company. My specialty was analysis of data. I've been a keynote speaker at least 3 national conferences on the analysis of data, and I can tell you that the experts that were speaking were conveniently avoiding certain pieces of data to present other pieces of data. And that is a big, big problem. And that is what I have seen consistently. There is not intellectual honesty in what is being presented to you, and you're only getting one side of the story. To Commissioner Zembauer's proposal at the beginning, the arbitrary date of June, whenever you want to rescind this, The 50% vaccine threshold is also an arbitrary number that just, I don't know what basis there is for that to when we should do it. I think the whole problem is arbitrary nature. The concept Dr. Husty said, are we there yet? Are we there yet? Well, I can tell you when my kids ask, if my GPS says we'll be there in 4 hours and 13 minutes at 73 miles, I can tell you exactly when we're going to be there. None of these people can tell you when we're going to be here because they don't know. They don't have a clue. They're parroting what other people have told them, or we're just going on what the CDC tells us. We don't really know, but this is what and if they dare step out of line, YouTube bans them. They get their medical credentials put in danger. They are drummed out of practice and out of business. Their livelihood is put at risk. And they are, quite frankly, scared to come up here publicly. That's why you don't see a ton of doctors sitting here saying that, because there is considerable risk to their livelihood to do that. And quite frankly, they don't have the bravery or the courage to do it. Looking at some of these charts, it's very interesting to me. The one chart that was the COVID vaccinations by age group, I think we can all agree the elderly population is the most at risk. Pulling from the chart, total vaccinated, 69.8% of the 65 to 74, 70% of the next group up, 61% of the next group up. The most dangerous population that we have has been vaccinated. I don't know, what number are we wanting to say that we have been successful? 100%? It's never going to happen. 70% vaccination levels of the most at-risk population is exactly what we wanted, exactly what we needed. Having a 26% population of the people who are the least likely to get it, the children, they're never going to get this. It's been proven. The public schools have been open for a year across the entire world, and there's not been these outbreaks of all these children dropping like flies. It just simply doesn't happen. So it's a false statement that, oh, we need to now work on these young people. The young people aren't getting this. The young people aren't dying from this. It's the elderly, and we have been successful based on your own data. For all the historical evidence that we have on the efficacy of vaccines, we have 0 on the efficacy of masks. It's a screen door on a submarine. The N95 mask, the definition is it protects 95% of 5 microns and up. The surgical masks were never intended to be used in this way. Their goal was, I'm a surgeon, in surgery, stuff splatters into my face. It protects me from getting blood and other fluids during surgery from my face, right? They define per the FDA's own website, it says, quote, the surgical mask may be effective to block large particle droplets. Well, what exactly does that mean, large particle? Well, if you do more research, large particle is 5 micron and up. This virus is 2 micron, 3 micron. That means the FDA says this mask is not effective at stopping this actual virus, but what it is, it's a thing that people can feel good. I can tell everybody else that I care about you. I'm not selfish because I'm wearing this mask. But meanwhile, I haven't seen anybody stand up here and say, hey, you know what? I think we should keep this going. Who here is saying that? I don't see anybody up here saying, we need to keep this. Why is that? Why is that? Where are those people? I don't see them. Thank you.
Kelly, followed by Debbie Suarez, followed by Karen Miller. Karen Miller, you're up third.
Good afternoon. My name is Kelly Shilson. I live in 224 Slade Drive, Longwood, Florida. I would like to point out to the commission, all the great citizens here today. They are here because they feel like their voice may finally be heard. I've heard over and over again, why go? They don't listen anyway. And now for the first time, you can see they finally feel that maybe you will listen to them and not just them. I'm asking you not to just take what the local professionals say, but to also look at our Constitution as a guide. Nowhere in our Constitution does it say you're free unless there's a virus that is advertised to be 0.03% deadly. I know you have been emailed many articles of dissent regarding the effectiveness of masks. I ask that you look at those in addition to Dr. Husty and Alan Harris. Again, to quote the current stats, not one child has died in Seminole County with coronavirus, yet suicides and opioids are up. Excess mortality has not significantly increased in 2019 or 2020, at least nowhere near what would justify our reaction. That is why the medical professionals do not make laws and mandates. Residents and voters should have the choice of what to do for themselves and not be encumbering on others. If people are scared, they should stay home or wear an effective mask. The dissenting opinions do not get equal representation and are ignored, while narrative arguments get amplified. People continue to virtue signal with their masks and now their shots. Even the doctors and experts with dissenting views are being silenced and ostracized in and from their own professions. I have had conversations with people of friendships of over 30 years being destroyed because of this issue. It has caused division in countless families, resulting in pointless and heartbreaking loneliness. Our Constitution was written to protect our rights from our government, not to infringe upon them. Now is the time to allow the citizens of Seminole County to make their own decisions on what is best for them and their own families. For those still wary, let them wear a mask and social distance. For those who have had the vaccine or have had the choice to be vaccinated, let them decide for themselves on what is best for them and their family. And for our children, who we all know are not affected by this virus, I beg you to let them be children again. Our children need to be allowed to breathe freely. This starts right here, right now. Thank you.
Thank you, Kelly. Next is Debbie Suarez, followed by Karen Miller, followed by Michelle Burrows. Ladies and gentlemen, we've been going for 2.5 hours. We've got 3, 4, 5, 6, 7, 8 left. Does anybody want to take a break, or do we want to keep going?
I don't think he was asking y'all.
That's because you guys can go to the bathroom.
With all due
when you
respect,
need
all of
to.
you can get up and walk out and you know, not miss anything. I mean, I want to make sure that we all hear it. I just.
Take 10.
Can
Take 10.
we just, I need a potty break.
Okay, we're going to take 10 minutes.
I'm so sorry.
4:10, we're going to come back.
Okay.
Thank you very much, everybody.
Those who don't.
All right, if I can kind of, people outside, they can hear me also? Yes?
We're broadcasting outside.
Yes, okay. So I'll just let everybody know what's going on. We still have a number of speakers. After the last speaker, and people are still bringing up cards, to be the last person to speak, I guess, but I'm not doing that. I'm shuffling all of the requests. After we do the speakers, there will be, we have a motion and a second on the floor. That will be debated and either amended. Questions can be asked by the five of us, of two others, both staff as well as individuals. There can be amended. There will be a vote. If that passes, then that will be what is decided for today. If it does not pass, other motions can be made. So I just want everybody to know where we are right now. We have about 10 more speakers. Most of you have been really good about keeping your comments concise, and I do appreciate that, and all of us appreciate that, I think, and we've given everybody the latitude to finish their thoughts. So with that, we've got three people on, Debbie Suarez is up, followed by Karen Miller, followed by Michelle Burrows. And is everybody ready? And here's another.
This is 34.
Okay?
They're only written.
Thank you. Oh, by the way, we have a written comment that has come in since that. It is from Diane, and she says, I saw the ages of the panel represented here today. They are all my age or older. Did we forget the science we were taught in school? And with that, we will move on to Ms. Suarez.
Hi, everyone. Last year, after saying that the masks were no longer necessary, and then said, sorry, my name is Debbie Suarez. I'm from Altamont Springs, Florida. Okay, so last year, when I heard Dr. Fauci say that the masks were not necessary, and then he did a 180 and suddenly they were, I knew right then and then that the mask situation was going to be used as leverage for the vaccinations when they came around. And I was right, because I'm a genius. And I wanted to give you my testimony so you would at least have a sort of a case study regarding masks. Last year in September, my household came down with COVID, my sister's household as well. We were all wearing masks, and we all got COVID. I was quarantined in my bedroom. My sister-in-law, who lives with us, and my brother, she also got COVID, and she was quarantined in her bedroom. My brother, who slept with her the entire time, never got COVID. He works outside in the sun all day long, never once got COVID. My elderly parents living with us, who were taking care of us, by the way, never got COVID, even though my mother has Alzheimer's, she's a comorbidity, never got COVID. My sister's household, she and her girls got COVID. My sister, who has two comorbidities, she fared the best in the house. My 21-year-old niece, she recovered in 3 days. My 30-year-old niece fared the worst. And she took hydroxychloroquine, which was that easy to get, by the way. She took budesonide by inhaler. It was difficult to get, but we got it, thankfully. And she fared the worst. Why? She was the lowest in her vitamin D. And this was proven through lab work. Everybody else had optimal vitamin D, and she didn't. And she suffered the most. And I'm here to tell you that my heart goes out, and it has for the last year and a half now, for all of these healthcare workers and the hospitals and everything they go through. But I knew last year that they're not applying the right protocols. One thing is to get COVID An entirely different thing is to treat it. And the way that it's being treated is so counterintuitive. I have a friend, and her neighbor, who's in his early 70s, who was diagnosed with COVID, was told to go home and ferret, just not even take lemon water. He wasn't told to do anything. He went home, and he had diabetes, and he died not too long after. So the way that it's being treated and the way it's been handled is so poorly. And believe me, there are officials in government right now. I'm not going to mention Dr. Fauci because it's so obvious, but these people, they have blood on their hands, literally. Let me just say that it's been proven now that there is a correlation with low vitamin D and coronavirus. And nobody, apparently, Dr. Fauci takes, just take 20 more seconds. Dr. Fauci came out saying that he takes 10,000 IUs of vitamin D a day. Why hasn't that been told to everybody? Why hasn't that been blasted from the mountaintop? Please make sure that your vitamin D is optimal. But how can it be optimal if you're quarantined at home? So a lot of the things that we've been told are counter health practices. And I think that it's fair to say that one of the reasons we have fared better here in Florida is because we are lovely and, we have the sun, we have the air, we're able to take advantage of that. A lot of the people up north, do not have that ability as much, especially with the winter months. Anyway, I beg you to please rescind this mask mandate. From personal experience, I know that it doesn't work. Even with the mask, we still got it. And the things that have happened as a result are much worse than any positive measure that we could have expected from it. Thank you.
Thank you. I just want to also, I failed to mention, we are also, as we all know, showing this video, and people can see it online. We have, at the current time, 6 hands raised to speak on that, so there's more than just the 10. Just wanted everybody to know that. Okay, we have Karen Miller up next, followed by Michelle Burrows, followed by Jen Ferguson. And by the way, Mr. Johnson, you just gave this to me. Yes, sir. I don't have an item, but I'm assuming it's on this issue. Thank you very much, sir. Okay. Yes.
Hey there, I'm Karen Miller from Oviedo. Thank you, Amy, for protecting our parental rights. I got to meet some of you on the break, and it was refreshing because I met Bob, and he's my guy in my area. It makes you look like real people, like us. Like, I'm only here to fight for my children. I'm pretty desperate. Every day for every year, I put a mask on my little kids. They're 9 and 11, but I feel like it's taken a toll. And years down the road, I don't want to be like, that year that I put you in the mask. I just think they need to see smiles and other kids' faces. I feel like I'm the parent. I should be making every single health decision for my kids, not the government. Florida Education Commissioner Richard Corcoran asked that districts revise their policies next year, which is in the next 3 months, in August. But I'm not sure why not now. And these doctors, they did say their point of view, but there are tons more doctors that say that the mask hurt our children more than they help. So I'm asking to let us with healthy children make our own choices. And Mr. Dowlery and I, we came up with a little something. He told me to just throw it out there to you. Since COVID affects this agent up pretty much and this agent down pretty much, why not leave our kids alone and maybe take the mask off at least our kids in schools, because I can fend for myself. You know, I go out in the real world, and it's not a problem for me not wearing a mask or whatever, but my kids, I can't go to school with them and defend them. So if we could just maybe take the mask off the people who aren't affected, and maybe that's a negotiation that we could, you know, go through. So thank you so much.
Thank you, ma'am. And if I don't get the chance to say it again, thank you to all of you for being here today. I really do appreciate it. Michelle, and I think all of us do, that you've taken the time to do this. Michelle Burrows is next, followed by Jen Ferguson, followed by Nicole Carrero? Yeah.
Good evening, guys. The school board knows me personally. This is my first time coming and approaching you guys because I felt welcome for the first time ever. I want to touch on what she was saying earlier. I don't remember your name, I'm sorry.
Karen.
But she did mention something very clear, and a lot of people haven't said this. There's a lot of us that have religiously worn these masks. I'm sorry, I'm in Oviedo. We religiously wore these masks in the beginning because we didn't know. My husband is one of them and was an emergency worker. He got COVID. He has asthma. It was very bad symptoms, but we were able to bring up his vitamins. I treated the symptoms as such. I did sleep with him every single night. Never caught COVID. Probably got the antibodies. Maybe I was, asymptomatic, as they say. My kids, more than likely, were probably in contact with us as well. None of them have had COVID. I think it's really funny that we say that we have to vote to end the mask mandate when none of us voted to have it actually, put it in. This is how silly this mandate is. The N95 masks, which are far more effective than what 99% of our, population wears right now, only filter 0.1 microns. The virus itself is 0.08 to 0.12 microns. So even if people were wearing N95s, you got a slim chance of possibly filtering some of that out. Yet, most of the people that I know, they wear cloth and surgical masks, which aren't even rated to filter the largest molecules of the virus. Would you wear a cloth face mask, a condom, to prevent pregnancy or STDs? I mean, common sense there. The commissioners in this room were elected to protect us from the government overreach. Instead, you closed your eyes and covered your ears to the people. You've restricted all the citizens of Seminole County based on solely on those you've chosen to listen to. Only selected professionals in the community. Ones who push the agenda of the experimental genetic shots, not vaccines, and cloth face coverings that do successfully filter a virus. Do not successfully filter a virus. Even though many of us have presented you with alternative evidence of the ineffectiveness of the mask, including respected physicians, instead of focusing on vitamin D, vitamin C, zinc, diet, and exercise, which are proven methods of combating this virus and building up the immune systems, those are the doctors I choose to put my trust in. We will see the negative impact of these ridiculous mandates for years come masks that flat out do not work. A mandate is not law. Laws have procedural processes to go through before they become law, and then they can be enforced. Your mandate doesn't mean anything in the court of law, and the Florida governor will not endorse penalties given by any county on the mandate. Ordinance made by the counties are unconstitutional. The freedoms of the people have been taken. When any government official makes statements that it's recommended, it means it cannot be enforced. Masks and vaccines should be a choice I make with the guidance from my doctor. This should be an individual choice for everybody in the county, including the parents, the students, the employees, etc. If you wonder why many people aren't running for the vaccine right now, look at one simple study back in the history called this Tuskegee study experiment on the black people that put syphilis in them for over 40 years because they thought they were taking free medical treatment from the government. If the virus is so deadly, why are there not hazardous waste baskets out there for our masks?
Jen Ferguson, followed by Nicole Carrero, followed by Christine Christina Ernst.
Good afternoon, Jen Ferguson. I live here in the community in Sanford and have a business in Lake Mary. I am a mother, a wife, a business owner. I've been in Seminole County since 2002. I love this community, and I've been in front of you guys and like organizations advocating to keep Seminole County the great place that it is. The survival rate of COVID is 99.7%. We have less than 1% of our population that's being affected by this, and the 99% that are being impacted by all of these things. The cure can't be worse than the disease. I have a 11-year-old daughter, and she's been going to school, thankfully, at the Master's Academy. And she has to wear a mask all day long. And she never had headaches before. She has constant headaches. And I believe a lot of it is just that restriction of air. So many great things have been said, and I don't need to take up the full 3 minutes. In business, I'm a business owner. You look at the risks, you look at the rewards. There hasn't been enough rewards by implementing this mask mandate. It doesn't work. So I just implore you to listen to everybody. I've also sent in studies to everybody on the board for them to review as well that talk about the masks. And I'll also address that the experts, while they were really pro-vaccination, or what I call the injection, they weren't pro-mask. They didn't defend what we're talking about today. So I would just ask, please, rescind this and rescind it now. Thank you.
Nicole, followed by Christina, followed by PJ, P-I-N-H-E-I, yeah.
Hi, my name's Nicole, and I'm a Seminole County resident, and as a registered nurse, I have read every study I could get my hands on, ones that support masks, ones that don't, and I'm here in support of Amy Lockhart and rescinding the mask mandate. I know people worry about the risks, but the truth is, for as long as there have been humans, there have been diseases. We have always been human vectors of disease, and we have always carried them symptomatically and asymptomatically. It's time to acknowledge this scientific truth. It's time to follow the science and get back to normal. It's time to uphold our liberties. Every day we take risks. We get in our cars where we can be killed. We eat processed food and slowly kill ourselves. We drink coffee, which causes inflammation and illness, and we choose inactivity over exercise. These are all real risks to our health. Yet, I don't see our legislators mandating the foods we eat and our exercise. We can't ignore the statistics that show that those that live an unhealthy lifestyle are more affected by this virus. We can't make mandates based on health while ignoring the statistics and science of this disease and what true health really is. To do that is nothing short of hypocritical. Before 2020, every day we walked amongst people that are carriers of MRSA, strep, hepatitis, and many other diseases, knowing that illnesses have always existed and knowing that we are responsible for our own health, and it is not the government's job to mandate our health. When our government mandates our health, it lends itself to corruption, and it leads to issues such as discrimination against those that cannot wear a mask, as I have experienced with my own child many times over. No parent should have to fight against discrimination for their child to participate in society or to receive an equal education. Sorry. A healthy society believes in health education and takes responsibility for their own health. It's not American, socially acceptable, or even healthy to demand others to cover their noses and mouths and risk their own mental or physical health for others. This is an entitlement that others think they have because they are fearful and disguising wearing a mask as selfless. Let's be honest, at the essence of wearing a mask, there is fear. Fear is normal. It is not normal or acceptable to expect others to live in their fear. Let's focus on the unbiased science of all of the doctors, scientists, psychologists, and even Fauci himself. The studies show cloth masks have risks of bacterial infections, are ineffective against viral SARS, and that asymptomatic spread is statistically insignificant. Fauci himself said that masks only work to help people feel less fearful, and he even stated that there are unintended consequences when people fiddle with their masks. By that, he meant cross-contamination, which increases the rates of infection. Psychologists have shown that masks adversely affect our kids, causing high rates of anxiety, affecting their speech, social, and emotional development. Reading faces and being able to develop empathy is not only healthy, it's imperative to a mentally healthy society. Sociopaths are those that did not develop empathy, which is a learned behavior with a very small time frame in which to develop it. Masks impede the development of empathy. Our kids need to see faces to have a healthy society and future. Making mandates on unsettled scientists when there could be unintended consequences is dangerous. It's not your job to mandate something under the narrative that we are getting back to normal, all while preventing us from getting back to normal. Not wearing a mask is normal. Everything else is emotional manipulation, which is not scientists or good legislative policy. It's your job to serve us and uphold our rights. And at this moment, our rights to liberty and ability to move freely are being stripped, especially for those with disabilities because of discrimination. It's your duty to uphold the freedoms that our men and women have literally fought and died for. Bodily autonomy is at the essence of freedom. If we cannot make our own medical choices, where does the buck stop? Will the next choice stripped be vaccines, or else we will be held hostage to our masks? No one is taking away a choice to wear a mask or get a vaccine, but manipulating science to take away bodily autonomy is immoral, unethical, and un-American. Do the political thing, or don't do the political thing, do the right thing and remove our masks today.
Okay, we've given a lot of latitude to some people to go, not just 3 minutes, but way over the 3 minutes. Please, let's try to maintain as best you can. Christina?
My name's
followed by, I'm sorry.
Sorry.
PJ, followed by Mike Johnson.
My name's Christina Ernst. I'm from Oviedo, Florida. Good afternoon. I'm here in support of ending the mask mandate immediately. For the past 9 months, I've emailed the commissioners routinely, asking for what parameters were in place to end the mandate. Never did I receive a response with those details. It's obvious that I didn't receive a response because goals were never set. How does an emergency mandate get placed without the goal to overcome it? How is an emergency 9 months long? We, the people you serve and represent, have demanded answers. No employer would allow their employee to skim through 9 months without providing proper explanations. In fact, they'd likely be fired. Why should you all be held to different standards? It is imperative during these times of chaos that you provide your constituents with the utmost clarity, and you have all failed us. It's time for the government to stop interfering with our daily lives. You don't mandate what food or vitamins we should intake. You don't mandate how much exercise and sleep we should get every day. And you shouldn't be able to mandate what we do with our bodies. Government is responsible for providing services that individuals cannot effectively provide for themselves. We are fully capable to decide what is best for our health. It's time for the mask mandate to end, for us the people to decide what is best for ourselves. It is not the government's responsibility to keep people safe. It's the government's responsibility to provide accurate information. And it's the government's responsibility to stop feeding the fears of individuals.
BJ, followed by Michael Johnson, followed by Amber Carroll, followed by Mariana Reyes.
Good evening, Commissioners. JP Pinedo from Sanford, Florida. First, I'd like to thank you, Amy, for putting this item on the agenda. It's very important to all of us in Seminole County. I wasn't really prepared to speak fully on here, but listening to, the experts that you guys had on, that Mr. Alan Harris brought on, had all these charts and beautiful data, but there's also a lot of data out there that I myself as an engineer just siphoned through the COVID dashboards And there are schools across the state of Florida, and even some in Seminole County, that have masks optional for the past school year. And if you look at the data from those schools, for the better part of the whole school year, the COVID cases between those schools that have masks as optionals and not mandated in Seminole County for some private schools, as well as other counties like Highlands County, Okaloosa County, and some other counties, they're comparable. There is no statistical significant difference between COVID cases at those schools compared to schools with really strict mask mandates like public schools in Seminole County. So I'd ask, the epidemiologist and Alan Harris, the data is available. Just look through the dashboards, please, and, siphon through that, and you can correlate masks or no masks. There is no difference in COVID cases at our schools. We really need to remove the mask mandates for our children. I have children in Seminole County schools, and I'm here for them. I can't stand still and not speak for them. And also, you asked about credentials. I'm just an engineer. I'm not a doctor. But we have had Governor DeSantis convene some health experts, right? We had Dr. Scott Atlas, Dr. Jay Bhattacharya, Dr. Martin Koldorf, who's an epidemiologist, professor of medicine at Harvard Medical School. Bhattacharya is a professor of medicine at Stanford University. All very esteemed doctors and scientists. And all three of them unequivocally stated that we should not have kids wearing masks in our schools and that these policies should be reversed immediately. So let's not wait till August or, as the commissioner of the DOE recommended, let's do it today. So commissioners, please rescind this mandate. Alan Harris, end this emergency executive order immediately for our children, specifically because they shouldn't be wearing masks in school. Thank you very much.
Mr. Johnson?
Hello, everybody.
Wait.
I just got here because I was running around the county, visited like 10 different businesses and 3 different bars. And guess what? Everybody wants these damn masks to come off. Okay? That's all those are your voters. Remember, Andrew, when I was walking around the precincts with you, you said you would stand up for us. You did. Just a few months ago. Lee, you go way back with me, going back to the church down in Orlando where you're asking people for the first time as a young kid to help you run for office here. And guess what? We still have you here today. Amy, you've been in our homes with our groups. And I encouraged you to run for a higher office, and you did. I'm very proud of you. I'm very proud of you. But now today, we're asking you to do the right thing with these masks. And I just want to make a couple personal comments. A lot of you already know that I worked for the government for 36 years. And we had to get advice from people. We got tons of data. I've seen generals and admirals and colonels take reports and data and throw it in a shit can. They threw it in front of the people that did the data research. That's how much data is worth to me. You know what I'm saying? And to the people that ran our military for like 30-some plus years when I worked in the military, commands. Okay, so here what I was looking at, okay? I didn't catch the history of everything here today. I was listening to it in my car when I was driving around. And I remember one agency I worked for, because I worked for 5 different Pentagon agencies. We moved around a lot. We also had people come from other agencies that came to work for the Pentagon, for DOD. And we had 2 employees that came from NIH. Everybody probably knows what that is today. You know what? We had to let those folks go during their probation time frame, 90 days. So that's what I think about the NIH. They're just regular employees. And being a government employee for years, I used to go to the Capitol Hill, did lobbying for programs. We sucked out billions of dollars for local companies around here to program and keep people employed here. So I know how easy to get money out of senators and congressmen because I did it for a long time. But don't be snowed by bureaucrats, folks, because we were able to snow the people in D.C., 11, a bunch of the guys like John Kane. You know what I'm saying? They were suckers about giving out money. But you guys cannot believe and listen to the bureaucrats all the time. They work for us out here. You know what I'm saying? We voted for you to keep them under control and listen to our advice, not their advice, because they're not always right, How much? 28 seconds, okay. Man, we only had 30 seconds to Tallahassee to talk when we were up there.
I remember those good old days.
Yeah. You do? Thank you for the time, Lee. I appreciate it. But what I'm saying is that I agree with everyone here that we need to move on from this fiasco, because it was designed to get Trump out of office, and we all know that. And all the research shows that. I talk to people privately that you all know personally that represent this county, they'll tell you the same thing in private. Okay, but anyway, try to do the right thing, folks. I love you all. God bless you. Thank you very much. Bye-bye.
Amber Carroll?
Hey guys, I'm not a public speaker and I'm actually shaking, so kudos. And I had no intention of even coming here today, or I didn't write anything, so it's all off the fly. My name's Amber. Okay, so first of all, I echo everything that's been said here so far. I think a lot of people, all my neighbors, are all in agreement. The masks don't work. It's a false sense of security. As was given earlier, I have slightly different numbers, but it's still the same thing. The N95 mask, which is like the gold standard of masks, right? It only does 0.3 microns, give or take, and the COVID virus is at least 0.06 microns. It's smaller than what the mask can handle. We know this. We've seen the guy wearing the mask smoking, the vaping, and you see it coming out all different directions because, as someone stated earlier, it's only meant to keep out large particulates. For instance, a surgeon cutting in, he coughs, well, you don't have a gob of spit going into the wound now. It's not meant for any kind of long-term use, and it's dangerous. We are restricting oxygen flow. We're breathing our own carbon dioxide. And now let's move into the children. That beautiful little boy that you guys are hearing out there, that's my baby. I love him. He's growing up in a strange world because 3 months to 5 months after he was born, people are suddenly covering their faces. And see, babies learn from facial expressions. They do. They see us smile, and they smile. It's literally forming synapses in their brains. So I have my son, and I'm in a grocery store, and someone comes up like, what a cute little baby, and they have a mask on. And he's looking at them, and he's trying to figure out, are they for me? Are they against me? I don't know what they're doing. And it had frightened him in his earlier months. So that's something we're teaching our children. Then we have the younger kids. My little 7-year-old niece goes to a private Christian school that, praise God, I was able to pull my children from 2 years ago before the world went crazy. Because now I get to homeschool my children, and it was before that the mask thing hit, but she has to wear a mask every day to school and take oxygen or mask breaks. So let's think about what that's doing to her. And now when she comes over to visit her Aunt Amber, she's like, I forgot my mask. I forgot my mask. I'm like, honey, we don't need it with me. You'll never need a mask with me because I believe in being able to breathe air. That's one of our rights. So there's that. Also, a sweet lady over here was talking about an abuse situation. I was abused by my mother, who later committed suicide when I was 11. She did some horrible things to me, okay? So the mask is yet another thing. I can't wear a mask, not only because it restricts my breathing, it's unhealthy, it causes the most severe anxiety in me. You would not believe. And it's a form of virtue signaling. If you wear the mask, you're a good person. But if you don't wear the mask, shame on you. You obviously don't care about those around you. What? It breaks my heart to hear people are just wearing masks because they think they're doing the right thing. Because, well, that's what my neighbor would want me to do. They're not doing it because they believe in it. And it's the only real thing that tells us there's any, quote, virus around. Mind you, the flu has been eradicated, apparently. It's all COVID now. But in all reality, that's what this is. We are virtue signaling, and we are saying, yes, there must be a pandemic. Everybody's face is covered. It's absurd, guys. And last thing, the masks are filthy. They're filthy, and we're sitting them on our tables. We go to a restaurant with somebody, they put their mask down. They drop it on the floor. If my kid picks it up, that's the only thing I'm afraid of him touching, because I think he should crawl on the floor and get germs. I'm just saying.
Ms. Reyes, and then another Carroll has just come in, Mr. Joshua Carroll.
My son?
Does he want to speak? Okay. Bring him on in, please.
Hello, my name is Mariana Reyes. This is my husband, Antonio Reyes. We live in Orlando. I just wanted to say I'm against the mask mandate, and it's time to end it because it's not effective to wear it in public, and it's affecting our health, and it's affecting other people's health that I know of, and hurting small businesses, and people are getting discriminated against for not wearing masks, and it's our constitutional rights and they are getting taken away. The reason is to lift the mask mandate. Like, I have a medical condition, and I also have a disability that it's hard for me to wear masks. It's hard for me to concentrate in college. And we are asking you to please end the mask mandate locally and in Seminole County. That would be appreciated, and thank you for your time.
Thank you.
Let me add to this. Here's a mask that we wore earlier today. Back in December, and many of you know us very well, she suffered from COVID and was hospitalized for 9 days over at Orlando Regional Medical Center in Dr. Phillips Hospital. No mask was able for her not to get COVID and not for her to suffer. Please listen to what we got to say here. No mask is going to prevent COVID to come in. We both had it. And I'm sick and tired of people discriminating, especially against people like us who are disabled. If we go to a store, if we have to go anywhere in the county, and in Orange County especially, I'm hoping Jerry Demings and the mayors are listening over in Orange County into this live broadcast. This needs to end now.
That's right. Mr. Reyes, I'm going to ask you to please go out and fill out one of these.
Okay,
Thank you
yes,
very
sorry
much.
about that. Okay.
That's no, sorry. Just
Thank
want
you
to
for your
make
time.
sure. Thank you. I said that I would come back to it. I know Mr. Carroll, Joshua Carroll, you're up next. I'm coming back to Mr. Mike Sawyer. Is he come back? Did he go out to lunch or any place else?
Joshua, you can come down.
Come on in, Joshua. You're next. If Mr. Sawyer's not here, then I tried again. Thank you. Joshua, you're up, please, sir.
Okay, well, I've not prepared a speech or anything like that. I don't plan on speaking for long. I am just as stage frightened as my mom is. My name is Joshua Carroll. I'm a homeschooler. I have 2 siblings on earth, 2 siblings in heaven. I am a strong Christian and strong pro-life activist. And it's a scary world that I'm growing up in. It's a scary world that my 1-year-old brother's growing up in. I have a sister that's growing up in this world too. It's just, this world has, over the past 2 years, gotten significantly worse, to the point where we went from our forefathers fighting for our freedom to now we have no freedom. And the Bible makes it very clear. Jesus said, "My people perish for lack of wisdom." How true is that statement? We have many people that are just, they have no wisdom anymore. They do whatever Fauci tells them to. They do whatever the people we haven't even elected. The CDC is not even a government organization. We just do what they tell us to. And it may not seem like a big stance. It may not. A lot of people say, well, is this mask mandate a hill you really want to die on? Well, yes, it is. Why? Because the little foxes are the ones that spoil the vines. Wow. Everyone catches the big foxes. Everyone's worried about the big ones. It's the little ones that slip under the fence and spoil the vines. And in the pro-life the conversation, you have many pro-choice people that say, it's my body, it's my choice, when in all reality, it's not even their body in that situation. And these, and what happens here? With this, it is our body. That's right. With this, it is our body, and it's still, where is my choice? When do I get a right to walk into Goodwill if I want to without having to wear a mask? And then what makes people 2 and under unsusceptible to it? What makes the people that are up here, thank you for being willing to hear me out, what makes them immune to it when they decide to sit down, they can take off their mask and suddenly they're not worried about the virus anymore? Where does that come from? And there is much more harm to it than there is good. And if the risks outweigh the benefits, then it's not a true cure. if there are people blacking out and passing out, if there are people gaining anxiety issues, if the depression rates and suicide rates are going up, if lack of oxygen is doing things to people, if people are getting diseases from constantly breathing in their own germs and carbon dioxide, where is the good in that for a very, very small, if any, decrease in COVID cases? Thank you guys for hearing me.
Joshua, before you leave, I'd just like to point out that you are a public speaker. And that you have two really big fans in the back, one that I suspect is your little sister that was peeking in the door.
All right, everyone, that concludes the people that have filled out forms. We do have people in cyberspace that wish to speak. So I'm going to ask Clint, if you could bring the first one in. I have, well, it changes from 5 to 6. Now it's down to 4. So I don't know.
It's because they're in now. Julia Roberts.
Okay, so go ahead and bring the first one in, Clint.
Sir, it's Julia Roberts.
All right, Miss Julia Roberts.
Hi, sorry, give me just a minute. I wasn't quite prepared. I've got to pull up my notes. I've been watching you guys all afternoon.
This is just the scene of your, you know, never mind. Very exciting stuff, huh?
Very exciting. Can you see and hear me okay?
Yes, we can.
Okay. All right, now it's the time where we have to be quiet, okay? All right, thanks. All right, so hello, my name is Julia Roberts. I live in Castleberry with my husband and 3 young children. I am speaking to you today in support of rescinding sections 3 and 4 of the executive order regarding COVID-19 and use of social distancing and facial coverings. We have heard, quote, follow the science by those that support mask mandates. Let's go ahead and follow the science. Keeping in mind that the general public is not wearing medical masks in a medical setting, nor are they trained on how to properly don and doff. A study in Oxford Academic Annals of Work Exposure and Health that evaluated the filtration performance of cloth masks showed that they had 40 to 90% instantaneous penetration levels. A poor filtration performance, quote, a poor filtration performance is expected for improvised fabric materials because these materials are not designed for respiratory protection. The WHO, in a review of non-pharmaceutical public health measures for mitigating the risk and impact of epidemic and pandemic influenza, regarding the use of face masks, says, quote, although there is no evidence that this is effective in reducing transmission, there is mechanistic plausibility for the potential effectiveness of this measure. However, this potentially effective measure is not a cost-free social experiment where we have nothing to lose by just wearing the mask. We risk an increase of self-contamination due to the manipulation of a face mask. We also risk self-contamination when medical masks are not changed when wet or soiled, which can create favorable conditions for microorganisms to amplify. The WHO, in an article titled Advice on the Use of Masks in Community Settings in Influenza A or H1N1 Outbreaks, says, quote, using a mask incorrectly may actually increase the risk of transmission rather than reduce it. The CDC, quote, available evidence shows that cloth masks may even increase the risk of infection due to moisture, liquid diffusion, and retention of the virus. Penetration of particles through cloth is reported to be high. Altogether, common fabric cloth masks are not considered protective against respiratory viruses, and their use should not be encouraged. This is just a small sample of literature that proves that wearing masks for the general public is not evidence-based and is in fact harmful. Dr. Husty, what we are doing is not safe. Earlier he said what we're doing is safe. If you will review the COVID-related data from Florida counties with mask mandates and compare the data with those without mandates, you will clearly see that Florida counties with the mandates actually had more cases per capita than those without mandates. If we consider the actual evidence, then there is no reason for you not to rescind the face covering mandate immediately. Even without full uptake of the experimental COVID shots masquerading as safe and effective vaccines, despite no long-term safety data, there is a lot of posturing and pontificating around mandates, but no proof that they are effective. Today, we did not hear any evidence of their effectiveness, just talking points and opinions in the mandates. And I'd like to add, the gentleman earlier spoke of herd immunity exclusive to vaccine uptake, but chose to ignore that a large percentage of the population already has natural lifelong immunity from either a SARS-CoV-2 infection or a previous SARS infection that they had recovered from. That also needs to be considered. Thank you for your time.
Thank you, Ms. Roberts. I appreciate it.
2 minutes and what, was that like 58 seconds? That was pretty impressive. Very impressive.
Thank you very much.
Thank you.
Clint, next.
Yeah, we have Peter Vasquez.
Sir, we can see you. Well, now
Hi,
we
can you
can't.
hear me?
Yes, we can.
My name is Peter Vasquez. I live in Longwood, Florida. Thank you for this time, and thank you for all the other citizens. It's great to see a lot of like-minded people out there. I've listened to a lot of the comments, probably most of them, and just wanted to say, you know, at this point, you have all the facts, you have all the data. There's no study showing the effectiveness of the mask. One thing, we ask you for the data to make such a decision. And I wonder if you're asking the scientists and doctors for the same data. I mean, you're basing your decision on, I don't know what, just on, you know, what Dr. Fauci says. But who's asking Dr. Fauci where the studies are? And if you're making your decision based on that and it's affecting our population, then I think, you know, you have a responsibility there. So one thing is, I have 5 children, and my biggest concern is for those children. My 11-year-old autistic son is scared. He's got a lot of anxiety, as you can imagine. You know, having autism to begin with. Seeing facial expressions, not sure what that means to him. But, you know, this has just affected him, affected my daughter, who's in elementary school as well. I have 3 other children who are not in school yet, but, you know, we can't go out in public and just enjoy ourselves. If you take nothing else away from this, think of the children. If you want to put the mandates on, you know, people ages 18 plus, you know, I don't know if that's even the right answer. I don't think it is. But you have to think of the children going to school and what this is doing to them. You know, there's no effectiveness in the mask mandates. It is not reducing risks. It is not reducing the spread. You can take 2 states, 2 municipalities, what have you. One has a mask mandate, the other one does not. Look at the data. Just look at it. And, you know, speaking of the data, we constantly see positive test results. We constantly see death. But what I'm not seeing, and maybe there's a reason we're not seeing it, is how many of those positives are go into a critical condition or severe condition. At this point, we should have that data, but that's not being told. It's just, here's your number of deaths, here's your number of positives, and then beyond that, we're not seeing the demographics behind it. We're not seeing, okay, well, 65 plus is the majority of this data. Well, what about all those people under 65? If you want to put a mandate 65 plus, okay, maybe that'll work. But I think that you're doing it the wrong way. And, Mr. Zembauer, you had said something about 50% vaccination rates. I think if you did that for the 65 plus population, that might be okay. But, anyone under the 65 with no comorbidities, I don't know why you would even get a vaccine, especially one that they're just testing out. I mean, you see an 18-year-old woman who died from it, and they probably would have had no effect from the virus to begin with. So anyways, thank you for your time. I know you have a lot to consider, and I respect each one of you. You're all leaders. You all chose to be elected and to be in this position, and you have a lot of hard decisions to make, especially during this time.
Thank you very much, sir. Clint, next.
We have Christine.
Hello, can you hear me?
Yes.
ma'am.
Okay. Can you see me and hear me now?
Yes.
Okay, thank you. All right, my name is Christine Lyons. I've lived in Oviedo for 25 years. I'm a wife and a mother of 2 grown children. I'm asking you to rescind the mask order immediately, and these are the reasons why. So, number 1, the mask order is unconstitutional. It clearly violates our First Amendment right and our fundamental right to privacy and bodily autonomy. No law is valid or lawful that violates the Constitution. No health order, emergency order, state of emergency, or municipal ordinance may suspend or violate the Constitution, period. The Constitution doesn't give us rights. We are born with God-given inherent rights, and these are the right to life, liberty, and the pursuit of happiness. We have the right to life, and life requires oxygen. Therefore, no law or no order that requires us to restrict our breathing is lawful. Secondly, the masks do not stop any virus and actually cause more harm than good. A lot of people have spoken to this fact today, and it is true. I have been researching this since this whole thing started, and it is an absolute myth that the masks prevent viruses from spreading. Okay, the virus is a 0.1 micron. That the surgical masks filter out 0.3 microns and higher. So you do the math. I'm very grateful, and I praise the Lord that the Commissioner of Education, Richard Corcoran, I'm not sure how you say his last name, he sent a memo to all the school districts, superintendents, asking for the mask policy to be voluntary for the 2021-22 school year since, and I quote, he says, data shows that the district's face covering policies do not impact the spread of the virus. And the other thing is, kids don't get the virus and they don't spread the virus, okay? The age group of 0 to 19, they have a 99.997% survivability rate if they ever even get COVID, okay? And then there's been several studies that have researched this, and they found that kids don't pass on the virus, and they're basically a stopping point. If they do get it, they're a stopping point because they get over it like that, and it's done. Okay, so masks are intended for the ill, not the healthy. Healthy people should never be wearing masks. In fact, prolonged mask wearing actually decreases the body's natural immune response. People tend to touch their faces much more when they're wearing a mask. In addition, we end up rebreathing particles that our lungs have exhaled, whether it's pollen, dust, virus, or bacteria particles. They are trapped in the mask, and on the very next inhale, we breathe them back in. And this gets deep down into your lungs. It can cause pleurisy and Legionnaire's disease. The masks are not allowing carbon dioxide that we exhale to fully dissipate. So in every inhalation, we're breathing back in more carbon dioxide. And this creates oxygen deficiency and a flooding of carbon dioxide. The human brain is very sensitive to oxygen deprivation, and that's what these masks cause. The acute warning symptoms are headaches, drowsiness, dizziness, issues in concentration, and slowing down of reaction time. The face masks do not block human-to-human transmission of viral and infectious diseases such as COVID-19 or SARS-CoV-2, which is the virus that causes COVID-19. Wearing face masks causes substantial adverse physiological and psychological effects. These include hypoxemia, hypercapnia, shortness of breath, increased acidity, toxicity, activation of fear and stress response, rise in stress hormones, Alzheimer's disease, fatigue, headaches, decline in cognitive performance, immunosuppression, chronic stress, anxiety, and depression. Long-term consequences are health deterioration, accelerated aging, and premature death. By requiring your citizens to wear a mask, you're promoting the idea that the mask can prevent or treat a disease, which is an illegal, deceptive practice. It is unlawful to advertise that a product or service can prevent disease unless you possess competent and reliable scientific evidence substantiating that your claims are true. That is why every box or packaging that the masks come in have a warning on them that says the mask does not provide any protection against COVID-19 or any other viruses. Misrepresenting the use of a mask as being intended for the use as infection prevention or reduction is a deceptive practice under the FTC. As such, forcing citizens to wear masks without the wearer's consent is illegal and immoral. It needs to stop now. It's dehumanizing.
Christine,
must
you've
be
gone
free-
way, Christine, you've gone way over. Please, can you wrap it up a little bit?
I'm almost done. It's the free decision of every human being whether they want to wear a mask that is absolutely ineffective to protect themselves from a virus. Considering the many ill effects that mask wearing causes and contributes to, clearly outweighs the perceived benefits, if there ever were any, I strongly support the rescinding of the face mask order. Thank you very much for your time.
Thank you very much, ma'am. Clint? Next.
Yeah, we have Drake.
Hello, can you hear me?
Yes, we can.
Yes, sir.
All right. Hey, good afternoon, commissioners. I know you folks are going on 3.5 hours now, so I appreciate you bearing in there. You folks are soldiers. My name is Drake Wirtz. I'm a resident of Altamont Springs. I'm a husband. I'm a father of 3. I'm a volunteer in our community, and I'm a leader committed to fighting the evil of human trafficking and child exploitation. Thank you, Commissioner Lockhart, for bringing this issue to a vote. You have a backbone, you have common sense, and your courage will be rewarded. I'm proud to live in Seminole County. I'm proud of the values that our county stands on. However, the draconian measures, the micro-tyranny, and the overall harm to our children that this commission has allowed by continuing this mask mandate is inexcusable. When the science has come out suggesting that masks were harmful and ineffective than originally thought, you chose to continue forcing citizens to wear them. My family and many others, we simply do not comply. We recognize tyranny. We know when to push back against it. We know that our rights do not come from the local government. Our rights come from Almighty God. God gave we the people inalienable rights, and we entrust you as our elected commissioners and our elected officials to protect those rights. I'd also like to remind you all that all 5 of you are Republicans. Real Republicans defend liberty at all levels. You received the vote of conservative patriots in Seminole County because you had an R next to your name on the ballot. But make no mistake, if you don't end this nonsense and start trusting your constituents to take personal responsibility by making their own informed decisions, you will not get reelected. There will be a recruit of freedom-loving Republicans that will replace you. Commissioner DeLaurie, I would like to turn my attention to you, sir. You've been a strong advocate for victims of human trafficking through your work with the Lifeboat Project. I commend you for doing so, sir. Continuing this mask mandate only puts vulnerable children at risk of being preyed upon by traffickers and predators. Nonverbal cues are often a first sign of distress in identifying potential victims of human trafficking. Sorry, I'm getting emotional. Forcing and normalizing face coverings only makes it easier for sex traffickers to target kids in our community. Protect Seminole County children, Commissioner DeLaurie. And I would like to close with the 30 seconds that I have by calling for the immediate resignation of Emergency Manager Alan Harris. He is an awful leader. He is not an elected official. He has no business playing the role of a dictator to the people of Seminole County. God bless you all. God bless the great free state of Florida.
Very much. Ladies and gentlemen, it's one thing to clap and everything, and I've asked, before not to. I could see that you weren't going to listen to me, so I did. I just, I'm not going to cause any scene for either side, but please, Mr. Harris has worked hard for all of us, and whether you agree with him or not, he doesn't deserve that kind of treatment.
Well, this commissioner, for one, is not going to sit here and listen to our staff be attacked. You can agree to disagree with that individual. He's got a job to do to protect 480,000 residents in this community. You may not agree, but show the man some respect.
Okay, next person. All right, next person, please, Clint.
Kathleen?
Hi, Kathleen Wallace, Winter Springs.
Kathleen Roberts?
Wallace.
I'm sorry,
Mr.
people are
Chairman, I
talking.
can't hear what's happening.
Everybody, can you please, thank you. Kathleen Wallace, go ahead, ma'am.
I would like to thank all of the commissioners for sitting here and listening to everyone. However, I must admit, I have a difference of opinion. I really appreciate the mask mandate. I feel safer with it. And I also, it was funny because I already had this in my little thing, was I appreciate Seminole County Emergency Management. They've done great on the vaccines and it's been very efficient. And I want to commend them on that. And it's really, just a coincidence. Anyway, the reason I would like to keep the mask mandate in is if I'm wearing a mask, it doesn't mean that if somebody's infected, I may still get it. But if the person who is infected is wearing the mask, they will have a lesser chance of spreading it to me. So when I walk around the grocery store with people all masked up, I feel a lot more comfortable in getting my groceries. However, when everybody is not wearing a mask and I'm the only one wearing a mask, they are not as effective. And I've been sitting here on the internet fact-checking some things, and they said respiratory droplets are expelled into the air when affected people cough, talk, sneeze, or breathe. These droplets quickly evaporate and shrink to become tiny airborne particles. But if an infected person is wearing a mask, it would catch and contain the larger droplets in the humid space between the person's mouth and the mask. In this environment, droplets take nearly 100 times as long to transform into airborne particles. So masks reduce the spread of infectious particles. We keep forgetting that in our country, 572,429 people have passed away due to the coronavirus. This has personally hit me with one of my friends who visited with her daughter who was not a mask wearer. So she went other places and had no problems. So this is a personal thing for me. And we were talking about the respect of others. Well, if you wear a mask, you are respecting others. If you refuse to wear a mask, you are not respecting others. So that's how I think we need to go on. So I appreciate all of your time, and I appreciate getting vaccinated. I have my 2 vaccines, and I appreciate Seminole County for what they have done in that. Thank you for your time.
Thank you. Clint, next.
I have no other hands.
Okay. We have no other hands. We have no other cards. We have a motion. Do we have discussion and debate? Anyone? Commissioner Lockhart.
Chairman, we do have another hand that
Now we have another hand.
Okay.
All right. For those out there, if you don't have your hand raised after this person, we're going to close the public hearing and go in, or close the public comment and go into discussion and debate. So next. I see 2 hands, Clint. Which one are we going to bring up?
We have Leo.
Leo? Leo?
Disappeared.
Leo.
Clint, go to the next person, see if Leo gets back in or learns,
He's mobile.
Leo, is that you? Okay, you're still on mute, Leo, if that's Leo.
Says he's unmuted.
We're not hearing him. He was talking.
He may not turn on his audio.
Maybe we go to the next one.
Yeah, that's what I just said. Okay. Leo, we can't hear you, I'm sorry. So I see your lips moving, but we can't hear you. Can we go to the next person while Leo's working on his computer, please?
Yes, sir. It's Catherine.
Catherine, you're up, Catherine.
Hi, can you hear me okay?
Yes, we can.
Okay. All right, my name is Catherine Maluda. I'm a Seminole County resident. I would like to address the comment from the person that just spoke in regards to being pro the mask mandate. If you've already been vaccinated, why do you still need a mask? It seems counterintuitive to me. So I just wanted to bring that point up as it seems to be missed. I would like to address the fact that I have watched this for the entire time, except for a short period. And Mr. Constantine and a few other commissioners, as I watched this meeting, you listened intently to the doctors speaking and told the public to be quiet. When the residents started speaking, you got very busy doing other things at your desk to the point the residents had to point it out. If you can give the doctors your time, your residents deserve the same respect. That shows us exactly where we stand as a community. At this point, you may as well say that you do not care how your residents feel. I absolutely agree. Those that have spoken out have been bullied more as adults than ever before, as it's been personally attacked to me. I am requesting, along with many other residents in Seminole County, to rescind the mask mandate unnecessarily in place. It is not this board's duty to bully residents to get a vaccine to remove a mask mandate that should have never been in place to begin with. If people want to get a vaccine, they should, but it is up to the individual, not to get to a 50% vaccination rate. Vaccine locations are not busy because people who want to get the vaccine have, including those that are 16 and up. Leave the rest of the residents alone if they do not want to get vaccinated. Stop trying to push them to do it. I also believe the only change to the current request is to expedite the rescindment and make the order effective immediately. My grandmother passed away at the age of 93, not due to COVID, due to the fact that she was depressed because she could not be with us. She was in assisted living and they would only let us talk to her from her window. We had a great relationship prior to them shutting down her facility for COVID. So from March to October, she significantly declined. Before that, she was a coherent, healthy woman who would come to our house and visit us. I don't spit when I talk. I cover my mouth when I sneeze or cough with my elbow, such as we learned and my kids learned in school. I do not need a mask to have common sense. If I am sick, I stay home. That is the expectation and always has been. If this was such a concern, why wasn't there a mask mandate in place to fight the flu? Because they don't work. You are purposely perpetuating the situation by choosing to focus on a virus with a 99% recovery rate. Dr. Eckenberm said the younger generation is where the positive cases are coming from. Although these kids are wearing masks all day unnecessarily and barbarically at school. What is the younger generation that she is referencing? Is that the kids that are stuck in a mask all day at school? Because my daughter has been quarantined twice and she has to wear a mask all day. It makes no sense to me. If the mask works so well, then why have the mandate in place? Why are cases going up? It has almost been a year since the mask mandate has been in place. I would question this to be a scare tactic. Being positive with COVID is not a death sentence, so stop using it as a tactic to scare people. Seminole County is clearly bored, and having this mandate in place makes you feel in control and in power. You are not doing what's in everyone's best interest. This has turned into a political play. People should be allowed to make choices for themselves. That is not your place. We will take recommendations from our own doctors, not yours. You have your doctors and nurses with opinions, and there are many others that have a different opinion. Of course, you would only bring doctors to the table that agree with your stance. There are plenty of other counties that do not have a mask mandate. There is no proof masks work. End the mask mandate today. Thank you.
Thank you, ma'am. I'm just going to say, folks, we've had 36 people speak after I think it was 6 or 7 people that spoke before. We had 36 people, to this point that have spoken. I made eye contact and listened to every single one of them intently, and so did every one of these other members. So to say that we weren't listening to you, I think you all know that are here that we were. And so I'm sorry, ma'am, that you think we weren't watching from television or wherever you're watching from, but we were listening to every single person here and have tried to intently take in every single thing that has been spoken today. And I just needed to say that. Okay, we have more people that wish to speak. Next, Clint.
We have Barbara.
Barbara Martin. You're up, please. And Leo, we're going to still try to get back to you. Barbara? Looks like you're on. We can't hear you though. Okay, Clint, let's try to get the next person, please.
Okay, we have Nancy.
Nancy? Is that Celleri?
Oh, there we go.
There she is. Nancy? We can't hear you. Your mouth is moving.
Can you hear me now?
Yes, we can. Yes.
Okay, great. My name is Nancy Celleri, and my credentials are RN, BSN, WCS. I am a mother, a grandmother, a registered nurse with 40 years of experience in acute care. I've been a resident of Seminole County for 22 years. At this particular meeting, I too am of the minority opinion. Many of my friends who live in the county were unable to be here today. They work 12-hour shifts while wearing masks. Sadly, many mistakenly believe that their constitutional rights are being trampled upon by a public health mandate. But in Jacobson versus Massachusetts, the Supreme Court ruled that there are manifold restraints to which every person is necessarily subject for the common good. Otherwise, organized society could not exist with safety to all its members. The protection of our constitutional liberties, therefore, rides on the assumption that the exercising of these rights must not endanger others. Do we not wear federally mandated seatbelts? Should we rather just encourage their use? Are we not prohibited from smoking in offices, hospitals, schools, etc.? Should we rather just encourage restraint? Is it really our constitutional right to decide? I think not. These mandates, if you will, for indoor use are in place for the general good. Last week, according to the CDC, over 5 million Americans have skipped their second dose of the vaccine. This means it's going to take us that much longer to achieve herd immunity. Meanwhile, more and more variants are emerging around the world and around our own country. Alarmingly, increased numbers of children are becoming infected. As of April 15th, they represent 20.9% of newly diagnosed cases across the country. Over the past 2 weeks, there was a 5% increase in children. It is already concerning that the Commissioner of Department of Education wishes to make the use of masks voluntary in schools while we are in the middle of a pandemic in which children are not yet able to be vaccinated. Our kids deserve a community that operates under the guidelines of best practice. Persons with medical conditions may obtain an exemption from their doctor from wearing a mask. As more adults become vaccinated as a matter of survival, the virus will target those who remain susceptible, and this will soon just be our children. Similar to the principle of herd immunity for vaccination, the greater the extent to which intervention is adopted by a community, the larger the benefit is to each individual. Lacking a vaccination, masks, proper hand washing, social distancing, good nutrition, exercise, perhaps vitamin D supplementation may all be needed to keep this virus at bay. You're right, people who wore masks have gotten COVID, but look around. How many people are wearing masks below their nose, on their chin, removing them to eat in the restaurant, allowing them to verbalize something that wasn't understood the first time they said it, putting them on and off without first sanitizing their hands? Also, they weren't wearing masks 100% of the time. In February of 2021, JAMA released a paper citing studies regarding the efficacy of masks. It's very easily accessible online. We all were taught, and we all taught our children to cover their mouths when they sneeze or cough. We do this in order that the aerosol spray is curbed. This is what the mask does for us. We would not consult a plumber when we're diagnosed with bladder cancer. We would consult the medical community. That community appeared here today and unanimously agreed that this is not the time to stop using every tool we have in the box to fight this savage disease that has taken 3 members of my husband's family.
Nancy.
During the past national crisis, sorry.
No, I'm just saying, could you wrap it up? You're way over the 3 minutes. Thank you.
I just asked you to vote in conscience and not vote out of fear of not being reelected. Remember our children. That's it.
Thank you very much, Nancy.
Thank you, Nancy.
Okay, next. Sean, I see a Sean Cable. Are you here for the golf carts, or do you want to speak on this?
No, I was just going to, listen, I've been sitting here listening to everything. What can I say that hasn't been said already? But I just wanted to thank Amy for bringing this up. It's been a long afternoon, and I think it was a great job. I'm in favor of it. There's been some great minds in time, Albert Einstein, Graham Bell, Isaac Newton, Thomas Edison, and Amy Lockhart. Thanks.
He wants his golf carts approved later this afternoon.
He didn't want his sidewalks, and he wants his golf carts. Okay, there was 2 people that were having difficulty trying to get in. Do we have any luck with either one of them? I think one was Barbara and one was Leo. Clint, is either one of them still on or trying to get on?
I don't see their hands raised again.
Okay. And I don't either.
Oh, looks like Barbara just raised her hand.
Barbara's back again. Okay, let's try Barbara again. Barbara, if you can get on, you're open. We just need you to unmute yourself if that's the problem.
Yeah, looks like we're still having some difficulty with that. She is unmuted.
I see Leo's hand is raised again. Let's try him one more time. Folks, as much as we'd love to hear from you, it just seems that we're having a difficult time getting you. And it's 5:30 now, and I see that somebody is trying to get in again to speak now.
Last one.
Okay, Miss Owens?
I'm pretty sure you can guess. Okay, hello. As a mother.
Name and address for the record, if you would.
Say again?
Your name and address for the record.
Tia Moya Owens. I live on Mellonville in Sanford. As a mother and as a grocery worker who has been going through this pandemic for a year, we wear our masks all day, every day. For me, in the grocery department, I am there from 8 to 13 hours a day with a mask. And I want it to stay on because I have a mother that's sick. I have a young daughter that can't get the vaccine. I'm fully vaccinated, proud of it, okay? But I don't want to take the chance of the mother that raised me by herself getting sick because people aren't wearing masks, which is what I see every single day at work. And it scares me to the point where the friends that I have that are nurses have me double masking at work to be safe for my mother, who all of a sudden got sick 3 years ago, who had never been in the hospital since she'd had me. And I'm almost 50. And I'm going to take care of my mother because she's my mom.
God bless you.
Okay? Today's her birthday.
Happy birthday.
So I'm asking to please keep it for as long as the CDC says it is absolutely necessary. Because those of us that are in the grocery store, we are working our behinds off still after a year of trying to make sure everything is taken care of for people. And to watch how many people still come in the store with a mask mandate, with signs telling them to put one on, and they completely ignore it. And we can't say anything to them because our company doesn't want us to get hurt because people get attitudes with people. And like I already told them, catch an attitude with me, you catch hands. But again, all I'm asking is that we still have to protect those people who are vulnerable. And until we don't really know where this, they say they know where it came from and how it started, but we don't know what all it's doing. And there's so many variants and everything else. And I just want to protect my family, period. And my child, who will be wearing one whether they like it or not at school anyway. So that's all I had to say. I saw this on the news and I saw where everyone was getting up here complaining about wearing them. And some people complain about wearing them for 10, 15 minutes walking into a store. Like I said, 8 to 13 hours a day, we're wearing them. And trust me, they are adamant about us wearing them. I work in grocery and there's usually only 5 of us in there at 3 o'clock in the morning. But we have to have them on, even though we're in separate parts of the store, because they don't want us getting sick, because people in the store have come in and gotten it. We always get that email, but you'd be glad to get the email because that means you didn't come in contact with them. So, again, just please, to keep protecting everyone. That's it.
Thank you.
And thank you, I'm sorry it was so late, but I was at home.
Oh, we're not sure you're late yet.
No, we've heard from everybody today for the last 4 hours, and thank you very much. We also want to thank, everybody that tried to get in. We're sorry, for whatever purpose, whatever reason you could not get in, Leo and Barbara. But we're going to close now the public comment portion and open this up for discussion and debate. I believe that when we first started, Ms. Lockhart, you wanted to start. Go ahead.
I would, but first, I have some prepared thoughts and comments, but a couple of the things that I've heard that concern me. We keep hearing the word fear, and I've heard folks say that they have been fully vaccinated and they are not only masking, but they are now still double masking, and there's this fear that they may still get sick or get others sick. And I just think whether you are a person who is pro-vaccination or not, these vaccines are showing 94 to 97% efficacy. People are not getting hospitalized or dying from these if they've had the vaccine. It's amazing to me that we're still, I forget which one of you it was that was talking about fear, and I wanted to jump up and say, yes, we're in this fear-based mode right now, and it makes me sad to think that folks who have done the work of getting vaccinated are still so fearful when we have seen in real-world evidence that these vaccines are unbelievably amazing. So that's not on my script. There's no secret where I stand on this. I believe that we're in a completely different place than we were in a year ago. I got a phone call from the county manager last summer. I remember it vividly. I was in Charleston, South Carolina, and there was a discussion about whether or not this was something that the board, that I as one commissioner, would be opposed to, because staff really was feeling the need to impose this executive order. And given all the unknowns at the time, I lent my support, because there was still so much unknown. There were no vaccines. There were no treatments on the horizon. There was so much we didn't know. And I will tell you that it never occurred to me in that conversation and subsequent conversations with our emergency management folks that we would still be here a year later. Because the comments continued to be, this is not something we want forever. Of course we don't want this forever. Nobody wants this forever. You can go back and watch our Board of County Commissioners meetings going back to the fall of last year, and time after time after time, asking about metrics and benchmarks and goalposts. Repeatedly, our team would say, this is not something we want for forever. As soon as we can lift this, we're going to lift this. And so I kept asking, okay, let's talk metrics and let's talk benchmarks. And we just kept hearing, not yet. We're not there yet. We're not there yet. Well, now we're at a place where we do have robust vaccines. Everyone that's eligible for a vaccine in Seminole County who has the ability to protect themselves if they choose to with a vaccine over the age of 16, they are able to get one. As I mentioned, those vaccines are showing that 94 to 97% of people vaccinated avoid serious disease or death. That is phenomenal. Over 170,000 Seminole County citizens have received a vaccine. It's, again, amazing. And due to the great work of our folks in emergency management and the private sector who have come together to put together an absolutely incredible, seamless operation, both at the Oviedo Mall and at points of distribution around this county. They have done a tremendous job. So those 30,000 plus people, maybe a lot more, who have had COVID, because there are so many who are asymptomatic, we don't know if they've had it or not, they do carry some form of natural immunity. And by my proposal, not Mr. Zembauer's motion, but what we talked about putting on the agenda for our last meeting, by June 7th, thousands more residents will have had the opportunity to get their vaccine. And I understand the folks that are saying we want the mask order rescinded right now. I get it, but I also hear loud and clear from people who are fearful that want an opportunity to get the vaccine. So from my thought process and the logic that I established, and I don't know, it was my logic, so maybe it's faulty, but it's mine, giving everyone the opportunity to get the vaccine that wanted it, have their 3 weeks to get their second vaccination, and then 2 weeks for their full immune. That was my logic, right? Whatever. We can't ignore the studies that show that folks who have had COVID retain some level of antibodies. And the more I'm reading, and I'm not a medical professional, but I read a lot, and my reading comprehension's pretty good, I'm learning more and more about the importance of T-cell response, and that antibodies are one thing, but T-cell response is incredibly important. And I've been reading study after study that shows that when we talk about variants, the T-cells are still very active with all of these variants that were discussed. I have a copy of several of the studies that I brought with me. But anyway, they're showing that these antibodies are lasting for more than 8 or 9 months. That's incredible as well. And we'll probably see that they last even longer, but we haven't really been tracking it for that much longer, have we? So we only know for how long we've been tracking. So there's been a lot of talk about the CDC. And the CDC is our federal government's regulatory body that gives advice. And they're tiering that advice. They've been tiering it based on individual circumstances, and there are lots of nuances in their advice. So from my perspective, maintaining a one-size-fits-all mandate doesn't account for that tiered, nuanced advice. It's just intellectually dishonest. It's not in alignment with the current CDC recommendations to have a one-size-fits-all mandate. The CDC has even said, if you are vaccinated and you're with a group of other people who are vaccinated, there is no reason for you to wear a mask. So why do we have a mask mandate telling everyone to wear a mask? It doesn't take into account the fact that 170,000 people have subjected themselves, including myself, to an experimental vaccine. As circumstances change, our focus should be on educating, not mandating. A one-size-fits-all government mandate is not the most effective way to communicate with our community. I don't know how many, many of you have children, but when you sit down and you talk to your kids, whether they're young children or adults or anyone in your family, and you have a discussion and you engage in educating, you get so much farther along than standing over them with a stick and mandating something out of them. It's human nature. It's natural for people to want to be engaged and educated and not be forced to do something. I will tell you, I feel like we have entered the theater of the absurd. The CDC, as recently as yesterday, has made a recommendation that children should wear masks at summer camps. Now, I don't know how many of your kids have been to a summer camp in Seminole County in July, but I'm here to tell you, we have fantastic summer camps, by the way. Shout out to our natural lands folks. Great, great camps. My kids have gone to all of them. And you know what? It's hot, and it rains, and those masks are going to get wet, and they're going to get dropped on the ground, and it's nasty. And to expect young children to wear these masks for summer camp is ludicrous. So I've been all about, follow the CDC guidelines, and until this came out, and then I'm just like, I just can't anymore with this, because it's dumb. So there's been too much fear in our politics and not enough emphasis on the data that's showing the good news. And it's been pointed out today by many people here that it's having a detrimental effect on our community. There's increased depression, anxiety, drug overdoses. We can't ignore those pieces of this puzzle. It was also mentioned today about the Commissioner of Education, Richard Corcoran. So he has requested that all K-12 superintendents take into account this next school year that masks be considered optional. Based on public comments made by our superintendent here in Seminole County, it appears that the school board will be taking that up very soon. And based on his comments, I would say he said he is seriously considering that. You can take what you want from that comment. So removing the mandate, and I'm going to do air quotes on the mandate, allows educational institutions to implement their own flexible guidelines for the start of the new year. We can say all we want, that the school board does what the school board wants and the county commission does what the county commission wants, but we all know that the school board is not going to completely fly in the face of something that this board has done. That's just not how that's going to work. So local government, us, and the folks that work with us can't possibly know or predict every variable in a business or instructional setting. Removing this mandate frees up private businesses and public institutions to implement policies that are appropriate for them. Everything is different. This is not one size fits all. Most importantly, our mandate is completely unenforceable. There's no enforcement. And based on what the legislature is discussing right now and has just gone through the House and apparently gone through the Senate, and the House is taking it up tomorrow, they are going to require us, I have no reason to believe the governor won't sign this, they are going to require us to reauthorize every 10 days every executive order. We will be back here, I appreciate every 30 days or whatever the suggestion was, every 10 days this board will be back here having this discussion about masks for us to vote on. That's the way it's written right now. It's likely to pass. I can't imagine that it won't. So this idea of rescinding the executive order and implementing a resolution is, in my view, a proactive way to offer residents hope and freedom to follow the recommendations that are applicable to them in conjunction with discussions with their doctors. And if they choose to follow CDC guidelines, they can look at those. But I'll be honest with you, some of the doctors I've talked to and the nurses friends that I have, with all due respect to those who are in the medical community today who shared a differing opinion, the folks I have talked to have said that it is unreasonable to assume or to think that the goal of any of these mitigation efforts is to eliminate death and disease. And I feel like we have gotten to the place where we are holding up an unrealistic goalpost, albeit wonderful and altruistic and aspirational, to say we want no one to get sick and no one to die. That's not the world that we're living in. And those are folks in the medical community who are saying that. And they are also treating children who are having incredible anxiety and depression right now. So I want to talk about metrics real quick, because that was something that was brought up as an alternative to what was on the agenda. If we set metrics, and originally, I was asking about metrics, and some of you I've talked to that are here today, I said, we just need to ask, what are the metrics? What are we going to look at? That needs to be what we need to focus on. And then I started thinking about it. What if we set metrics that are unrealistic? So if we set 50% vaccination rate and we don't get to 50% vaccination rate, does that mean that we're going to require masks forever? I mean, I'm personally not interested in coercing the public to have any type of medical decisions. So I'll be honest, I pivoted in my thought process because I realized at the end of the day, the outcome of setting a benchmark like that requires individuals to make decisions about their personal health wasn't consistent with my personal beliefs. So I'm the kind of person that I do better with deadlines and rewards. And we're seeing out of the UK that as soon as their government set a deadline for their mitigation efforts, vaccines took an uptick, because people who were on the edge, people who were trying to debate about whether they were going to get it or not, people who were perhaps fearful, they knew that on blah, blah, blah date, that's the date that the orders are going away. And so more people went and got their vaccines because they had to make a decision or move on. So I think there's some logic to setting a deadline, even though it may sound arbitrary. I think there's something just from the way people operate that a deadline is not bad. Have you ever had a college student or been in college? You set a deadline for that project. You may be up at midnight getting it done, but you got it done because you knew the deadline was the next day. Looking at those 170,000 people who have gone and gotten vaccinated, and the tens of thousands of folks who carry some form of immunity, I'm not someone who is willing to make the entire class stay in from recess because a couple of kids won't do what the teacher wants. And that's where I'm afraid we're headed with this. So that's where I'm at.
Further discussion? Commissioner Zimbauer?
So I agree with a great deal with what my fellow Commissioner Lockhart has indicated. I think we can all agree the CDC's been all over the map. We can all agree Fauci speaks out of both sides of his mouth. We can all agree about a lot of things. There's been a lot of discussion about benchmarks, deadlines, and so forth. So we've had 170,000 vaccines, yet we have an uptick. I do a lot of reading. I do a lot of studies. This county has actually, there was a lot of questions about where's the studies, where's the facts. We'll go on to our webpage. There's over 40 peer-reviewed documents on the Seminole County website that can refer. They cite the studies and so forth. We're at 42. We heard today we're at 42% of our eligible population vaccinated, but we still have an uptick, and we've seen an uptick. So how come there's an uptick? Well, I think what I have learned and when I've digested in reading and studying and even talking to some of the experts is there are things that we know, but there's a lot of other things we don't know. We don't know about certain variants. We don't know, and now we've actually had people that have supposedly been vaccinated who've actually now contracted COVID. Now, agreed, the studies show, that they are not going to the hospital at the rates once you're vaccinated versus not vaccinated. We're also hearing some of the pharmaceutical companies saying, well, you may have to get a booster on top of what the vaccine's already been, or we're not real sure how long that is going to function. That said, that was why I made the motion. We're at 42%. I can't imagine this county can't get to 50% at this juncture. But I think the bigger thing is the community spread aspect. If you continue to see the community spread, it tells us that it's still active, whether it's some hybrid model of it, whether it's the original one. We've seen California, Brazil, UK, whatever it might be. I can't speak to that because I'm not an expert. I'm going to follow the expert's advice. I don't hold a medical degree. Well, I am smart enough to know when so many people have been vaccinated, yet we still are seeing an incline or increase in the contraction rate. And then we learned this morning on our briefing that we had, I think, 4 or 6 additional deaths, and now we have more hospitalizations. We also heard this afternoon that we have more ICU patients. I can't speak to why, but I can only say I'm smart enough to listen to those that have the degree and give this advice to us. As the chairman last year, and I'll say it again tonight, this is not a political statement. I don't care whether you're an independent, a libertarian, a Republican, or a Democrat. This is about the safety of a community. And having politicians banter around a decision based on what I heard here today, that you won't be reelected, you're going to be primaried. You know what? This commissioner doesn't care. Because at the end of the day, I'm going to make a decision what's based on the best for this community, whether you voted for me or not. So I would only urge my fellow commissioners to consider the entire population of this county, look at what the trends are. I don't think we can argue if we get to a point where there's not community transmission increasing, that we're probably at a pretty good place. We thought we may have been a good place a month or 2 ago, but here we sit. You don't have to look far, and you look to India. They were flatlined of any country. They rolled back their mitigation strategies. Now they're out of control. Why? I can't speak to that, but I know what the trend shows. And so a simple trend line of watching community transmission, I think, is whether you want to believe the doctors that were here today or don't believe them, is certainly result-driven of what we can follow and understand. So that's my position.
Commissioner Zimbauer, I just want to clarify the motion since it was done
A couple hours ago?
nearly 4.5 hours ago. The amendment, could you repeat it? And what I'm saying is I thought, the reason why I took the two together was because I felt that everybody were here for both of them. And the second thing is your motion, if passed, took into consideration of rescinding 3 and 4 because you're saying it's not going to be rescinded. Correct. As part of your motion. And the resolution encouraging facial coverings in indoor spaces is not necessary if you continue the mandate.
Well, first of all, we don't have an indoor masking unless you can't have separation.
And we don't have any outdoor.
So I'll reread my motion.
Okay, that's what I want you to do. I just wanted to make sure that everybody understood.
Section 3 and 4 of the current executive order be amended to state the following. This body shall revisit this issue every 30 days or every second BCC meeting of each month. The facial covering order shall be removed once 50% of the county's eligible population has been vaccinated and there has been 30 days of declining community transmission, or sooner should the Seminole County medical community and subject experts as represented here today recommend it appropriate to do so.
Is the seconder agree to that?
That's the way I understood it, and the reason why I supported it, Mr. Chairman, was because there's an or there. That's the issue for me. It actually happens before June 7th.
Is there any further debate on the motion? Seeing none. All in favor, say aye. Aye. Opposed?
Nay.
It passes 3-2. Thank you very much, everyone. It looks like we'll be looking at this in 30 days.
Or sooner.
Or sooner.
depending on-
Or sooner.
So before we end this
Yes.
topic, and I just want to go on the record with a couple of things. Number one, I really don't want to hear another briefing from our medical staff without a briefing about mental health and substance abuse attached.
Thank you.
Those professionals need to be considered. And I also would prefer to hear outside of the folks that we continue to hear from. And I'm not discrediting the folks. I work with a lot of those folks, and they are highly credible to me. But we can't continue to be in our own echo chamber and expect to get smarter. So I want to hear from outside of our echo chamber. I think it's critical to the success of this decision. And I'm also going to go on the record and say that I don't think the original proposal was ever with the idea that we wouldn't be wearing masks. That was the proclamation. And so I don't want to leave here with the notion that while we would support taking away the mandate, that wearing masks isn't a good thing to do. And so I am not for government regulation of this sort of thing, particularly when we're not actually enforcing it. And we're not even enforcing it in our own building. I am for a business making its own decision as to whether or not a mask needs to be worn in their business to keep their employees safe. I applaud your employer for doing that. My own employer does that. But it's not a government intervention. And so I really want to be clear around the notion of what we heard today versus of public input versus the intention and the thought process that I think all of us probably have here on the board. And that is, there's probably a couple of different ways to skin the cat, but the idea of keeping us safe is a good thing. The idea of spreading fear is a bad thing. The idea of getting vaccinated at your own discretion is probably a good thing. And the idea of being respectful is always the best possible thing because we can get the best possible ideas onto the table. So God bless all of you for being here as long as you have. We're glad to have heard from you, but please don't leave confused about what our thoughts are.
And Commissioner, I want to echo the fact that I think that it is correct, as you said, because I've indicated too, that we need to hear from the, other health community and everything. And I think that this motion that Commissioner Zimbauer has put forth gives us that opportunity in a sense that we are now, we have some guidelines, but we also have the opportunity to look at this as it progresses. So thank you very much, and duly noted to that, to the county manager at the next
Could you please
meeting.
circulate that motion, which was clearly already discussed?
Absolutely.
That'd
Well,
be
and I'd also
fabulous.
say that the handouts from the medical community need to be given to us. If you can't facilitate it in advance, I don't want to be scrambling on email behind the scenes trying to get it into my hands so that I can look at a previous slide while referencing something else later. I feel like we were put in an awkward situation with that. It is incumbent upon us to be as informed as possible. This was not a good setup.
Ladies and gentlemen, we have we now are at 32. We are going to 33 to 36 plus other public comment and others. So what I'm going to do is I'm going to give us a 10-minute break. 15, okay, well, let's just make it, okay, we got, let's say 12 and a half, because it's right now, and we'll make it 6:10. Thank you very much. We are recessed until 6:10. Again, we have a quorum here. We're now going to go to the legislative public hearings portion of the meeting. Items 33 through 35 are legislative public hearing items. We need a motion to accept proof of publication.
Move to approve.
Second.
Motion and seconded, discussion. All in favor say aye.
Aye.
Passes. Our staff will present each consideration with a staff recommendation. The board will have the opportunity to ask questions of staff when presentations have finished. The applicant will have an opportunity to make a presentation. The board will have a chance to ask questions. People interested in speaking for or against the project or issue may speak in person, or if virtual, they should register with Seminole County website by going to the Board of County Commissioners page and clicking on the webinar registration link. If you are unable to join via computer online, interested parties should call 407-665-0808 for additional information. If you would like to make a comment and are attending the meeting using a computer or iPad, click on the raise hand feature. If you have to call in on a telephone, you can raise your hand by pressing *9. You will be called on in the order that you have raised your hand. You will only be allowed to give comment once per item. Speakers should state their name and address clearly for the record, and whether or not you're for or against the items. And as you know, speakers will have 3 minutes or 6 minutes if they're official spokesperson. If a board member has any questions regarding the speaker's comments, an opportunity will begin for them to speak after the time has expired. Speakers should limit their comments to pertinent information regarding the item under discussion, keeping your comments brief. Obviously, once all the speakers are heard, the applicant will have the opportunity to rebuttal if necessary. We will close the public hearing and put the matter at the hands of the commission for discussion, recommendations, or motion. Following a motion and second, there will be a discussion and a vote will be taken. We have the proof of publication. The chairman has stated the public hearing rules. We are now on number 33, Amendment to Chapter 40, Seminole County Code of Ordinances. Mr. Hopper. Oh, no, that's not Mr. Hopper.
I am not Mr. Hopper, no. Good afternoon, or good evening, Commissioners. Mary Moskowitz, Planning and Development Services. Got it. Okay. So item 33 is an amendment to Chapter 40 of the Seminole County Code of Ordinance to update the ordinance in the administrative provisions of the code to be consistent with Florida statutes, and also to revise the street sign requirements. The proposed ordinance will have 2 sections. The first section changes to the Appendix A, and it would revise that to be consistent with the Florida 2020 Building Code and Florida statutes. Various topics that are addressed include the applicability and exemptions, duties and powers of the building official, submitted documents, and violations. A copy of those changes is included in your agenda package. In addition, the changes relate to new language which will clarify requirements for street signs within new development projects to facilitate the E911 response. Staff is here to answer any questions that we have, and we recommend approval of the ordinance.
Thank you very much. Any questions of Mr. Markowitz?
Moskowitz.
Moskowitz? Come on, guys, it's been a long day. I'm trying. Any questions? Seeing none? Okay, is there anybody? I have no cards for the audience, from the audience. Anybody else need to speak on this? This is to update, put us in compliance with the new 2020 building codes, et cetera. Is there a motion?
Mr. Chairman?
Yes.
Adopted ordinance amending Chapter 40 of the Seminole County Code of Ordinance to update the administrative provisions of the building code consistent with Florida statute. Also devises street sign requirements for new development to facilitate the E911 response as submitted here today.
Second. Motion and seconded. Who got the second? I'll give it to Commissioner Herr. Any further discussion of the motion and the ordinance? Seeing none, all in favor say aye. Aye. Opposed? Passes unanimously. Thank you, Mary. Next, we go into number 34. Item 34 is the oft-discussed and long-awaited Shoreline Protection Amendment.
Amen.
Wow. Been around a while.
And I see that Kim Ornberg is here. Ms. Ornberg.
Good evening. Yes, Kim Ornberg, Watershed Management Division Manager. Yes, it's been a journey, and here we are. I am here to present for your consideration an ordinance amending Chapter 70, dredge and filling, and adding a new Chapter 71, Seminole County Shoreline Protection Ordinance to the Seminole County Land Development Code to provide regulations for shoreline alterations and management of aquatic plants for water bodies in unincorporated Seminole County. As I know all of you know, and many know, that aquatic plants play an important role in natural water bodies. They can protect shoreline property from erosion and protect and improve water quality for lakes. This is why it's important to have rules governing their controls and management, since the mismanagement of them can conversely have a negative impact on a water body, such as algal blooms, decreased water clarity and water quality, increased invasive species, and degradation of the ecosystems. Historically, I know you all know, Florida Fish and Wildlife Conservation Commission, or FWC, had regulatory authority or jurisdiction of all shorelines and aquatic plant controls for water bodies 10 acres or greater throughout the state. But they revised their rules in November of 2018. And now FWC only regulates water bodies that are 160 acres or more in size, which leaves most of the water bodies in Seminole County without shoreline protection. This proposed ordinance would only apply to those water bodies less than 160 acres in unincorporated Seminole County, and therefore there would be no regulatory overlap between the state and the county. And this ordinance will fill the shoreline protection gap that was left by FWC rule changes. It's also beneficial to the county and its residents to protect the health of county water bodies and for recreational, environmental, and property value purposes. As with all of our programs within watershed management, education is our primary focus and the goal of this ordinance and its implementation. Changes were made to Chapter 70, dredge and fill, and other chapters where necessary updates were needed, and revisions that refer to the new Chapter 71. In leading up to this public hearing, our staff has reached out to the stakeholders to provide information about the proposed ordinance and seek comments and feedback. We set up an informational webpage and sent out over 900 emails to our waterfront residents, our environmental groups, our development community, state agencies, and our local cities. Additionally, we presented the ordinance at community meetings, both virtually and in person, and sent out social media blasts through the various platforms that the county maintains. We've taken their feedback and comments and incorporated most into the current draft being presented for your consideration today. Staff is recommending adoption of the ordinance, and I thank you for your time, and I'm happy to take any questions that you might have.
Any questions of Ms. Ornberg? Go ahead.
The only thing, I'm sorry, Kim, I know we've talked about this ad nauseum, so I appreciate you clarifying this. There were some changes that were made that were circulated. Were those changed online, or for anyone that might be out there looking at it?
Yes, every time we've made an update, we have updated what was online.
Fabulous. Okay, thank you.
I do have a couple of, Commissioner Zimbauer.
I want to make sure that all the stakeholders were included and weighed in on this. I know early on they were, back 5 years ago when I was at Planning and Zoning. Have they had an opportunity to weigh in on the latest? I have not heard any rumblings, but...
Yes, sir. They were all included in the emails and the communications that we've had starting in early this year. So we've involved them and sent updates to them and contacted them. So.
Fantastic. Thank you.
Any further questions or comments? I do have a number of cards here. One is a public comment form from Miss Debbie Smith of 1473 Hyde Park Drive, Winter Park. She says, I'm in support. I live on a 32-acre lake, Lake Florence, that has seen an increase in shoreline destruction over the past 3 years as a result of development, clearing of plants, and aggressive boating. It is affecting water quality and natural environment for all of our small lakes. Save our lakes, hashtag save our lakes. I also have a public comment form from Chris Campbell of FWC. Now, She left at 4 o'clock. God love her, she was here from 1:30 on, but she was going to try to do it on, in virtual. Clint, did she ever get virtual? If not, I'll read her statement.
No, sir, I only have one.
Yes, I see David Bayer is on there, and I will get to him in a minute. Okay, but this is, then I will read her comment. This is again from Chris Campbell of FWC, Florida Wildlife Commission. This ordinance will bridge the gap of protection for for Seminole County shorelines that are no longer under Florida Fish and Wildlife's protection. Riparian areas are crucial habitat for fish, birds, and it is imperative they are protected for the health of the lake systems. We also have one public comment here, but I think we outlasted poor Cindy Haller. She is not here, but she is...
For the record.
For the record, she is not here. Is she out there? She's not out there. So I'm just going to say that she is in support of this item. And then we have 2 hands raised now. So bring in Mr. Bayer first, because he was first up.
Good evening, Commissioners. Can you guys hear me?
Yes, we can, David.
I know it's been a long day, and I don't think you need to hear me say why this is such a necessary and good idea. It speaks for itself. By the way, David Bayer, 921 Tuscarora Trail, president of Save Rural Seminole, as well as president of Lake Tuscarora Association, one of the lakes that would be affected by this. What I wanted to comment on is, a lot of times you hear complaints, sometimes from me and other people, about the way things need to be, or why we think you're going wrong on the wrong path, or staff has. And in this case, I think it's very important for staff to be recognized, and all of you guys to be recognized for having done yeoman's work to bring this to the table. I know it was not easy. There's a lot of coordination. I know firsthand from staff, having been present when staff was doing that. They did an excellent job. And I wanted to make sure they're recognized for their efforts in doing that.
Thank you very much, Mr. Bayer. Does anybody have any questions of Mr. Bayer? Seeing none, we have, I believe that's Gabriella, which means it's Miss Milch. Gabby, you're up.
Hi. Thank you all today for being here. I would like you to please vote in favor. My name is Gabrielle Milch. I live at 252 Coble Drive, Longwood, Florida, and this is a great ordinance in many aspects. I just wish there was a component part about repeat offenders, and that instead of asking for forgiveness, they could ask for permission. And also, I'm worried about herbicide efficacy and resistance in lakes in Seminole County. And I hope that self-reporting is a good thing, but I would like some other type of, oops, it says, am I on?
Yep, you're still there.
You're on, Gab.
Computer said something. Well, thank you very much, and please vote yes.
Thank you, Gabby.
Thank you, Gabby.
Anyone else? Clint? Kim, would you like to just make any comments on what, the one thing I would say is, like we did with Bayer ordinance and everything, education is first. We have learned that, has worked with our citizens in many cases, but would you just comment on Ms. Milch's comments?
Yes, we do concur with that. That's one of the things that she was talking about was herbicide use, and that's why we feel, the ordinance is really key. We don't want, anytime anyone's going to be using aquatic herbicides in a water body in one of the lakes will be under the jurisdiction of the ordinance, we would allow our staff to work with them and to make sure that there's no resistance, and make sure that they're rotating chemicals properly, using the right chemicals for the target species, and developing an integrated management plan like we do with our MSBU water body. So I think that is important. And like you said, with everything that we do, education is our primary goal. And if we see something, we try and educate people with the fertilizer ordinance, that was the ordinance, the fine is the last resort, and I will be happy to tell you that we've never issued a fine in the 3 or 4 years that we've had that ordinance. So, like I said, I think most people want to do the right thing, and when they understand how it helps their water bodies, then.
Well, thank you, Kim, for all the hard work, just as with the fertilizer. And this is just another step in protecting our water quality here in Seminole County, and one that we are taking well before most other jurisdictions. So I'm very pleased to say that, and happy that we are taking this step if it passes. Now, is there anybody else that wishes to comment on this amendment? Yes, go ahead.
Mr. Chairman, I just want to thank staff, Kim, your entire staff, legal department, John Dredge, the whole team. So many people definitely put a lot of hard work into this. And I want to also thank the citizens and the community activists that were very involved in this. So a lot of hard work. With that, Mr. Chairman, can I make a motion?
Sure, please do.
I'd like to make a motion to adopt the ordinance amending Chapter 70 and adding Chapter 71 to the Seminole County Land Development Code to provide regulations for shoreline alterations and management of the aquatic plant in the water bodies of Seminole County, as presented here.
Is there a second?
Second.
Second by Commissioner Zimbauer. Discussion? All in favor, say aye. Aye. Opposed? Passes unanimously. Thank you very much, all that were involved. We really appreciate it. And we look forward to results. Next.
Mr. Chairman, the other thing I would say is that if Gabby takes you on a kayak trip, make sure you define the length of time, because she'll take you out all day long.
All day long. That's right. You got her. Okay. It's not like we haven't had enough of English estates today. We have English estates again. Please, Bill.
Back one more time, sir.
Yes, sir.
This is item 35, English Estates and English Woods Golf Cart Program. I'm Bill Wharton, project manager out of the engineering division for the county. And as the board recalls, back in December 2019, you created a golf cart program to allow golf cart operations in residential neighborhoods. So far, we have 2 programs under that, the Markham Woods Road Sidewalk and the Rolling Hills programs. The request came from Sir Sean Cable. He's the president of English Estates and English Woods Homeowners Association. His request is to allow golf cart operations on roadways within the English Estates and English Woods neighborhoods, limit golf cart drivers to those with a valid driver license, allow day and nighttime operations with proper equipment on the golf carts. On July 7th, 2020, we had a community meeting, virtual by Zoom. We sent out a total of 899 cards. We had 30 people register for the meeting. We had 30 people attend. We had 18 people who spoke. Of those, 4 stated they were in favor of the program. 2 stated that they were opposed. The remaining 12 had questions and comments, but did not indicate if they were in favor of it or opposed to the program. Over the past months, I've also received 3 emails stating opposition to the golf cart program. The county's determination and recommendation is golf carts will be allowed on the local neighborhood streets of English Estates and English Woods. The golf carts will not be allowed on Derbyshire or Oxford Road, but there will be a crossing of Oxford Road will be permitted at the offset intersection with Hunterfield Road. Golf cart drivers must possess a valid driver's license, and the golf cart operations will be permitted only between sunrise and sunset, and that is consistent with the other 2 golf cart programs. If approved, the ordinance will not take effect for 30 days to allow for the fabrication and installation of the necessary signage. Have been in contact with the Seminole County Sheriff's Department. They have no objections to this as long as it follows the Florida statutes. And DOT, Florida Department of Transportation, has no comment, as these are not state roads, nor do they connect directly to any state roads. And Chairman, that's my report.
Any questions? I have no cards. Is there anybody in the audience that wish to speak?
Mr. Cable's hand is up.
Yep, I see that, but I'm just seeing out here. Just one question. Those when you said there were 12 people, I think it was 12 or 14 that had comments, did you take all those comments into consideration, try to abide by all of them?
A lot of them were just how the process
How the
works.
process works.
Who was the requester, those type of things.
Okay.
More informational than really direction.
So since we did that other one in the morning, just so everybody knows, the sidewalks will go on Derbyshire and Oxford, but the golf carts will not. They're going on all the other streets that will not have sidewalks now. Okay, any other questions before I open it up?
Or they should.
Huh?
Or they should.
Yeah, or they should. Sean, I believe that you have your hand raised. Sean Cable of English Estates. Sean, you've got a lot of airtime today, buddy. We can't hear you. We can't hear you.
Muted.
Are you there?
Yep, we can see you. I hear you now.
Yeah, perfect. This application started as an idea to see how the community felt about golf carts in our neighborhood. And since applying, I've seen numerous carts around the neighborhood, and the numbers continue to grow. With the Florida weather, carts are fun, and if electric, they're green as far as transportation. It's true that this would only be for our community, but I've been actually contacted by other communities around us about how to go about applying. So this ordinance, we're kind of paving the way to allow us to have golf carts in our community and outside our community. It's already happening in Domerick, and Domerick comes into our community, to be honest with you. During the holiday, we had a small parade that we do yearly with Santa. We included golf carts with lights and holiday decorations. It was a great success. So I think carts are a great way to make our community more enjoyable and a cleaner place to live, and that's why we went ahead and did this.
So, Sean, only from sunrise to sunset, though, that parade was going on, right?
Well, actually, to be honest with you, the golf carts, I have one and it's tagged. So all the golf carts that were in that parade were all tagged anyway. But I think as time goes on, you'll see more people in our community using them. It's kind of nice. I use it. We have community events and stuff. It's so nice to be able to just put something on there and cruise around the neighborhood.
And this is the first item that English Estates has a consensus on.
Well, I don't know if they have a consensus, but
18 of them anyway.
Lee, you're doing so well. Move on.
I know. Commissioner, this is your district.
It is my district, and I love that we're retroactively making the golf cart parade okay. That's awesome. I mean, I think there are a lot of communities like English Estates who enjoy golf carts, and they use them whether or not they're legal technically, but you know what? C'est la vie. I would like to make a motion to approve and authorize the ordinance establishing the designated facility in accordance with 34.30 of the Seminole County Administrative Code for the use of golf carts on local roads identified as a designated county facility within the English Estates and English Woods residential communities.
Second.
Motion seconded. Discussion. Seeing none, all in favor say aye.
Aye.
Opposed? Passes unanimously. All right, ladies and gentlemen, we are now going to begin the quasi-judicial portion of this meeting with public hearings. I've stated it before, but I have to go through this just to be safe. While the board welcomes comments from all persons with an interest in this proceedings, the Florida law requires that the board decision and a quasi-judicial action be supported by competent, substantial evidence presented to the board during the hearing on the application. Competent, substantial evidence is such evidence that a reasonable mind would accept as adequate to support a conclusion. There must be a factual basis in the record to support opinion testimony from both expert and non-expert witnesses. That means that you must provide, public comment needs to provide comments that are based in fact and not just opinion in order for the board to consider it as a basis for the decision. We still don't have an interpretation of what a reasonable mind is, though. But saying that, we will, the county staff, the applicant, after the county staff presents it and questions, the applicant will make a presentation on factual information, including the county staff report, to support their testimony. All persons who present written materials to board for consideration must ensure that a copy of such material is provided to the clerk for inclusion in the board's record of proceedings and official minutes. Has any commissioner received any oral or written communication regarding the quasi-judicial items? If so, please disclose the substance of the communications and identify the person making the communications. 37 was postponed, so we're only talking about 36.
Mr. Chairman?
Yes.
I had several conversations with county staff as well as the applicant. I'd like to submit this into the public record.
I have none.
I've only had communications with county staff.
I have none.
Mr. Chairman, I had both, not only with staff, but the applicant. However, the clerk has managed to take my package when she departed here a short period of time ago. But all my ex parte was sitting there and it's now in her hands, so it's been turned in.
Then you've achieved your responsibility. You've done your responsibility. Okay, so let's go to 36, Park Dental rezoning. Consider a rezone from R1 single-family dwelling to C3 general commercial and wholesale on approximately 0.76 acres located on the west side of 426, approximately 800 feet south of Connection Point. Ms. Giles, Joy Giles is the project manager.
Yes, good evening. Joy Giles, Senior Planner for the Planning and Development Division. The applicant is requesting a rezone from R1 to C3 in order to develop the subject site as a dental office in compliance with the C3 zoning district, which permits general office, commercial, and wholesale uses. The site does not have direct access onto 426 and will access via a shared access agreement from the existing office development located on the east. The request is consistent with the Seminole County Comprehensive Plan and the trend of development in the area. The subject site has an industrial feature land use designation which permits the requested C3 zoning classification, and the surrounding existing development consists of office, commercial, and industrial uses, including the DOT maintenance site adjacent on the west, and as previously mentioned, the office park adjacent on the east. At time of engineered site plan review, the development must meet all requirements for parking, access, building height, open space, permitted uses, and maximum FAR in accordance with the Seminole County Land Development Code. The Planning and Zoning Board met on April 7th, 2021 and voted unanimously to recommend approval of the request. Staff recommends the Board of County Commissioners adopt the ordinance enacting a rezone from R1 to C3 on approximately 0.76 acres located on the west side of State Road 426 south of Connection Point. Thank you.
Thank you, Ms. Giles. Any questions?
Just a question for staff, if I may, Mr. Chairman.
Certainly.
So with this site, they're using the cross-access easement from the commercial property to the northeast?
To the east, correct.
By doing that, they're not providing another crossing of the Cross Seminole Trail, correct?
That is correct.
Okay, so you're obtaining the same crossing that's there for the commercial aspect of it?
Yes.
Okay, I want to make sure.
Any other questions? Let's go to the applicant. Is the applicant here to speak?
Who wins the endurance contest?
Poor guy.
Didn't think about that earlier. David Stokes, Madden Morton Stokes, 431 East Horatio Avenue. Here on behalf of the applicant, we're just here to answer any questions you guys may have. We agree with staff, and thank you guys for your time.
Any questions?
Nope.
I have just one question, real quick. The only concern that I would have is that, that not the dental rezoning, but the fact that because of the rezoning, it could be used for other things in the future. Is there any safeguards that can be made that it doesn't go back to industrial or any of the other things that could be used for C3?
That may be more appropriate for staff.
I understand, but I was trying to get a commitment out of you. That's not your intent, right?
No, sir. It's a family-owned business who's looking to relocate there.
Thank you. Ms. Giles, could you just answer that question? And that was the only concern that I have heard at all.
Yes, so C3 is a straight zoning, so there are no conditions put on that zoning. The future land use is currently industrial, which does permit the C3 zoning on the property. So again, there's no conditions of approval for straight zoning.
Thank you very much. Anything else? Seeing no citizens here, seeing no one in the cyber.
Well, I
this
do
is
have just a comment, Mr. Chairman. I noticed if you all saw in your packets, there was one letter of opposition that was filed by Ms. Jill Feidler, talking about we need more rural open lands, et cetera, et cetera. So to that point, what I just want to make sure that we understand, we have less than 2% of available land left in this county for commercial and industrial type uses. So we have to be very cognizant of that. And I've tried to do that since being on planning and zoning, when we actually looked to see how many parcels and how much we actually had. And I think that's very important, although we have to be sensitive to what the community desires and wants. Part of the issue is, as we know, we've had numerous retail clients that want to come to Seminole County, but if we get rid of that and zone it to multi-use or multifamily, all we're doing is sending the best taxpayers, honestly, that supplement our residential taxpayers to another jurisdiction or another county. Just a matter of awareness. So that's all I have.
Thank you. Commissioner Delory, it's your district.
Thank you, Mr. Chairman. Mr. Chairman, I'd like to make a motion to adopt the ordinance enacting a rezone from R1, single-family dwelling, to C3, general commercial and wholesale, on approximately 0.76 acres, located on the west side of State Road 426, approximately 800 feet south of Connection Point, as presented here today.
Second.
Motion and seconded by Commissioner Herb. Discussion. All in favor, say aye. Aye. Opposed? Passes unanimously. Thank you very much. As we've done previously, item 37 was postponed till time certain, 1:30 on the 11th of May. I do have one card, which I'm just going to read into the record, again from Ms. Howler. Was not for the continuance. Mr. Stokes filled in for Mr. Moorhead at the City of Sanford meeting on the blah, 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 of 26th, because I was there. Mr. Stokes could have filled in today. So with that in the record, we'll go to item, we'll now go to County Manager's report. County Manager, before I bring up Ms. Johnson, is there anything that you have?
I just have a couple of brief updates. I know it's getting late. Typically at this point in the meeting, I would update you on the emergency rental program. The rental assistance program, I'll just tell you, we're at about, we have 700 approved applications out of 1,400 that have been submitted. 555 of those were denied. There are a handful that are still awaiting a decision. We have approved about $4.5 million, which represents about 30% of the $14 million that was directed to Seminole County. We continue to try to reach out to landlords and other agencies that may have folks that are looking for assistance. So we're diligently trying to get that money out into the community. As a reminder, it needs to be committed in full by the end of September and expended by the end of this year. The other item that I talked about at the last meeting that's related to this is the American Rescue Plan dollars. We still have no guidance from Treasury on that, and no indication as to when we'll get it. We received some guidance on how to register for the program, but I saw a commissioner raise their eyebrows at that, so.
It was probably me, because I, unless I misunderstood, I thought we had.
And maybe I missed it, but
well, I got a reply from Lori. So sorry. Because we received communication from Senator Rubio's office about the American Rescue Plan Act with a link. Please see the latest Treasury guidance. And so I forwarded it to Lori Bailey Brown and said, I wanted to make sure you all see this.
The guidance was how to register for the dollars, unless it's come in.
Okay.
Yeah, I think that link was simply how you had to get into the system to get registered to receive the money.
Okay. All right, hearing there was nothing yet, I was like, well, wait a minute, I know I just read something, hold on. Okay.
We did get something from Commissioner Rubio's office, you are correct. But I think it only related to...
If Lori Bailey Brown is here, she could
Yeah, she
probably
could answer that.
I don't know if she is, though, or not.
We did also receive some information on the homeowner assistance program. The state of Florida, we don't get money directly on that. The state of Florida is receiving money on that. And it received, I think, $689 million. That's the program that we hope to receive mortgage assistance dollars from. And that may have been, we did receive some guidance on that as well. So that may be what you're thinking. But with respect to the actual $91.5 million that we're receiving, we have yet to receive any specific guidance on that. We continue to try to refine the items that the board discussed at the last meeting. And we also met with the cities to talk about sort of what their plans are. I think that they are still trying to get their brains wrapped around it. But a couple of them seem to be committed to using the funds for water and sewer improvements, but none of them seem to have a well-developed plan for the dollars. They are all interested in working together on any direct assistance program that we may develop with those funds. So as we get more information on guidance and as we get more information on some of the programs, we did have a call last week with the state office at DEO on broadband to try to get some information from them. They are still trying to get information from the governor's office as to how the governor would like the money that the state is receiving with respect to broadband expended. They did give us some good contact information for a couple of counties who have hired broadband consultants, and so we've reached out to them to get their RFPs to see what that might look like for us. But as I said, we're still trying to wait for additional guidance and understand exactly what our restrictions and permissions will be with respect to the expenditure of those dollars.
I have a question along those lines, if I may.
Please go ahead.
So, not somewhat related to this, have we been getting any guidance or any heads up? Is there going to be, as part of this American Cares, has there been any discussion about additional VA vouchers for our veterans for housing? Has anything come down along that? And if not, are we going to be able to use any of that funding for that purpose for some of our veterans that need housing?
I'm not aware of that, but we'll look and see.
Okay.
There may be something, it's this thick, but we'll look and see if there's something in there.
Further questions? Is that it, County Manager?
Yes, sir.
Okay. Then, Ms. Johnson, we're in the funny season, down to 72 hours.
Right. Good evening, Chairman and Commissioners. Tricia Johnson, Deputy County Manager. Yes, the legislature officially concluded their budget discussions today at noon. So the budget is in what they refer to as the cooling off period for the next 72 hours. And then they will vote on the budget on Friday. This year's budget is historic, as it is the first to exceed $100 billion with a B dollars, but that is largely due to the $10 billion the state received in federal stimulus dollars. Some exciting news for you. I'm excited about it. We are currently in the budget for $500,000 for the Little Wekiva River Restoration Project. That's exciting because this is a tough year to get money, and originally we had no money in the House budget and $250,000 in the Senate budget, and Senator Broder was able to advocate for another $250,000 to fully fund that appropriations request. So I would like to thank him for his efforts there. Of course, we aren't out of the woods yet with it. The governor could veto it, but fingers crossed, if we do receive that funding, will be beyond halfway to the fully funding of that project. So that's some great news and something to be excited about. The session should conclude on Friday. They will have a special session, but that will focus only on gambling and a deal that the governor is working on, so nothing related to local government will be discussed at that time. there are a number of bills that are moving very, very quickly. So rather than go through them with you now, for them to change in the morning, my recommendation is I'll just send you a daily email with the hot bills that are relevant to the county and where they stand so that you can see that on a daily basis, because I promise you they're voting tonight. We've got a couple of big ones up tomorrow, and I can just send you a daily update if you prefer, especially considering the day. Okay. Any questions I can address for you?
Any questions?
No, I really appreciate the daily update.
Sure.
That's very helpful. Thank you.
Absolutely. Thank you very much.
Thank you. You can also, if you choose, you might want to send the daily updates that the Florida Association of Counties is giving also to all the members, because that gets a little bit more into the broader aspect of it. So I know that Tricia's on the phone calls with me every Friday, so if you could do that, that would be great. Also, just as a reference, point of reference, if you will, when I was elected in 1992 and went into my first budget on the Appropriations Committee in 93, the budget of the state of Florida was less than $50 billion. So it is, the state is growing. And so is the budget. Thank you. Okay. Anything else, County Manager, on your end?
Yes, sir.
County Attorney?
Nothing at this time.
Okay, future agenda items. This is the 15th day. You saw the message from Ms. Kuntz to make sure that we do it in 15 days. It is 15 days. Does anybody have anything right now for any future agenda items? Try to keep in mind they're trying to get us to do the 15 days, which is done in writing and everything like that. So, but you can also do it at this point now. Seeing none, we do have two individuals, I'm sorry, and a third one that left, but I will just state his concern that wants to talk about future agenda items from the public. So first, we have Mr. Johnson. Mr. Johnson?
Okay, a couple things.
Mr. Johnson, name and address for the
record. Mike Johnson, common name. I live in your neck of the woods, Lee, in Altamont Springs, unincorporated area. I'm going to give you some advice, one of you here on this board here. I'm also going to give some kudos to some folks here, and also some other things that were said in the past that didn't come to pass, and you all lied to us. A couple of you, not everybody here. I want you guys to listen to what we're about. Jay, what's the purpose of public comments? It's not for you to mock us when we get up here and talk. That's what you did today. It was disgusting and offensive.
Mr. Johnson.
Okay.
Yeah, let me
take exception. Let me go on to what I'm going to give a kudos to Nicole and to the roundabouts that are being engineered in the city. Remember I came here a couple years ago, I got back from Norway, remember that, Nicole? And I said I'd pay for you guys to go over there, and I'm still up for that. I just came back from 11 states in the last 14 days, drove across to I-10 and up through Arkansas, Oklahoma, Missouri, Illinois, and back through Kentucky, Tennessee. And I saw a lot more cities and counties that are installing roundabouts. That's professionalism, folks. That's not mocking people. That's doing the job, Nicole. Thank you very much. I was also here when we had a bunch of people here that were against the tax hike. And like I was talking to you, Lee, I believe that firefighters need to be on par with the same salaries that they make in Orange County. I am a big proponent of helping our local guys get the right kind of salaries that their neighbors have, because these are fantastic people out there that help remove trees and everything else in my yard and neighbors' yards and everything else. But what happened is that we were lied to at that meeting about ISO. Remember ISO? When we had it in the federal government, it turned out to be a fraudulent organization. We got rid of them. But yet, but at that time, I'm not going to mention names, you all promised that our taxes and our insurance would go down. Well, guess what? You want to see my tax bill at my son's house that I go home with him in this county? It went up double, maybe almost 2/3. So ISO didn't help out at all. When you enhanced the fire department, it didn't help ISO at all. It didn't convince the insurance companies that you guys were all rooting for, that they would lower our premiums. Okay, so I just want to make that point. Okay, and then let's go back. Okay, you take exception to it. This is the comments I have right here. I told you guys I worked for the federal government. I was GS-14. I was approved to make SES. In the government. I thought about working for Trump's campaign. because we need people that know how to run the organizations and operation. There's too many incompetent people working in government, folks. I spent a few years working over at Navy Training Center, the most incompetent organization in command I've ever seen in my life. About 10, and the people that ran the organization could tell you that only 10 out of 100 people worked over there. They're spending $1 billion a year buying less than $1 billion worth of equipment for our troops. Ask David Smith, he knows the truth too about it. We talked about it. But,
Thank you, Mr. Johnson.
We don't like to be mocked down here when we come down here. We voted you in.
Thank you, Mr. Johnson.
We want you to listen to us, folks. Take our advice. We're the professionals. And I told you that the data we saw, the thousands of employees that I've worked with in the government, thousands of them.
Mr. Johnson.
A lot of them were worthless. The reports are worthless. The doctors, by the way, can I make one more point, Lee? I just spent the last couple of months trying to look for a new doctor because one of the doctors got charged with drug possession. The other one was ended up with a malpractice case against her, so she had to get out of her business. So doctors aren't always perfect, folks, that you heard today, because most of them, those 42 articles, I read them last night. And I made some key feedback to Alan about it. A lot of them are quacks. And then a lot of the information here is outdated and been refuted, like Amy was saying.
Mr. Johnson.
Listen to the facts, okay? Thank you, Lee. I appreciate it. Thank you. Give me a little leave time, okay? Thank you.
Not to belabor the point, every one of these people work very hard and take everything that they hear into consideration, all of my fellow commissioners, and Mr. Zimbauer should not have to justify what he felt was the right thing to do. So I take it. No, Mr. Johnson, please. It's my turn. Thank you, sir. Okay, Mr. Shilson. Bill Shilson.
Excuses for ignoramuses.
Mr. Shilson, Bill, I'm
Just for the
sorry.
record, I will address those individuals moving forward. I appreciate you cutting me off.
I'm sorry, I didn't mean to cut you off.
I'm fully capable of handling those situations.
And Commissioner Zimbauer, I'm sorry if you felt that I cut you off. I didn't. I was trying to cut him off.
Understood? No, I got it.
Okay, it wasn't cutting you off. And I thought it was not right and unfair to you. Okay, Mr. Shilson, are you here? I guess he left. Did not show. Okay, let's go into the district commissioner's report. District 4.
I have nothing tonight.
Okay, thank you very much.
I'm getting applause from the audience.
Yes, you are. You're getting applause from me too. District 5.
I have a few brief items. Reporting on the Port Authority, everything is business as usual, high occupancy rate, leases renewing, et cetera. Rescue Outreach Mission, we did speak to the City of Sanford last night about the rescue funds and the opportunity to fund the upcoming need for homelessness, and answered a few questions there. We also took another turn to the bylaws that have now been reviewed by an attorney, and they'll go back to the board. And then the last thing is that there's a new funding agreement that's been presented by staff to their board, and it was reviewed in detail, which apparently had not happened before, at a board meeting, line by line, with the two consultants side by side, and we've given it back to the team, the staff, to take the next turn of that agreement. So progress is good. We did a visit out to the Midway community, and I know that all of you have been invited, and if you haven't done it, I do encourage you to do it. Mr. Green and the Midway Coalition have a very interesting tour, and there are a lot of things to learn there, so I would encourage that. The last thing that I'll share with my district report is that I realize that I'm new to this. But there were a few uncomfortable moments today, and I realize that that's part of this process. I am also uncomfortable with us taking a tone with the public that's just aggressive. And quite honestly, it doesn't do anything but escalate it. And so I really, really do ask that we search our hearts and find the discipline to simply bite our tongues, and I know I'll lose it at some point doing it as well. But they deserve to be heard the entire way through their 3 minutes, regardless of how it is or what they're saying. I think we get to rebut it later as calm and cool and collected as we can, because I think that's in the best interest of everybody that's here, including the staff. I'll also tell you that I found our behavior with each other odd, and I'll leave it at that. But there was a motion that was brought to the table with regard to that item, clearly a sensitive item. There was a really fast second to the motion. I certainly had never seen the motion before today's meeting, and I wasn't remiss in doing my homework. And it just seemed odd. So I'll leave it at that. I am paying attention. I've been quiet, seek first to understand, then to be understood. But we need to function together as a team of 5 better than we are. I'll stop there.
Thank you very much. District, I believe it's District 2.
Thank you, Mr. Chairman. First and foremost, I want to thank everybody on staff as well as my fellow commissioners who helped accommodate getting Rocky Harrelson's recognition done today on behalf of his family and his widow. Very special moment for those folks, very special for Geneva and everything that family's done for Geneva, and it was well-deserved. Airport report, things are going as good as can be expected at the airport. Travel is still considerably down. There is a slight uptick. There is discussion right now about maybe some international flights returning. That is still discussion, really waiting to see what some of the other countries are doing as far as their COVID restrictions and working with our country and so on and so forth. Weren't sure that everybody was aware that the city of Sanford on 4/12 recognized Donna Walsh and Allen with their work with emergency management. I think that was a great recognition being considered by the city of Sanford. And then everything at the zoo is pretty much going good. Some of the fundraisers at the zoo are going to be changed because of the COVID and because of some of the other restrictions that are going on. Some of the construction projects are well underway and getting completed. All the animals are moving along pretty good. We have an ability to maybe win an award. When I say win an award, it will be an advertising for the Central Florida Zoo, and it's going to be a mural of a bear that will go on Frontier Airlines aircraft. So that was submitted on behalf of the zoo. It'll be judged. If they prevail, there'll be a picture of the bear with Central Florida Zoo logo and so forth, which is pretty cool stuff. Metro plan, not a whole lot going on there. I want to respond to Commissioner Herr's comments. I would actually like some exact dissertation of what you're referring to. I will tell you that I'm very sensitive to this staff being attacked by the public. It's uncalled for. I will always stick up for this staff. If somebody is out of line and just out of color, inappropriate, I got no problem letting people talk. I think the whole public should be heard as long as proper decorum. I'm going to respond to those people. If that is an issue, I'll apologize in advance, but I will not sit idly by while our staff is attacked. I understand the emotions are high. I got that. But when silliness happens and allegations are levied, our staff is not capable of defending themselves or responding to that. I think it's very important that this board support our staff on those issues. I understand it may be uncomfortable for some folks. I understand it. I will always try to address those individuals in the most professional fashion I possibly can, but I will not stand idly by while they attack staff for something they're carrying out as a policy procedure of this board. Just all clearness. As far as a motion, I spent hours and days doing my homework, and I typed up at 1 o'clock this morning my motion. So I'm not sure what is alluded to. I know Commissioner Lockhart made a statement on the record. I take exception to that, but you're entitled to your opinion. I'll leave it to that. That's all I have, Mr. Chairman.
Could I get some clarification on that? Because
yes, go ahead.
so we had, this board voted or gave direction, it wasn't a vote, it was consensus, to put an item with specific language on an agenda item. Staff spent a considerable amount of time drafting a resolution that was consistent with what this board agreed to have on the agenda. And then before even having the opportunity to discuss that, what was actually worked on and agreed on to go on the agenda, there was a motion that came out of left field.
Well, and I understand left field,
Hold on,
but
Jay. I'm Commissioner Zimbauer. Go
So
ahead, finish.
that was what I was saying, is that I found it, and you know, and I'm not as new as Commissioner Herr, but I found it odd that we would have all agreed and given direction to staff to put something specific on the agenda. And you talk about defending staff. I've been staff here for 8 years, and I know what it's like to be them, and I will always defend them from attacks. But I'm also going to defend them when they put in work, and then we just go a completely different direction on our own. So I don't know that there was anything improper about what was done, but it certainly was not what we had agreed on to be addressed today. So that's why I was kind of trying to maneuver that, frankly. I don't know that, I'm not sure what I said that what you're concerned about that I put on the record.
well, although I can appreciate your comments on that, that's not how I understood it. My purpose of making a motion was to get on the table for discussion, at least something moving forward, in addition to my agreement with you to put it on the agenda as we discussed at the last meeting. So I was not aware of, we told staff to put specific things in. You wanted it to come to this board. I said, yeah, I'll support that, bring it forward. I'm not sure that, I don't recall seeing any language that I said, hey, we're going to agree to this specific language. There's no question staff put things together.
Okay.
Okay, Commissioner Lockhart?
Well, then I am really confused, because I have paragraphs from the county manager stating somewhat defensively that they had spent a lot of time communicating with each of us about the contents of that resolution, and that it had been walked up and down the hall, and that everyone was allowed to give input. Maybe I misunderstood.
So my apologies, I'm not referring to the resolution itself. I'm talking about the item before that. I thought it was odd when it was joined together as one item, but we did it, and that's what happened.
So I'm going to go back.
Commissioner Herr?
Sorry about that. Sorry about that, Chairman. I'm going to go back and, I think, answer some of the specifics. I think one of the challenges that we're having is that, to be quite frank, we voted for Commissioner, I'm looking at you and I'm thinking Lee, Commissioner Lee versus Commissioner Z versus, we voted for Lee to be the chairman. And I feel like we have two chairmen, and the rest of us are stuck in the middle, including staff. And quite frankly, that's just not the way it should be. So Lee is doing a great job, Commissioner Constantine. I am exhausted and I'm starving. Is doing a great job at getting the public to be engaged and positive, and us doing the same thing and managing this. I think there are times when, quite honestly, we would benefit from tightening up on Robert's Rules of Order, and you did a good job of just correcting me. But that's not what happens, and quite frankly, I think it was the chairman. The chairman is running the meeting, so if the citizen is not behaving the way we would expect and meeting decorum, you can't have 5 of us jumping on a citizen, and so the randomness of that is not healthy. And quite frankly, they were offering an opinion. While we may not agree with that opinion, they were offering an opinion, and the time to defend staff is probably after their opinion is out. So I think we, as a group, probably need to do a better job of allowing whoever we elect as the chairman to be the chairman, and allowing the public to speak all the way through, allowing staff to speak all the way through, allowing staff to answer a question when we ask a question, and not cutting them off in the middle of the And that happens. That's not, and please don't take me wrong, Commissioner Z down here, that I'm aiming that at you. That we do that. We do that, and I'm finding myself doing it because now it's becoming a habit that I'm enjoying with you. And I'm not going there, so.
And let me just say, I do think it's the job of the chair to allow a free flow of conversation and knowledge. And sometimes I will not jump in when somebody has not been recognized, and that basically is my fault, but I think we've all gotten better at that. Let me just put it that way. I do feel that it's my responsibility as chairman, as I always have, whenever I was, that when somebody was attacking this board, whether it be an individual or collectively, that it's my job as chairman to jump in, and same thing with staff. The fact is that when that gentleman just then was saying that, it was, I felt that it was inappropriate, and that's why I jumped in, and I'm sorry that Commissioners, I know you can defend yourself, but I wanted to do it for you. I'm sorry. But as far as the other thing, but what I want to say is, the thing that really bothered me, and I think we gave everybody the opportunity to speak today. We gave latitude when they were late. I think I counted 14 of the 40 that went over, okay? I kept a record of that, just so, and I thank you all for your indulgence, because I know we all get impatient when people go over, and then when they go over a minute or two or three, then we really get, and I know that I give more latitude than sometimes other people might. But the fact of the matter is that when they started going after Mr. Harris, that's when I could not. It wasn't just that the last gentleman that was on the thing, he was vicious in it, and all of them, not all of them, certain members that we all know jumped up and was all excited about it. That's when I jumped in. That's when Commissioner Zimbauer jumped in, and I'll tell you, that was completely inappropriate.
Well, if I may.
Okay, and Commissioner Zimbauer and then Commissioner Dory. Commissioner Dory has been very quiet. Commissioner Zimbauer and then Commissioner Dory.
It is difficult sometimes to be sitting there with these shields and monitoring what's going on online and monitoring what's going on here with the audience. What we had today was, in my opinion, complete improper decorum. We had clapping going on, we had cheering going on. That adds to it. I mean, I understand the emotional perspective, and people are really emotional about that, but that runs into a chairman being able to follow what's going on, paying attention to what's happening there, calling the names, understanding if a commissioner wants to weigh in, recognizing a hand raised when may not see it. I mean, I know I've sat here, and I know others have, Commissioner Herr has, with our hands raised, and it's not seen for whatever reason. I understand that. But point taken, we all should be functioning together appropriately. I tend to defend staff and defend my fellow commissioners when it's called for. When silliness is happening, I usually don't tolerate it. I mean, I'm all about people having their say and showing that respect, but when they don't, then that respect is returned.
And Commissioner Dory,
equally.
if you can give me just another second, I just want to say,
Chairman.
the other thing that I want you to know is you have to make decisions up here sometimes as far as the audience. And last week, those folks wanted me to provoke them at the last meeting, and that's why I didn't give it to them. Okay? You guys want to be in a little cluster? Fine. You're wrong, but I'm going to, I'm not going to give you the satisfaction, especially when I know that the sheriff's office is not going to escort them out. Okay? Today, I asked them very nicely 2 or 3 times, a little stronger, maybe the third time or second time, but I saw that they weren't going to listen anyway, and I had to make a decision. Either I could continue to do that and lose all control, or let them just be what they wanted to be, and that's what they did. And I wish I had, been able to tell them not to react. Certainly, when they booed Commissioner Zimbauer, that was totally inappropriate. There was just no stopping certain members of the audience from cheering, and I wasn't going to get in a back and forth all day with them. Sure. I didn't think it would give us any help, or would not help the situation. As far as the other thing, by Robert's Rules of Order, a commissioner can make a motion, and if it's seconded, that is the motion that's on the floor. And so by Robert's Rules of Order, I made the determination that was appropriate only because, and I did not know any motion was coming, but it was made and it was seconded, and it was appropriate because it was reflecting the issue that was before us, 3 and 4. And so therefore, I really had no reason to not acknowledge it and accept it. And I will tell you, the other thing is, probably from the standpoint of the citizens, they knew it was one issue, and they all had signed, a lot of you didn't see it before, but they had all signed that they wanted to speak for 31 and 32. I think it saved us not half the time, but at least a quarter of the time if we had not done the way, now, again, the motion was the motion, but if we had separated the two, I felt that would taken us, we'd be here at 9 o'clock. So I don't think anybody did not get their say, and I think that everybody, other than the 2 people that couldn't get on here, but that, and I'm sorry, I don't mean to talk a lot, but I just wanted you all to know, that my thinking when that, and as far as the Robert Rules of Order, in fact, I got a comment from during the break from Mr. Applegate saying that I interpreted the Robert's Rules of Order correctly. So I just want you all to know that, that's why that happened. Commissioner Delory, thank you for indulging me.
No problem, Mr. Chairman, not a problem at all. First of all, it's not easy when you sit up here and you sometimes hear testimony that can be adversarial, and you get caught up in the moment, and sometimes you want to make sure that even if you're not getting caught up in the moment, you want to address something at that moment because it is an issue that is important to you. I've been guilty of it time and time, and it just kind of happens. And I will tell you, not with recently, but there's been times that I've said things that, as I'm saying them, I wish I could have taken the words back.
Nasty in your mouth.
I was like, why are the words coming out? And I know what they're coming out, but I'm trying to put them back in. And it's just very appropriate. But I think it's important for us to have this dialogue, this conversation. The reason why I seconded that motion was very simple. We did have proposed resolution in our book, but I wanted to hear, once that motion was made, I thought about it, I'm like, okay, it seems to be a little bit stricter because it didn't talk about the June 7th, and I wanted people to talk about both of them. They didn't, and that was my whole intent of seconding it.
Thank you for this. Seriously, I think this was good that we brought all this out, and all I'm asking, the one thing that I think Commissioner Hurst said, and I'm asking that everybody try to at least get it, recognized through the chair before they speak. That would be nice. Commissioner Zimbauer.
Just to follow up with that, I think to sum it up, I know I am, and I know the other commissioners are. We wouldn't be here if we weren't passionate about our community, our county, and sometimes that does, cause a little additional emphasis when things are being attacked and things are being said that may be in contrast to, the well-being of our employees and so forth. So I think, like Commissioner Delory says, there's sometimes you open your mouth and you say things, you wish you could take it back. I always try to do my best to think before I speak, but again, I'll recognize the criticism and do my best.
Thank you all.
Chairman?
Commission, yes.
I just want so a couple of words that are sort of absent in building trust, and that is not intended to be criticism. So it's intended to be constructive, forward-moving. There is definitely a void here that was left by the person that sat in my seat before. I am very aware of that. I get told that after every meeting. And quite honestly, she had a style that kept things on track. It would be really easy for me to move into that. I think there's an alternative that might be more productive and less stressful. And so my goal is to get us to be productive and less stressed together and have open dialogue. I also agree that we can be exceptionally passionate about the community, or we wouldn't have literally sucked up what you do to get elected, because that's a pretty horrible experience. And so I get that. That also gives us the opportunity to, instead of inflating a discussion, attempt to deflate and redirect a discussion, because I think that would be helpful for everybody involved. That's all I'm asking.
Understood.
I think we have that opportunity every time we speak. I'll try to remember it with my kids. I'm going to go home and hope they're not watching.
And I think all of you know that and I've said this to you from the beginning, my intent was to give everybody equal opportunity to speak as much as they wish, and to change the culture that they felt that there was no gotchas in anything that we're doing. And so I hope that I'm meeting that expectation that I have set for myself. Commissioner DeLore.
Thank you. Two quick items. One, I did meet with a resident this past week about the PACE program that the state offers through cities and counties. And at first, because we talked about this a couple of years ago, that the county wasn't really interested in it. And from what I learned, some things have changed, and I just wanted to pass this out because they gave it to me. That's one for the clerk as well. I'd like to have staff at the appropriate time, and there's no timetable to this, to kind of review it to see if it's something that we should be looking at in the future. I think it's important that if there's a way to help residents do improvements to their homes, I just want to make sure that we vet it out correctly. And again, I'm not looking, Nicole, I'm not looking for this to be on the front burner, but somewhere that we can actually discuss it at the appropriate time.
And Commissioner, if you don't mind me saying so, because I know this program, there's a lot of positives to it. The one thing that needs to be done, and because I brought it up to the previous tax collector, is that the tax collector's got to be on board with this. And our previous tax collector didn't want anything to do with it.
Well, I understand that, Mr. Chairman, but also
so maybe the new one.
One of the things that I was informed about it was that there's an actual vetting process of the contractors, which I was not aware of.
Yes, yes.
And I just wanted to make sure if this is a tool that we could use, the citizens can use, I just want to make sure that we're giving our citizens every opportunity to take advantage of these types of programs. Thank you, Mr. Chairman. The other thing I'd like to ask you, since you sit on the Wekiva River Basin, both you and Mr. McHugh, I'm hearing that one of our counties to the west, Lake County, is doing some either mining or borrow pits that could affect the Wekiva River Basin, and I just want to make sure that at the appropriate time you'd give us an update.
If you would like, the Wekiva Basin Commission asked me to send a letter to the governor, the DOT, the St. Johns River Water Management District, and the Department of Agriculture concerning the borrow pits, the illegal borrow pits that were in Lake County. I mentioned that to you a number of months ago. We were successful in stopping the one. Unfortunately, another one was not in the Wekiva area, and that one is still going on. I have heard since from our friend at the DOT that He was concerned, and so were some others, about some borrow pits that were being done in Seminole County also, but there are some borrow pits in Lake County that the Lake County Commission is right now, that was in the Wekiva area, that they want to stop, but now there's talk of other illegal, and they're looking at that right now. And I have been talking to Commissioner Parks of Lake County to ensure that they are making the appropriate action.
Can you copy us on those correspondence, if you wouldn't mind?
Sure, I think I do have the letter, but I can get it for you, yes.
I'd like to
That was
read
the
up
letter
on-
to the governor, which, by the way, the DOT, St. John's, and Agriculture all responded, and they were able to stop that one almost immediately.
Because my concern is the Wekiva Basin as a whole.
Yes.
Because that affects us.
Yes, no question about it, and that's why we took action. So I'm happy. The latest ones, I will tell you, we haven't got a rain on yet, but we don't know if they're in the Wekiva Basin or not. I have not gotten confirmation on that. And I know that the Lake County is working on that, but I appreciate
Thank
your
you, Mr.
concern.
Chairman. End of my report and my
Appreciate
questions.
Thank you. I just have a couple things. Number one, on April 30th, we have the Seminole County Prayer Breakfast in Altamont Hilton, and that's very appropriate. Also, for the first time in a long time, the Orlando Economic Partnership Board will be meeting both live and virtual on May 5th at the Orlando Science Center. So I don't know the actual hybrid yet, but they did make that comment. Also, we all know, so keep in mind, that the staff is going to be presenting and coming back with the plan presentation and findings on the retreat on the 6th, and that's from 9 to 12, is that not correct?
Yes, sir.
And is that going to be here?
Here. Yes,
Okay,
in the
here. Okay. I also, Commissioner Herr, went on the Midway tour, actually got captured by Mr. Green in his car, and 2.5 hours later, we were still driving around. I think I saw the same street 12 times, but honestly, it was a great tour. And immediately, I have a number of questions, which I've already started to talk to the county manager about, too. That is my report for both sides. I don't really have much of anything. I do want to tell you that there was a gentleman here by the name of Anthony Rizzo that was very patient. He was sitting over there, wanted to speak on, he was the one that originally had the concern over on Bear Lake about the natural fencing that was going into the lake, that we've already had conversation with, and probably why Rebecca's still here, but he did leave, Rebecca. He said he'll just postpone it and come in again, but I assured him, and hopefully after talking with me numerous times, talking with with Sarah numerous times, talking with Rebecca numerous times, he does understand that we are working on that. I'm not going to tell you, the right or wrong of this from the standpoint of neighbors. This is a neighborhood dispute, but the policy of putting natural fencing into the lake is something that we should address, and we are addressing. So I just wanted to make that aware, that I told him that I would let everyone know that that he was here. Yes, ma'am.
At the risk of getting the answer to this question, what is considered natural fencing?
Well, I think that's what we're allowing the staff to do. But this was the
Same
one where the
question.
bamboo.
Oh, bamboo.
Remember when the bamboo was being built into the lake and continued to go out to the
Okay.
lake? And basically,
Got
it's neighbor to neighbor.
Got it.
And I don't want to get into too much of it, but both neighbors think that the other neighbor has some sort of sway on me. Where both of them have called me and said, the other guy has said that you're close personal friends, and and this has been going on between these neighbors for a number of years. And I don't want to get in the neighborhood dispute, but I do think policy, we have kind of identified a policy that should be looked at, and that's what we're doing. Is there anything else? Anybody else? Anything for the good of the order? All right. Meeting is adjourned.